Good evening, everybody. I'm going to call this meeting of the Gloucester Public Schools to order. I'll remind everybody that the mission of Gloucester Public Schools is for all students to be successful, engaged, lifelong learners. And I'll ask you to join me in the salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This meeting is recorded by video and audio in accordance with the state open meeting law, consistent with the governor's orders suspending certain provisions of the open meeting law and banning gatherings of more than 25 people. This meeting will be conducted by remote participation. If you're calling in on a phone, you can press *9 to request to speak. If you're watching on a computer or device, there is a raise hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. Maria, could we have a roll call, a vote for attendance?
Mayor Taken. I don't see her yet. Ms. Watson.
Here.
Ms. Wiesen.
Here.
Kathy Clancy.
Present.
Mr. Favazza.
Present.
Chairman Pope.
Here.
And Ms. Prince.
Here. Jonathan, you're muted.
Tonight we have a lot of work in front of us. We've got to make a number of very important decisions tonight. We are joined tonight by the entire administration of the school department, as well as the DPW director, Mike Hale, and the Gloucester's public health agent, Karen Carroll, and they're here to answer questions from the committee. As far as oral communications go tonight, we will not be entertaining questions about the reopening. We've had a very extensive public input meeting on Monday night. In addition to that, we've received around 75 emails concerning the reopening plans. And I know that the committee has many, many questions that they need to feel comfortable about asking before we make these important decisions tonight. So with that being said, the first item of business is oral communications. If there's anybody here that would like to address the school committee on subject not relating to the reopening plan, we will be recognized. And we have two people. Cynthia Carney is.
Jonathan, can you just leave the open meeting law language so that we're in compliance?
Okay, I will do that. Wait a minute, Cynthia.
Sorry, I meant to tell you earlier, but I couldn't. I didn't want to interrupt.
I can do that. Okay. Oral communications. The public shall have the opportunity at every regular school committee meeting to be heard under oral communications. Oral communication shall allow any resident who has a request or complaint of any nature relative to the school committee business to appear before the school committee, state their problem without debate, and the matter may be referred to the proper subcommittee. For items that are on the agenda, members of the public may address the committee with the permission of the chair. Persons speaking under oral communication shall be limited to 3 minutes each and shall submit a copy of their prepared communication to the recording secretary. The school committee chair shall not allow complaints as to the individual performance or character. Okay, with that being said,
Well, that was really awesome, but I meant the open meeting law language.
what?
I'm sorry, the open meeting law language that we're required to read at the beginning of every meeting, telling them we're being recorded on Zoom.
I did read that.
Oh, you did?
Melissa.
Oh, God, I still need sleep. I know, I apologize.
So before we start, I just want to ask the indulgence of the 263 people that are out there. I don't know anybody that's you can see on this panel that's been getting good night's sleep. So that being said, Cynthia, if, like I say, if you have an issue not related to the reopening of the school, go right ahead.
I'd like to start by saying I can totally relate to not getting sleep. I don't have a question, Jonathan, but I do have something I would like to say about the reopening. And what I'd like to request is that you indulge people in this scenario because it would show support for the community, that you're listening to us, that it means something. I know you had the Monday forum, but this is a very, very important vote. And I think final statements from the community should be warranted during this meeting.
Cynthia, we were available all of Monday night. We've received plenty of, we've had people have had every opportunity to send us information, and we're not going to open it up because we've got a lot of questions ourselves, and tonight's the night that we have to make a decision. Cynthia Machowski, and I'm going to reiterate, we're not going to be talking, we're not going to allow discussion about the reopening at this point.
Thank you for listening, for taking my, oh my gosh, I haven't gotten much sleep either. But anyhow, no, I'm not going to reiterate anything about tonight. I just wanted to say thank you for your work, your consideration, the listening. I also wanted to be able to address, you said 263 people. If we had this many people, or even half as many people at regular school meetings, pre-pandemic, we would have probably had a lot more different funding situations. And I would like to see these people chiming in after tonight's meeting to be attentive, because the way is, if you don't put your voice in, you have no reason to complain. And it's really hard when you're speaking up by yourself or just looking like the one or two people. Jonathan, I laughed out loud when you said to reiterate, because I was like, oh, does he know like that I talk that much? But anyhow, no, and I appreciate the good humor and stuff, but I'm just, it's more to address all the people that are out there listening. Show up more often. And even when we stop doing the Zoom calls, which hopefully will be sooner than later, that you show up at the buildings, because it makes a difference when you show that you care about our schools. All right, so thank you so much. I really hope this is a quick night, an easy night, and thank you again.
Thank you, Cynthia. It's interesting. I guess it was just yesterday. There was a discussion with the commissioner as well as with MASC board and the MASS, and this subject did come up about how the attendance at meetings because of Zoom has increased for across the board. Many school committee members were saying that, you know, in the past, if they got 10 or 20 people at a school committee meeting, that it was a lot of people. And right now, we're getting on an average of over 200. Right now, we're at 340 as I look at the chart. So we would love to be sitting in person. We have tried that with the negotiations with the teachers. I'm losing track of time. Was it yesterday or Tuesday? We don't have the technology to be able to do a combination of a public meeting and a meeting where people are present. We will probably refer that to BNF later on tonight to look into what the purchase of the equipment to facilitate being able to do that will cost, and whether it's the will of the committee to spend those resources for that purpose. But I do have to say now, I'm very thrilled about the attendance that we have had in these last meetings and the participation of people across the community to get involved in what's going on. So I echo your sentiments that I hope it keeps up as we go forward. So the next item on the agenda is executive session for the purpose of discussing negotiations. But as we met with the GTA recently, and I would just like to say that they agreed that we would be negotiating in public, and therefore we do not have to go into executive session to update the committee. Laura?
Well, there were other hands up. I don't know if you saw that.
Oh, okay, well, they come in late, and do we want to allow these people? All right, once again, I would just like to say we're not going to allow discussion about the reopening of the school's plans. Joan Kleiss, is it? We can't hear you. You don't have you're muted.
Hi, I am a veteran teacher. This is my last year before retiring, and I was just wondering if there is any provisions offered for people who are over 60 that are worried about contracting the COVID virus.
The question was, is there positions available for, excuse me, I didn't catch all of that.
I was wondering if there were some kind of provisions that are going to be given to over 60 veteran teachers who are a little bit nervous about going back into physically teaching.
Okay.
I have a brother-in-law right now that's dying of COVID, and it concerns me.
I understand. We will discuss that at length tonight. Okay. That will be one of the provisions of one of the new, one of the plans to go forward.
Thank you so
much. Matthew Lewis.
Hi, everyone. Can you hear me?
Yes.
Great. Just a quick question. At the end of Monday's meeting, there was an email address given out to send questions to you. And I had a number of people that texted me asking for it. I don't have it. Would it be possible for you just to repeat that email address?
Yes, it is. I believe it is, and correct me if I'm wrong, Grant, but it is school committee at Gloucester, no, Joel?
It's Gloucester School Committee at gloucesterschools.com.
Simple enough. Thank you, guys.
Got that? Okay. Beth.
Hello, can you hear me?
Yes.
Thank you very much. I actually had a question for the Director Carroll. Since I was at the meeting where you presented the information about COVID to the community, and I did a public records research, and I wanted to know if you could confirm that this is still the case, that the highest rate of infection in the city is between age 50 and 59 followed by 60 to 69, followed by 30 to 39 years of age. So I'm curious if you could just confirm if that's still the case.
Karen,
I
if you
think
want
it
to
should have
address
had
that.
a supervisor. Yeah, sorry.
Do you want me to answer? Is it okay to answer?
Yeah, we will get to this. We will get to this during the presentation. That's why we are trying very hard not to get into the weeds before we get the presentation, because the committee has very similar questions. So we're going to proceed. I'm going to close the oral communications part of this meeting. Our next item is recognitions. Are there any recognitions? Laura.
Thank you, Jonathan. So I had a few, and now I'm echoing what others have said, but first I wanted to thank all the community members who have attended forums, who've come to our meetings, who've written to us, who've just listened but been present. It's really been gratifying, and I think a silver lining of this pandemic is how much participation we've had, and I want to thank every single person who's taken the time to listen and participate. It's really important. I also wanted to thank the teachers and the administrators and the community stakeholders who have been working so hard on these plans to think creatively, to figure out how best to deliver education and keep our children safe and support families. So I wanted to thank them. And I lastly wanted to say just to the wider Gloucester community that we all have a role in keeping our children and our families safe. And so every time you go outside with a mask and you're sure that it's over your nose and you social distance and you don't gather in large groups, you're helping us keep our children safe and our families safe, and we thank you.
Any other recognitions? I would like to recognize Mike Hale and the entire crew at DPW. They have been working extensively in our buildings. We did go to Veterans today to view what classrooms would look like set up for different options, and the place was immaculate. I could see myself in the floor. Not a pretty sight, but it is what it is, and they've done a fabulous job on doing all the research that that they've had to do to try to figure out the best options to make the buildings a safer environment as they possibly can be. And I know that they are part of the non-sleeping class that we now all belong to. And I'd also like to thank the Gloucester Health Department and Karen Carroll for all the support they've given to us and all the information that they have disseminated to the community. And I'd like to just say that, you know, it's trite at this point, but we are all in this together. As Laura said, the only way we're going to make anything work and move forward is everybody puts in the best effort to do the best they can, not just for themselves, but for the entire community. Okay. So we will move on to the consent agenda. Do we have a motion to approve the consent agenda, or are there any items on the consent agenda that people would like to remove for further discussion?
I move that we approve the consent agenda.
Okay.
Second.
Okay. Maria, roll call vote.
Mayor Taken,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
Kathy Clancy,
Yes.
Mr. Favazza,
Yes.
Chairman Pope,
Yes.
and Ms. Prince.
Yes.
Okay, thank you very much. It passes unanimously. Our next order of business is a discussion and presentations about the reopening of the reopening plans that we will be voting on tonight. Joel, you had something?
Yeah, through the chair, I'd be curious to know if the will of the committee would be to take the smaller items out of order so that the administrative things get taken care of before we dive into the feature presentation of tonight's meeting.
You mean so we're not discussing a policy that needs to be reviewed at 11 o'clock tonight?
Right.
Without objection from the committee, I would entertain that. Okay. Hopefully we can do this relatively quickly. And so the first business item is the Gloucester School Committee Ad Hoc Communication Subcommittee meeting report. And Laura, would you like to report out on that meeting?
Sure. So on August 6th, the committee met again to work on creating a fact sheet related to the new building project. And we actually decided that further work on that would have to wait both until we were past this major vote tonight and until we have a meeting with the City Council, which my understanding is will be in September, when we will have more details on some of the things we may want to include on the fact sheet. So we've tabled working on that fact sheet until that time, and that was it.
Okay. The next order of business is the first reading of the Department of Education amended Title IX regulations, which need to go in effect by August 14th. These are mandated by the state. These are essentially harassment policies and such. So Ben, are you going to take the lead on this?
I'll ask Greg Bach to summarize it for the committee, including the changes that the federal government the changes we have had to make because of changes at the federal government level.
Sure, I'd be happy to. And is my audio okay?
If you can speak louder, Greg, or get closer to the mic, or
yell,
that might be better.
How's that?
A little bit better.
Oh boy, I'm about 2 inches from the microphone. I'll keep trying. Just to summarize the most significant changes to this policy is that there is a change to the investigative process, and no longer is there a single investigator. Excuse me one moment, please. Sorry, my dog has just started growling because somebody drove up. Apologize. The definitions have remained largely the same, but I think if I could draw your attention to the due process protections, those are substantially defined and somewhat different. You'll notice that in the due process, the prohibition of using a single investigator model instead of requiring a decision, make a decision maker separate from the Title IX coordinator or investigator. This is a substantial change for school districts where an investigation will be conducted by a designee, typically at the school level, and in many cases the decision maker might be substantially involved in the investigation. And in this, very, very clearly prescribed process, and we'll have all kinds of guidance that on this to follow. It takes an entire team to investigate cases, and the decision maker cannot be part of that investigation team. They have to be independent from the investigation. And so we've, the entire administrative team engaged in substantial training already, and we'll be getting more, but we will be creating a pretty wide team with lots of training to be able to handle any cases that may come up. There will be, as I mentioned, there will be very clear prescriptive guidelines for investigation, and also the opportunity to test, number 4, opportunity to test the credibility of parties and witnesses through cross-examination. So that's something that will be detailed in the guidance. That's also a new item. I think that probably hits the most important pieces of that. This is an MASC policy used widely throughout the state and would replace our current file ACAB.
Greg, there's attached, there's a thing that it says that it needs to be, there's a date of August 13th, which is tomorrow, right? Exactly what does that mean? You know, we have to have, I mean, this is, first of all, this is just the first reading.
Yeah.
We cannot, by our own rules, this would be the first reading. We cannot approve this until our next meeting. Melissa?
We can vote to waive the policy that says that we have to approve it on the first reading. We've done that in the past. I've done it on other school committees. The school committee is willing to do it. We can vote not to comply with the policy that says we have to have more than one reading and vote the policy if we feel that's appropriate.
That's
actually waiving.
That's because it's our policy and we can change our policy at any time we want, right? What's the process for that? We need to make a motion to waive the first reading?
Yep, and then see if the committee agrees to do that. And then if they do, then.
Well, would you like to make a motion?
So I make a motion that we move to waive policy, whatever number it is, that states that we have to have more than one reading of a policy that for consideration.
Second.
Okay. It's been moved and seconded. Is there any discussion?
Well, I haven't received it, so I don't expect to vote on it.
Okay.
In the packet.
It is.
I know, but I didn't have a chance. I'm sorry. Let's see. How many Zooms, how many other things? I mean, I scanned through it, but I wanted to actually go through it.
I understand. We're all very, very busy. So it's just a question of whether we want to break the law by not passing it, or want to change our rules so we could at least vote on it. Laura.
Jonathan, just a question. I mean, do we have a choice about this policy? Is this just a pro forma vote? But we don't, I mean, these are obviously, from my perspective, these are very questionable changes. So, but if we don't have a choice about this, then what's the, yes?
Yeah, we have some leeway, as always in policies, but we need a policy that basically says all of the things that are in this policy, I'm afraid, because the federal law has mandated it. Melissa.
So I just wanted to say this, remind everyone, as I'm sure you know, more so the ones that have been here longer, this is an MASC policy. That means it's been written and reviewed by legal departments and most likely adopted by 8% of school districts throughout Massachusetts. But know that if we do decide to waive it and we do approve it, if we see something we don't like, we can always go back and amend it at another date, because we have the ability to change our policies at any time. So if there's a requirement that we have to approve some sort of language, we could do that, and then we could look at it more in depth at a later date and make changes accordingly, if that makes anyone feel comfortable.
Joel?
Yeah, when this first came up, I received communications from the administration seeing if we wanted to throw this on a program subcommittee, as typically you would. And, you know, I kind of suggested it come straight to committee because it is this mandatory compliance with federal law issue. And although there's wordsmithing, I suppose, you know, that's kind of been done at the MASC level. So I'm comfortable pushing it forward tonight.
Anyone, any further discussion? So the motion is to waive our policy to allow us to waive the first reading of the policy so we can go directly to approval of this policy. Does everybody understand what we're voting on? Could we have a roll call vote, Maria?
Mayor Taken,
No.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
Kathy Clancy,
Yes.
Mr. Favazza,
Yes.
Chairman Pope,
Yes.
and Ms. Prince.
Yes.
It passes 6-1. So now we'll entertain a motion to approve policy, it has a name, right? Policy file ACBA for approval. A motion?
So moved.
Second.
Okay. Discussion on the policy. Melissa?
I just want to state again, I'm really comfortable doing this only because it's MASC's policy, which is 90% of our policy handbook that we currently have, knowing that it's been vetted by legal departments and other departments that would be needed to weigh in. So I feel comfortable doing it because it's MASC. If it was a different situation, I may not feel that this was appropriate. So I'm going to vote in favor.
Any further discussion? Kathy?
Yeah, I just want to second what Melissa said. We've had the opportunity to interact with the lawyers from MASC in the past, and they really are very thorough in everything they put forward. So I'm very comfortable.
Laura?
So I just want to say this, from my perspective, has nothing to do with the lawyers at MASC. They're taking federal policy as required and writing it legally. The question is, the changes in the federal policy may or may not be, you know, I trust MASC, I may not trust the federal policy.
Okay. I'll just reiterate what Melissa said, that if on further investigation, people feel there's something in this policy that they'd like to bring up again, that's always an option. So if there's no further discussion, Maria.
Well, my hand's up, so I don't know why
sorry.
you don't keep noticing it, but I'm going to say my piece. First of all, I represent the whole city, and I don't care who you trust and do not trust. I saw bits and pieces. They change policies all the time on us. Just because someone else is doing it doesn't mean we're doing it. We're voting on something tonight, the same thing that people are following policy. So because I represent the city, and I couldn't really have my legal department look at all the policies, all the different changes from the federal government and what can change, I don't feel that I could vote because I represent the city side on the school side. You are all experts at what you're doing, et cetera, et cetera. I've only been here 5 years and I still saw a lot of changes, amendments that we've had done all along. So I don't feel comfortable. So thank you.
Okay, I'm sorry. I had the attendees up and I didn't see your hand, Safa. So just for the record, we're now hitting 405 people in attendance of this meeting. So are there any further discussion? So we are voting on to approve policy ACBA as presented. Roll call vote, Maria.
Mayor Taken,
No.
Ms. Watson,
Yes.
Ms. Weason,
No.
Kathy Clancy,
Yes.
Mr. Favazza,
Yes.
Chairman Pope,
Yes.
and Ms. Prince.
Yes.
Okay, it passes 6-1. Thank you very much. We'll now move on to the next item on the agenda, which is the school calendar. We have to approve the school calendar because of the DESE has allowed 10 days, given us 10 days. We only have to have 170 days of in-class instruction this year, so we have to adjust the calendar. Ben or Greg, are you gonna just run through this?
I'll ask Mr. Bach to summarize for you, please.
Thank you.
Yeah, can you give me one moment while I get to the calendar in the packet? Okay. Just to summarize briefly, and this has been reviewed by the school committee and also by the GTA has reviewed this as well. The calendar, by moving the student days to begin on August 31st, gets in 10 days prior to September 16th, which is our mandatory return to school from DESE. We removed the Labor Day, which was in error, the day before Labor Day. The contract makes it very clear that if when Labor Day falls, such as it does this year, the Friday before is off. So we did fix that. We removed the September Professional Development Day that had been scheduled for the 22nd, which would have been after in the second week of school after the 16th. That was removed. That was a elementary specific professional day. Along those same lines, the elementary portion of the October 6th professional day has been shifted to May 11th to provide more time to best utilize that. There are no other substantial changes except for the return of November 3rd professional day has traditionally been election day, has been a professional day for, a professional development day. And that was restored to that date. Before we knew that we had 10 days, we had moved it sort of late in the year. We knew that we might need that time, so we moved it to the front of the year, but returned it once we had 10 days. So that has been restored to that date. We also removed an additional elementary professional development day that fell in January, trying to disrupt the learning as little as possible by removing those. And the other more significant change is that what had been the last student day had been Tuesday, June 15th. Because of the shift at the beginning of the year by one day, that moved to June 14th as the last student day, barring any snow days. That's a really quick summary of the changes. Any questions? I'd be happy to take them.
Questions? Not seeing any. Do we have a motion to approve the school calendar for the 2020-2021 school year?
So moved.
Somebody, second?
Okay. All right, is there any discussion? Okay, seeing none, I will call for a roll call vote. Maria?
Mayor Taken?
Yes.
Ms. Watson?
Yes.
Ms. Weason?
Yes.
Kathy Clancy?
Yes.
Mr. Favazza?
Yes.
Chairman Pope?
Yes.
And Ms. Prince?
Yes.
It carries unanimously. We'll move on to the next item on the agenda, which is the, where are we? Okay, is the Massachusetts School Building Authority project update. Very little is happening. As we've said, we're waiting to go before the board at MAS, Massachusetts School Building Authority, and that is scheduled for, I believe, August 23rd. We have, are in the process of, we had a meeting with MASB, and they had some questions. We've been responding to the questions, and everything's moving forward. The Article 97 disposition has passed the legislature and has been signed into law by the governor. We will try to, so the next item on the school, on the city council's docket will be to vote to transfer the property to the school department. As well as somewhere down the road, we will have to, we are going to try to have a joint school committee, building committee, school committee. I got some sleep last night too. School committee, city council meeting to discuss the project. So, and as I said earlier, I'd like to refer to building and finance. The investigation as to the costs of procuring the equipment that would be necessary and recommended by the IT department to facilitate having so the hybrid in-person and Zoom public meetings without objection. Is there anything else we need to take up before we go into the presentation? Okay, we're going to start our presentation on the reopening plans. This is, there are a lot of people here that have been working very, very hard to come up with these plans as well as to provide the information. And I just want to remind everybody that these people are working hard. They're working for us. Everybody here has the interest of the school children in mind and the safety of the community. And we need to be respectful and accepting of people's expertise. So with that being said, I'm going to hand it over to Ben to get it started. Later on, we'll be taking a number of votes. We have to submit 3 different plans for each grade level. One fully remote, one hybrid, and one fully inclusionary. And those will, some of those, there are only one option. Of course, fully remote, there's only one option. But we need those for the pre-K, we need them for elementary, we need them for the middle school and for the high school. And then we have to vote our preference. So there's a lot of votes to be taken tonight. So without further ado, I'll hand the mic over to the main attraction, Mr. Lummis.
Thank you, Chairman Pope. Good evening, everyone. Thanks for being here. Thank you to so many community members who are out tonight to hear this important presentation and update, but also hear the school committee deliberation. I'm going to start with a short statement, trying to just capture a lot of the work we've been doing and summarizing sort of where myself and I think our staff are coming from. We all care deeply about our students and their health, safety, and education. We know schooling is more than what students learn from books. Being in school with our educators creates a strong foundation around which Gloucester grows. Our students find their interests, invest in themselves, and discover who they can be when they're in school. In our public schools, our children and young adults create lifelong friendships that grow for decades, lifetimes, and even generations. We also see how being in school helps our families function and makes it possible for hospitals, social service agencies, businesses, and nonprofits to work every day. Our schools provide social and emotional engagement, food support, medical care, and mental health support. In many ways, the structure of being in school shapes the lives and health of our students. Without the learning, engagement, relationships, and services provided in our schools, students can be adrift. They can suffer socially and emotionally, and they can fall behind. Because our schools play such an essential role in the health and well-being of our community, we are committed in this very difficult time to work together with our teachers, our schools' leaders, families, and community partners to find the best way to get our students back to school. We are in this together and must all work together. I understand that many people are fearful and worried about what the weeks and months ahead may bring. This is very real. And yet we know that here in Gloucester, we are safe now. Presently, COVID-19 is barely present in our community. By abiding by the health and safety guidelines, Gloucester's residents have done a remarkable job containing the spread of this virus. Community transmission in Gloucester is essentially non-existent. As we plan for the safe return of as many students as possible to support our children and young adults, we will remain vigilant. We will continue to look closely at the health data to guide us. between now and the beginning of school and throughout the entire year, we will pay close attention to the expert guidance of Gloucester's Department of Health and the state's Public Health Department. Regardless of the decisions tonight, we will continue to prepare for alternative approaches so we can pull back if community transmission begins. As we move forward together, we will adjust to make sure that we keep our children, staff, and families safe, and so our students can learn in the most effective ways, stay connected to their teachers and peers, and thrive in a very difficult time. So now I'd like to begin with our presentation. The aim tonight is to inform the community and the committee on a number of areas that people have asked about, and also summarize the plans that we have shared already. I'm going to pull up a presentation. There we go. I'll begin and then hand it over to Karen Carroll from the Department of Public Health, and then also Mike Hale from the Department of Public Works. So again, just to remind folks, our primary objective is a safe return of as many students as possible to in-person school settings, so we can support their learning, their growth, their needs, and also support the community. We have some guiding beliefs and principles for planning as we've been working. And so one is the academic, social, emotional, and mental health needs of our students are best served when they are in our schools with our teachers and staff, as I've already said. Our decisions need to be based in facts, science, and data. In particular, we need to make decisions based on the situation in Gloucester, our surrounding communities in Massachusetts. While we'll strengthen remote learning, nothing can fully replace the in-person instruction that happens in our schools with our teachers every day. Oops, sorry. The health, safety, and education of Gloucester's children and the health and safety of families and staff is our top priority. And while we are aiming to minimize risk and ensure the safety of our students, we will weigh risk and safety across multiple dimensions. I'd like to show you just something in terms of a balanced view of risk. It's easy these days to really focus on the risk of COVID-19, but by solely focusing on the risk of COVID-19, we miss or perhaps neglect to pay attention to the many other risks our children face in our community in this day and age. There's of course the loss of learning. Some folks have spoke to me recently about if we lose another third or quarter or semester or even perhaps the full year to remote learning, what will happen to students and what will happen to the dropout rate and how many students will we leave behind and fall behind in a way that it'll be hard to ever catch up. There's a social emotional impact we witnessed in the spring and through to today. Kids want to be connected to adults. They want to be connected to their peers. There's also food insecurity, which we address, but can't do fully if our kids aren't in school. Loss of parental employment, lack of access to essential services on many levels, and of course, also reduced detection of child abuse and neglect as well in our community as it is in others. So as we're thinking about returning to school, we understand that being in school actually positively affects all these areas and supports our families, our students in so many ways. So it's important that we look at a wide variety of risks when making our decisions tonight and moving forward. Just another word about the guidance we're using again from the Department of Elementary and Secondary Education, from local state public officials, from other local departments. It's essential that we are basing our choices, our information, our decisions on what's happening here in Gloucester and based on the information that is happening in Gloucester and around us. So Karen Carroll asked to join us in a second. I just want to share with her and make sure she's available, but also everyone is, about some key areas, about the key health and safety measures that she can speak more to, about mask and face coverings being one of the essential pieces of health and safety during COVID-19. Physical distancing, we'll talk a lot tonight about 3 feet minimum, which is allowed when doing these other health and safety measures. And then 6 feet or more as well when their kids aren't masked or outdoors is fine. Hand washing and hand hygiene, and then of course staying home when sick. So those in combination together, using those wisely, supporting our students and learning how to do them, helping them support each other and doing them well, is what will keep us safe in our buildings. I mentioned and will continue to mention community transmission. Karen Carroll will tell us more about this, but essentially it's one of the key indicators of how we're doing in Gloucester and as opposed to how other places are doing. And we will watch this closely as it develops and keep a careful eye on it. And then very new, just yesterday, and again, Ms. Carroll will tell us more about this, is the rating or the average daily new case rate that the governor released yesterday. And you'll see here white cases, meaning fewer than 5 reported cases each day, green, greater than 4 cases, yellow, 4 to 8 cases, I think I'm getting this right, and then red, greater than 8 cases, new cases per day per 100,000 residents. You'll also see that in terms of white and green, we are surrounded. Not only is Gloucester in the green ranking right now, but we're surrounded, whether it's Rockport, Essex, Manchester, Ipswich, Danvers, Topsfield, we are surrounded by green and white communities. And this is where many of our staff members and colleagues come from as well. These communities are all doing quite well based on the state's benchmarks. This is what folks have asked when they ask for state benchmarks, and then the Department of Education has then also overlaid on top of that what they are recommending and what their expectation is for the learning model, depending on where your community is in terms of the shading and really the cases per new cases per 100,000 residents. As you can see, with green and white or unshaded, we're looking at what the DESE is recommending. Okay, this is just these are the benchmarks folks have asked from the state. The superintendents have asked, school members have asked, community members have asked, and they just released these yesterday. So in terms of the green, if your average daily new cases are less than 4 or fewer than 5 total cases over 14 days, and Karen Carroll will explain more about this than I can fully. The Department of Education recommending full-time in person or with extenuating circumstances a hybrid model. Okay, in the yellow, they're recommending a hybrid model or remote if they're extenuating circumstances. And if it's a red community, they're suggesting remote. So that's just some new information we've gotten recently from the Department of Education and the governor. And now I will go on. Karen, if you can update us, I will stop the presentation. Thank you, Karen, for joining us tonight and for also being a great partner, always being there when I call you or text you at strange hours or repeatedly. I appreciate your collegiality and all your support you're giving our whole team. So welcome tonight.
You're welcome. Thanks, Ben. And thanks to the school committee for having me back again. And I hope I can answer some of the questions that were raised. So I went through all of the questions and concerns that I received and heard from some of all your questions, but I grouped them into some categories, and I thought I'd give you a little overview, and hopefully that will address a lot of the questions. And then if you have more specific, we can go back in. And if I freeze up, I have a little bit unstable internet connection. It comes right back on in a minute, so just take a pause and I should be back. So just 4 quick areas I want to talk about: the current status of COVID in Gloucester. The second thing is testing, the current status of testing, and then future hopes there. The third thing is case tracing, just a little overview of how it works and how it is likely to work in the school community. And then 4, some general recommendations. So Ben covered a lot. You did a great job. You've been a quick study with all this public health stuff, and I will try to go through it in a way that's clear and concise. So in terms of the current status in Gloucester, we have 5 active cases at the moment, and we've been sitting right around that mark for a week or so. We've had very low numbers all summer. And we have, I believe, 1 person hospitalized and no deaths beyond the 26th for a couple of weeks now. So that's all very good. We look at these numbers in conjunction with a whole bunch of other information. And I don't want to bore you with that tonight, but I encourage you all to spend some time with the mass.gov website and look for the COVID dashboard. Once you find the dashboard, in the updated data section, there are several reports, and some are updated daily and some are weekly. The weekly ones are updated by town, and they are amazingly specific. You can see age distribution of cases, deaths, test rate, test numbers. You can see a whole lot of information in there by town, which is really helpful, and as well as statewide. It also gives you information on long-term care facilities, so you can really get a handle and see what's going on in your community. The other thing that we are looking at in conjunction with the school community and our Board of Health to really hone in on early detection is the measuring of wastewater. So we started that last week. We had our first official sampling by our DPW over at our wastewater treatment plant. And it's a 24-hour sampling that proportionally time sends that sample in, allows us to see how much virus is in the wastewater from fecal matters from the community. So it's really our only tool for seeing the full community-wide level. And it also allows us to see any trends that might be coming as well, excuse me. So we're excited about this. We had our first report. It came back earlier this week with no detection, which means there were less than 3,600 copies of the virus. And so for those of you who are not scientists like myself, you translate that to roughly 5 to 6 people in a population of 30,000. It's not an exact conversion, but that's roughly what you would estimate. So at the level of 5 to 6 people, which is kind of what we have right now, roughly with active cases, you will see transmission in the wastewater. Once we rise above that, you know, as we go, it will into your baseline. So at this point, our first week showed no detection, which is also a very good thing, because the wastewater is also sampling, is sampling and showing asymptomatic people as well. So one of the big problems with testing, and there are a few, and I'm going to come back to that, but one of the real limitations is that we're not testing everyone. We're not even testing most people. So typically the people that get tested are a very small cohort in the community who've either have symptoms or have been in close contact with someone with symptoms. Occasionally there's some travelers and work-related testing going on. But generally speaking, we're not doing any kind of mass testing of asymptomatic individuals in our communities. So we don't see the community-wide picture until you do something like the wastewater testing. So again, the other benefit of that, and then I'll stop about wastewater, is that it allows us some very early detection. So the peak viral shed in the feces of COVID-19 happens about 4 to 6 days before a person develops symptoms, on average. So it means that we are seeing the virus very early in the progression, very early in individuals getting sick. So in terms of one person, not useful, but if you're seeing it as a community, it can be really helpful to know very early on if there is a rise in community transmission. So moving along to some of the other indicators, just to clarify the new map that was released, that's taking a 14-day average of your new PCR positive cases only. So it's not including probable. So that's why it might look a little different than the number we report, which includes probable. And it's taking an average of all our new cases, can you hear me? Yep, over 14 days. So that's why those numbers are very, very low. And we're sitting particularly low in that green category. But I just wanted to be clear about what we're looking at because the actual title in the graph isn't super clear. This map can also be found on mass.gov and they will update it, I think weekly, but maybe daily, I'm not sure. One of the other percentage of people who are positive, who are testing positive. So as we test more people, as we increase our testing, we want to watch that percent positive rate. And at the moment, the state is sitting around 1.7, 1.9. It jumped up a little a week or two ago. It's come back down. So it's sitting well below 2%, or right around the 2%, which is significantly lower than where we saw it statewide in the spring. Gloucester's test rate, which also can be found on this website right now, is 1.07% positive. So it's a very low percentage of people getting tested are showing, are coming out positive on the PCR test. So the other ways that we monitor locally, and I know some of you in this panel and some of you on the call, including our mayor, are involved in weekly calls that were bi-weekly initially at the beginning of the outbreak, to check in with other community leaders and with the hospital and with our emergency management folks, as well as our ambulances and EMTs. Because we can get a lot of information about what is happening in the community by looking at our 911 calls, by talking with our colleagues in the emergency rooms locally to see what they're seeing. They often see things before we do, because again, we have to wait until a person gets sick, has a doctor or someone order a test, gets that test, gets the result back from the test, and then we can begin tracing those cases. So that whole process can take a while, and it can be really variable. And one of the main variables is how quickly someone goes to seek a test when they're not feeling well. And given some of the symptoms of COVID, obviously some of them can be quite subjective or mild, confusing. They may appear like other diseases. So that can also be part of the delay in that whole chain, but there's a lot of steps in there, and I just wanted people to understand those steps roughly. So all of these data points together that we are constantly monitoring and talking about as of today, right now, Gloucester would be considered low community transmission. You talked about the DESI indicators that have come out. We're getting more and more indicators from the state. Today there was talk of a composite indicator being put out because new cases alone don't tell you the full story. So there's a lot of pieces of information, and no one graph is going to tell you what's happening in your community. And no data alone is going to tell you the full story. So we also learn a lot from our contact tracers. These are the nurses that are working with the health department to reach out to people who are index cases, and we learn a lot about what's going on in the community from talking with them and interviewing them. So a number of sources of data in there that help create the full picture for us. And at this point, just a note about our capacity to trace, we are tracing all of our confirmed positive cases. We reach out to immediately, usually within 12 to 24 hours at the latest, at the longest. We have a 7-day-a-week contact tracing team that they meet every morning, roll call, and discuss any situations, any potential clusters, and assign cases. They also will reach out and see if the patient needs anything, the family needs anything. So at this point, we have plenty of capacity for tracing, and we also have the ability to ask for help from the state tracing team. They will pick up any cases that we can't, or we don't have time, or if we get a bunch of sick calls, they are there for us, and we do utilize them periodically, and we did in the spring as well. They are public health professionals, public health students and professors, epidemiologists, and some retired clinicians who do this work for a state, essentially a bank of people at the state level who will contact trace for any community that needs assistance. At the moment, our healthcare capacity is fine as well. Our hospitals are operating normally, doing elective procedures, and are not in. Just a note on that, one of the big things that we will be pushing this fall is the message of flu vaccination. because the flu inundates our healthcare system on, a normal winter and fall. We want to be really careful to not inundate our healthcare system any more than we have to, should we have the second wave of COVID. So the flu vaccine is extremely important. It's also going to be more challenging this year to set up clinics given the social distancing requirements. So we're working with our partners in the community and the schools, public-private partnerships to make sure that that's a priority. The second thing I want to talk about briefly is testing, because I did get a lot of questions about testing. There's sort of a mixed bag there. I just want to highlight the main gold standard is the PCR test, which is not the antigen test, so it's a little bit different. And it's looking at the molecular structure. It usually comes back, they told us yesterday, within the state of Massachusetts, 75% of Massachusetts COVID PCR tests are coming back within 3 days. So that's a pretty good turnaround time, unless you're one of the 25% that get sent out of state. So again, I briefly explained that process from symptom identification. So that's based on humans and the communication with their PCP, the time it takes them to contact their PCP if they have one, and then what we do if they don't, once they have the test, and then getting the result. So that whole process can take several days at best, and usually is more like a week to 2 weeks. The closest testing site, routine testing site, is in Danvers Leahy Outpatient, and we have some in Beverly as well. Large pharmacies at this point do not have any plans that we're aware of for testing here on Cape Ann. We have had discussions with them, and we are looking to partner with them in various ways. But at this point, there are no Minute Clinic pharmacies that have the capacity to expand to COVID testing, and there is no private pharmacy that we're aware of or other provider that is moving into this space on Cape Ann. Our hospitals obviously have on-site testing, but that is not open to public or, the sort of mass testing need of the community. Insurance at this point pays for testing for anyone who is symptomatic or is defined as a close contact of someone who's symptomatic, or a close contact, of an index case, which means they are positive. So if you've been defined as a close contact, someone who's confirmed positive by the labs, you will be allowed to get tested and encouraged to, and it will be funded by your insurance. Some insurances will test for other conditions like travel or asymptomatic individuals, but it's not the norm. And I think that's the main points I wanted to just kind of talk about with testing. Except for the antigen test, I just want people to be really clear. The antigen test is a different test, and it's often referred to as the rapid one because it comes back in 15 minutes while you're waiting there. It's a useful tool, but it's not accurate enough yet to be accepted alone. So we do not encourage people to get the antigen tests. They often are asked to pay out of pocket. If they're traveling or doing things where they want this quick, rapid result, you really need the PCR test. So just to be clear on that, it's a source of a lot of confusion for folks. There are rapid PCR tests available. There are a couple of machines that do this. We do not have one in this area that I'm aware of, and I'm not aware of any plans of anywhere on the North Shore or in this immediate area that is purchasing one of those. There is a wait time for those. That would obviously be really helpful. There are some talks about saliva tests that could be self-administered in the home, and that would be fabulous. They would be cheap and would certainly be helpful to all of us. We don't have those around here that I'm aware of at this point. So in terms, the other option we have is for communities where there is high transmission. So sometimes, anyway, where there's high transmission, the governor's office has set up these stop the spread sites. And basically they're free testing, no questions asked. Anyone can go in, you don't need insurance. And they're encouraging mass testing in those sites. Now that would be great if they did that everywhere, but they can't. So they've prioritized communities at higher risk, of which we are not at this point. You still can go to a Stop the Spread site. And again, all this testing information is on mass.gov. The other thing that we have been told by some of the labs is that we can expect to see increased delays, at least in the short term, until some wider infrastructure gets up and running to improve test capacity. In the light of colleges coming back and other states actually requesting the assistance of some of the labs in Massachusetts, it has caused some delays. But there are also a number of infrastructure things happening with these labs to improve capacity. So I can't tell you what the net result is going to be. I'm hopeful that we'll have more testing, more options, and quick turnaround. The third thing I was going to talk about is just case tracing in general. So if people, there were a lot of questions about this, so I just want people to understand when you have the PCR test, your doctor or your primary care orders it. The lab result goes through to the Department of Public Health, the state lab. It's an online database, and it's not new to COVID. It's maybe new to a lot of people because they hadn't heard of it before, never really needed to, but public health departments have been using this system for communicable diseases for a very long time. Anytime there is a communicable disease in your town, it gets reported through to your local public health nurse and Board of Health department, who does case investigation or follow-up. So any foodborne, those types of things. This is a function that local boards of health have always done and had to do, but as you can see with COVID, we hit capacity really quickly. Instead of 1 or 2 foodborne illnesses or a TB case or some Lyme, we were hit with a lot of people infected with COVID at once. That's when the state put together its tracing team to help support us in those functions. Once the result is in Maven and a record is created, we can see it instantly. I get an email every time there is. So that's again another indicator of what is happening. We can quickly see by the pace of emails coming in that there is a new case to report or a change. Our public health nurses, as I said, and they work most of the day, and any of them will work well beyond knockoff time to make sure that a case has been handled or handed off and a situation is under control. So the public health nurse will contact the positive case, the person who's been confirmed to have COVID-19. We call them an index case. They'll ask them they'll work with them to assess who their close contacts are. And I think this is important for decisions about school settings. A close contact would need to go home, be tested, be quarantined. But in order to be a close contact, you must be with up to 2 days before they were sick. And you
Karen,
must be.
I have to interrupt you. The most important part, you keep breaking up and people can't hear. So I know it's being recorded, but like you'll have to repeat that last 5 minutes, please. Especially when it comes to screening and the people who are next to you and et cetera, because no one really could get that. And that's very crucial.
Okay, thank you, Mayor. And
Karen, if it helps to know you, the last thing I know I heard you say was close contact to home, tested, quarantine, and then I didn't hear anything after that.
Okay. Close contacts are defined as people, well, you got me?
Karen, maybe it might be better. Do you think if you can call in? We don't need to see you.
Okay, we're back. So I'll start that again. Close contacts are defined as people who are within 6 feet of the infected person or the index case for 10 minutes or more. So you really have to be close for a while to be determined a close contact. So if you're passing someone in the bathroom, you know, just briefly, if you're standing in a classroom at a distance for a short period of time, that would not be deemed a close contact. Now, the guidance is a little different for classrooms, elementary classrooms, where there's a cohort of people in a room all day long. That would constitute close contacts. But other settings, an employee setting, in office, a close contact, again, 10 or more minutes for closer than 6 feet. Our team will also work with employers and school systems, districts, to make sure that we've identified all of the contacts, the close contacts, and advise on protocols for cleaning and what to do for disinfecting. And then we will go about the process of contacting all of those close contacts and helping them get their testing and their test results. Everybody hear that? Okay. And then if they are deemed to be a close contact, they will be asked to quarantine for 14 days. Or at this point, DESE is allowing them to get a positive test. Now, I just want to, before we spend too much time discussing that, DESE and DPH are in discussions right now about the discrepancy between the 14-day quarantine or shorter. So at this point, the DESE guidelines are a little different than what public health has been doing up until now, but we're exploring it, and I anticipate they'll probably get on the same page. If they don't, we'll have a discussion at our Board of Health here in Gloucester. And so finally, just in terms of recommendations, the Board of Health follows the position of the Department of Public Health, the statewide Department of Public Health, which generally follows the guidance from the CDC. So at this point, DPH is saying that it is okay to plan to return to school. One of the reasons that we look to DPH and we look to the state for guidance, and we typically do follow their guidance as a board and as a health department, is that they have a lot more capacity to comb through data. They have teams of epidemiologists and researchers and clinicians who can write this guidance and review the latest data that's available. And as those of you know who've been grappling with this for a while, the studies are coming out fast and furious. The guidance changes. It has since day one. This is a new disease, and it will continue to. There's a lot we don't know, and there's a lot of research that's in flux. So they have capacity to really deal with that better than we do, synthesize it, and make recommendations. Having said all that, you can never have zero risk for anything. And I just want to highlight that there absolutely are risks to kids not being in school, or being purposeful in their days. And maybe our definition of school and learning will have to change. I have 2 sons who will be home, so I am grappling with it as a parent and as a public health professional. I think that these will be the struggles. You know, I think Ben highlighted the main sort of externalities and risks associated here of youth not being engaged in a purposeful activity during the day and a schedule with adults. There was a study I did find from the International Labor Organization that talked about kids who had their work and their study disrupted were twice as likely to be affected by mental health issues, anxiety, depression. Again, it's one study, but it was referenced in WHO's work, and I think they looked at a number of other countries, not just in the United States. Again, the dropout rate is another thing for disengaged learners. This could translate to struggle re-engaging them, which translates to dropout, which translates to all kinds of health effects lifelong. And we know that. We know that you can sort of predict what happens to people economically and therefore with their health. So that's a real concern for learners who may disengage. And, I think that no one calculus is going to be the same for every child and every family. And public health is often about that, weighing up the risks. But we can't just look at the COVID risk in a vacuum. We have to look at the full picture. And as I said, the calculus is going on, in my house, in your house, in all of these homes. And I think the more we can offer families and kids choice, the better off we'll be. I think that's important. I think it's really important to keep talking to the kids. I think we professionals think we know what they need and want. They don't always know what they need and want, but they can certainly give us some really good information. And it's really important we engage them, whatever this thing looks like in the next 6 months to a year in our communities. It's important we engage these kids. And then finally, to be patient, as someone mentioned in the beginning. This is a really emotional thing, and it's really challenging, and none of us have been asked to do this before. Operate with the limited information and sort of best guess and hunches. And so again, we have to rely on what we know as of now, and be patient to each other in the decisions we make. And I'd like to reiterate, whatever decisions we make, that we put these kids first and foremost in our community. And it does take the whole community. If we want our schools to be open at any point until there's a widespread vaccine, we need to all really, really be careful what we do. I think one of the members alluded to that earlier, and I absolutely agree that it's going to take the whole community prioritizing the schools and supporting you all, and finding a way to do this safely. So I think that's probably more than enough for me, but I'm happy to take questions.
Laura.
So I have a few, but should I start with one or two and then let it go around? Jonathan?
Sure. We will come back if you still have questions.
Okay. So one, let's think, which one do I want to ask first? You said that the information included on the chart does not include probable cases, but that's something that's included in the local data. Is that right?
Mm-hmm.
So
that is.
Go ahead.
That is correct as of today. Now, and I have not seen any sort of definition behind this map. I think they got it out yesterday and we're excited. And it's one more tool in all of our toolbox. But we haven't sort of seen the fine print behind what it is. And we had to reach out through the mayor to get clarification that it was talking about new cases. And I did get an email back after a second email saying it's talking about just confirmed PCR. Now, generally speaking, we wait till we get things in writing from DPH to say this is the official word, because it really is very fluid at that level as well. But yes, you are correct.
So based on that, my understanding is there's more cases than that. Right? There are the confirmed cases and there are probable cases.
The number for Gloucester is 5, and that includes our probable, which is only 1. But on the map, yes, if they've only done PCR positives, you're not seeing the antigen positives. However, we don't have a lot of confidence in the antigen positives. And one of the reasons is they're seeing big discrepancies between how the sample was taken, probably. They don't really know. So the antigen.
Thank you. No, and this is a process question that may not be resolved yet, but how then, if you see a trend, right? So this is also an over time thing. If you see this going up in the next 4 weeks, say before school would start, how do you inform the school district, and how are decisions made based on that?
We talk every day to everyone. We have a team, my Board of Health and my chairman, we talk literally every day, sometimes multiple times a day, the mayor's office, the hospital. Right now, it's been quiet. The summer's been pretty good. It's been mostly about planning for, the next phase. But in the spring, it's a constant communication, and there is a citywide call that has representation from all sectors of the community. The homeless shelter, and certainly the schools have been on it and will continue to be on it. And we're constantly sharing information, and more than that, we're sharing solutions. We're saying, hey, I'm out of PPE, or I need this, or where can we relocate our homeless shelter for a few months? And that's how problems get solved often. So in terms of other communication, we have graphs, we have daily reports that come out that Ben would get, as well as the states.
It's just also, I think in the last week and a half, the only days Karen and I have not been in contact were last Thursday and last Saturday. Okay, so we're in regular contact, and then as she's telling me, I'm informing you, and I would make a recommendation then to the committee. The committee would again make the decision, but that's really how it would go. But we're in regular contact, and yeah, it's just there's a lot of communication on it.
Thank you. I'll let someone else go, and I'll come back.
Melissa?
I just have two really quick questions because I know Laura and Sam had a lot of questions tonight that covered a lot of my concerns. So just based on what you said, you talked about getting up the testing. Is a child who has a pediatrician in Gloucester, if there is a concern if they're in class and that they need to be tested, can they go to their pediatrician to get tested there, or do they have to go to Beverly and Danvers? Because there's a concern about, people who can't get a ride or can't get to Danvers or Beverly, how effective is that testing? Or can they go to Addison Gilbert or their pediatrician and get a test?
They can, it depends on their pediatrician. Health center can do the test on site. I don't know all the pediatricians, but most of them send their patients to the Danvers site or one of the Beverly urgent care sites. So it depends. You cannot go to Addison Gilbert. That's for inpatients, and that's for their community only. So that's not really an option. Was there more to your question?
No, I just had another question. So my second question has to do with tracking. So if we do get back into the classrooms and we're relying on our nurses heavily to deal with all the issues of COVID, do our nurses have to be trained in contact tracing, or is it the Board of Health responsibility to do all that and you don't require or need the assistance of the nurse other than maybe to ask a couple questions?
That is correct. And at this point, many of the contact tracers for Gloucester are your school nurses, and they will go back to that role, and we've been replacing them. So,
So I think you went out a little bit, or I did, because I'm in a bad place too. Did you say our nurses don't have to be trained because the Board of Health has those resources? And
that is correct. I know I cut out. Sorry. Yeah, the Board of Health, we will continue to do the contact tracing. Yes.
Thank you so much.
But Karen, can you let them know that they also had to get trained before they could even do tracers? Please let them know about the process that they had to, so they have that contact, they can get into the system. Can you explain that to them, please?
Yes, that's right, Mayor. She's bringing back all the early days of this when they have to actually do an online training with in real time with an epidemiologist from the state on the MAVEN system, as well as the COVID, which continually change. So they are on calls with the MAVEN staff twice a week is a requirement. We require all of our contact tracers to be on the call, or if they really can't, they can get the information, but most of them are, because it's constantly changing. So yeah, they have had to learn a tremendous, and they also provide a lot of information on resources in the communities to families who are being affected by COVID. And they have been a part of that with many of our families who have been affected, connecting them to food, to mental health, to medicine, to thermometers. We deliver things. We have a system set up where we provide things as needed. But yes, it's a training and it's a process, even just getting registered on the Maven system.
Samantha?
Thank you, Karen. You answered most of my questions in your presentation, so I appreciate that. But you just sort of briefly spoke to sort of the infrastructure that exists for people who do test positive. So I guess I'm wondering, we're seeing that certain populations are being disproportionately impacted by coming down with COVID. So can you just say that again? What are some of the resources that are out there for those families that might not have job protection if they do test positive? What do we have for an infrastructure for those families?
In terms of our contact tracing, we would be talking with them. We would be finding out what their needs are, and we would be hitching them up with other agencies. We obviously partner with Open Door. They provide food. They deliver it to anyone who's been asked to isolate or quarantine by our team. We deliver thermometers if we have them, some face coverings, wipes. And then our nurses work with them. I mean, one of the things that came out to the mayor's office and myself early on was with some of our older members of the community. And when we had people pass away from COVID, it's a very, very sad type of situation where families were not able to be with loved ones in those last days. And that stuff you saw on the TV, that was real. And it was really, really heart-wrenching. So, and not able to have funerals or gatherings to celebrate the life of someone who got very sick or died. So one of our nurses asked through the mayor and I if we would support a grief counselor, and some way that the mayor's office would reach out just with a check-in or a note. So they are very in tune with their clients. They speak to cases every day they don't necessarily talk every day, but they get pretty connected to these families and they know the needs, and they're working and doing whatever they can to help them through a challenging time.
I have one more question. Could you just speak to what resources the health department has to assist with mental health issues that our students are facing? What are some of the grant opportunities? Is there additional funding? I'm just trying to think, regardless of what option we choose, we're going to need additional support. The community is going to need a lot of help. So.
Absolutely. We have a prevention team who is working on all kinds of initiatives with the school team. We have a youth group that's been very active. They're doing a mask campaign that will be out soon. They've designed the campaign and they've drawn, they drew all of the pictures. They're of youth wearing masks. So we have a number of things going on with youth to help engage them, positive youth development. We're partnering with our police community impact team to support the work they're doing with the SROs. We have a task force with Ben's team and mine that work together pretty regularly. We have a number of grants currently that we've been allowed to redeploy as needed. And I think the main thing we did that we're excited about and will continue to promote is a role. We were able to find a grant. One of our funders who has always supported our work, they pivoted with us when we asked, and they funded what's called a navigator role. And basically it's if anyone is looking for a therapist or mental health support, You can call this person, Lauren, and she will work through with you who might be a good fit. She speaks with these people before she refers you, so you're not calling 10 therapists to never hear back, which has been the experience of many people in our community everywhere with mental health. So this has also been a priority of the mayor's and of mine since day one. We've been partnering with the state, we've had listening sessions, but it's really important that we continue to address the mental health aspect here as much as we can and provide as many options and supports for students as we can.
Can you just say what that person's name, the navigator's name is, her full name, just so that the 450?
Sure. I don't actually know her last name. It's just Lauren on the flyer. I will make sure you have it. She works for Children's Friends and Family, which is another great partner locally for mental health support. And she, you know, you just reach out to Lauren and she'll find out what insurance type you have, if any, and what you're sort of looking for. And she'll help connect you confidentially to a provider who might be a good fit. And if it's not, she'll help you find someone else. So we really are promoting that and trying to make sure everybody knows about it that needs to. Because I think that, you know, we all know the challenges that this has presented for adults as well as youth around your mental health anxiety during this time.
Yeah, and people become extremely discouraged when they don't get phone calls back or there's 6-month waiting list. So it's great that somebody can help navigate that with them.
Yeah.
Kathy?
Quick question, Karen. Are we, how many communities are testing their water like we are? I'm just curious what, you know, where the idea or where the science came from, and, you know, nothing technical, but.
Yep. It's being done in 42 states. I don't know the exact number. It's hundreds of communities, including Boston, several in Massachusetts. The company is BioBot that we have a contract with, and they are out of MIT, and they're partnering with MIT, a kind of spin-off organization. And yeah, they compare, you know, our report that comes in, which I'm happy to share. We'll probably put it up on our website somewhere. It compares us to other communities nationwide. So it helps you put it in some kind of perspective.
Okay, Laura?
Thanks. So just on the wastewater question, I may be wrong about this, but my understanding is that not all of Gloucester's wastewater goes through the same plant, right? So, so this water that's being tested isn't for all of Gloucester. It's for whatever water goes into this one wastewater plant.
That's correct. It's for anyone who's on the city sewer. It's as well as it includes Essex as well. Those people who are on the sewer system. There's a lot of people that have their own private systems, and they would not be counted in this.
Right. Okay. Second, I have two more. Second, on masks, and I know you responded to my question via the written questions. But it is my understanding that new research came out that not all masks are equal and some are not helpful. Some face coverings are not helpful. And I'm just wondering, as we think about the schools, how we want to create regulations around what's an appropriate face covering for everyone. And I'd love to hear what you thought about that.
Yeah, this question went to the head epi at the state.
You broke up. Okay, you're back.
Any face covering is better than no face covering, and that was her answer. Again, I imagine this is one of those areas that the science will change. We've learned a lot about the kinds of material, the level of thickness that's recommended, that is better at, you know, protect. Again, I think her answer was any face covering is better than no face covering if you're talking about, you know, compliance with teens or young people. the face coverings that kind of come over your ears, or that at least are a little bit more tightly fitting over your nose and mouth. That's would be the best.
Right. I mean, anyway, I think there may be some new research about some of the polypropylene that are actually not useful, but I'm not the scientist. And my last thing is Beth Goldberg had asked a question about the numbers, and I was just wondering if you could confirm that for, if you could confirm that for her before we leave this.
Did you say, was she the caller earlier on about the 50 age group? Is that the question? Yes. Yeah. Okay. I will come back to that. So just back to the masks, I have heard from some clinicians that when masks get wet, then they're not as effective, and that can be problematic. So, but again, I haven't seen studies. So it's definitely one of those things that's kind of a moving, the research is moving on that one. But we definitely know that the majority of the time, a face covering of at least 1 or 2 layers of there is a significant amount of evidence around face coverings most of the time. So there may be some subtleties there that we don't know about yet. In terms of the data, the age distribution, yes, she talked about the age distribution of people in Gloucester who were tested positive for COVID, and it is almost a perfect bell-shaped curve with our 50 and 60-year-olds sort of right in the middle. But the numbers are so small, it's hard to draw a lot of conclusions from that. But, you see there's roughly 50 in that 50 age category. There were 40-something in the other. So that's people who test positive. If you look at the hospitalization data for both Gloucester as well as statewide, and if you look at the death data, the story is very different. And it's very much leaning towards the people who get very sick and who pass from this are in that older 70 to 80 and 80 to 90 or 90 plus.
Thank you.
Joel?
Thank you. So just a clarification question to the chair. Is this our opportunity to ask questions of Ms. Carroll about everything that's going to be in this presentation, or is she going to hang on in case as Mr. Lemus goes through?
Joe, you're breaking up.
Sorry, I'm actually chugging water. Hold on. What I'm asking is this the only opportunity we're going to have to ask Ms. Carroll questions, or is she going to hang on so in case as Mr. Lemus continues his presentation?
Are we all broken up? I can't see nobody moving. Somebody wave.
Can people hear me?
We can hear you, Merritt. You're probably.
Are the panelists still out there? Or?
Yeah, we're all seeing each other and hearing each other, Safavia.
So the question's to you. If I have questions.
I don't know the answer to that question. Ben, Karen, right?
I think our approach, whether it's Mr. Hale or Karen, is let them go at a certain point tonight and not have them here to the very end.
Okay. So then, just to piggyback off of what Laura had asked, so are the calculations that you're making as far as the percentages of parts per million in the wastewater testing being adjusted for the fact that there is only a percentage of the city of Gloucester that is on, that there aren't 30,000 people flushing their toilets. That system is only, I'm sure Mike Hale might have a closer idea of how many households it is. Is the math being adjusted, I guess, in the question there?
Yes, because what they report to us is just copies of the virus. So we can use that to extrapolate roughly how many people in our community that would be. And we can do that a little more accurately. I think that's a good point. We can find out exactly how many people are on private septic and then do that extrapolation. But it is just a general, the general number that you can go to is that 1 person per 6,000 people is that level of detection. So we did extrapolate it up to 30,000 would be 5. So let's say it's a little less. it's not an exact calculation when you go from the copies of the virus to equate to, because obviously everyone's going to have different amount of virus and shed different amounts at different times. But yes, good point. And we will take out we'll make sure that, you know, we sort of roughly know how much of our city is on the public sewer system. And Mike probably knows that and can answer it in a second, but we can find that out.
So then you mentioned about close contact, and the standard you said was at least 10 minutes, less than 6 feet, that kind of contact, but that the schools, the classrooms where children are spending the amount of proposed time together would also consist of close contact. Is that correct?
Can you repeat the question, Joel?
Sure. Your definition for close contact was 10 minutes or more, 6 feet or less. And that was a close contact exposure. Did I hear you say that the classrooms would qualify as close contact due to the duration of time in which the people are present? I may have misheard you, so I'm asking.
Yes, I did. DESE's guidelines right now are that in classrooms where kids are in the same room all day, probably with windows closed, they're going to ask us to count them all as close contacts. But again, this is some of the guidelines that still is in flux, and it needs to be standardized a bit more with the Department of Public Health. So we're watching that. But at this point, they have said to us that that's likely to be how they would define close contacts in the elementary setting as well.
So a positive case comes back for one student, the classroom and the teacher are both considered to have been in close contact and need to follow the protocol.
Potentially. Yeah, potentially, but I don't think that's even an official, I'm not really sure. I mean, that was kind of one of those DESE guidelines maybe on the calls that they said they're working through to standardize it and make sure we all have it in writing really clearly. Once we start contact tracing at a school level, there'll be a whole bunch of nuances and questions. And again, it will probably change from day 1 to day 20 as we learn how this goes, but yeah.
Okay, so if I see Melissa's hand up, Jonathan, do you want me to pause or do you want me to keep going?
Melissa?
I can wait. I'm only going to ask a question about your question earlier. That's all. So
Okay.
go ahead.
Keep going, Joel.
Good. So, and forgive me, you know, if I have this incorrect. So I run a small office. We're 1,000 square foot office space, and we're told that I'm limited to 8 people in my office at any one time. Everyone has to be 6 feet apart, et cetera, et cetera. Those guidelines, you know, are, for me, every other business operating in the Commonwealth right now, and they're much stricter than the guidelines that are being proposed by DESE. And so I'm in your opinion as the city's leading, you know, health expert, you know, are the restrictions on my office overkill, or, you know, how do we reconcile what I'm being told to do, what I'm being told is safe for adults who can manage mask wearing versus what is safe for children, you know, who may not be as good as my office workers are about being vigilant with social distancing, et cetera?
Yeah, I mean, it's a great question, but basically because you're an adult and it's largely an adult setting, each of the checklists are a little bit different by sector. So it kind of depends to what you're doing in your space, the level of risk. And the schools, the task force that was put together to come up with the DESE guidelines, they recognize that children in school settings are different than adults, and they reviewed the literature that they had available to them. And again, I can't really comment. I mean, they had a lot of pediatricians and experts on that panel that came up with those DESE guidelines, but I can agree with you that they treated the risk to children and the way in which exposure might happen is different. because of the data that they have seen around transmission and how many kids get sick and how far kids spray when they, those sorts of things, all of these experts took into account. And many of the studies that they worked from are cited in the DESI guidelines. So it's quite interesting. It's limited, I agree, but they had a lot more experts on the subject than I am that formed that panel to make the DESI guidelines.
Thank you. To follow that, you mentioned tonight and you've mentioned previously that, Gloucester from a statistics standpoint is in really good shape. Our rate of transmission is very low. Our rate of active cases is very low. And it sounds like that's, one of the driving factors as to why you're receiving, guidance that says it's probably safe to get back into the schools. But, I want to push on that and I don't know the answer, and maybe you don't either, but right now, are there any other facilities or businesses in Gloucester where hundreds of human beings are indoors together for 4 to 6 hours, less than 6 feet apart? Maybe Annis and Gilbert, I suppose, but I don't even know. They might be 6 feet apart in there. Is there any other, are we doing what we're about to do in these schools anywhere else in the city? And if we're not, then how do we know that our good numbers are going to remain good once we start doing this different thing? Again, maybe variance back to full staff. I don't really know. But do you know if there's any other buildings where you have hundreds of humans less than 6 feet apart, for 4 to 6 hours a day in Gloucester?
Maybe some of our large facilities, our hospital, our healthcare environments, our long-term care facilities, they don't have our housing authorities. I mean, we have large numbers of people in all of those settings, and we don't have widespread transmission. I mean, hospitals have done actually quite well in their employees not getting COVID at rates lower than anywhere, and that's because they're trained in PPE. So they're really know how to don and doff that PPE so that they don't have an infection. So, to answer your question, most of our businesses have reopened. And again, depending on what type of business they are, they all have a checklist. So if you're a wedding venue, you've got a checklist. If you're a beach, you've got a checklist. And they all have different amounts and caps and rules. Certainly outdoors, we've seen, but
are any of those businesses allowed to have people less than 6 feet apart? My understanding is that a 6 foot guy like that, this would be the first industry where less than 6 feet is acceptable.
Other than healthcare, that's probably correct. I'm just trying to flip through all the checklists in my head right now. But daycares, I mean, there are some industries where that's not going to be possible. Medical, daycares, things like childcare. Why? I don't know exactly what their checklist would look like. Nursing homes, long-term care. But yeah, I would say most of the business separation between adults. And again, the calculus was made and the recommendations from the state were made differently because of their children and the science that at the time they were working with behind that drew them to those conclusions.
Yeah. And so I guess, my last question that I think I have, because you were very helpful in answering the written questions, and just a thought for the board, it might make sense for us to distribute or somehow make available the questions we had submitted. They're all public documents and we can go request them, but we might want to be proactive in putting them out there so that the community can see what we asked in writing and received prior to this meeting to avoid making this meeting 6 hours long. So that being said, because you've been, I'm looking at just for your opinion as our local health expert. would you feel safe working in our school buildings under the protocols and procedures that have been put forward under a hybrid model? If you were to go in and work in one of these buildings, would you feel safe doing that, and would you go and do it willingly?
Would I personally feel safe? Is that the question?
Yeah, would you feel safe working in one of these buildings?
Yeah, given the community transmission is close to non-existent right now, yeah, I totally would. But I can't answer that for other people.
No. It's just one of those things. It's important for people to hear that, you know.
Yeah. And, you know, we don't know what the next week's going to hold. I can tell you based on the spring, people react very cautiously as the numbers start to go up, and you know, there'll be a lot more discussion, a lot more, as Ben said earlier, a lot more monitoring really closely, and that would be a different calculus. But right now, there's very, very little transmission in Gloucester, and so yes, I would.
So I guess I'm sorry. I know I said my last question, but she said something very interesting. And again, I really appreciate you being so forthright. I think it's important, you know, for the community to hear that our experts, you know, have this confidence. And so, it sounds like your justification or your lead reasoning for why you would feel safe, you know, working in one of these buildings is based on the current numbers and current transmission levels, and not necessarily, you know, whether there's people are 3 or 6 feet apart. You seem to be more couching it on no one's really sick right now, so whether they're 3 or 6 feet apart, my chances of getting sick from one of them is low. Is that a fair statement?
Yes, I think that's a fair statement to the question you asked and my answer. Right now, I don't really need to pause because I feel that level is so low. So you're not asking what if there's so many transmitters or asymptomatic carriers in the room. I'm going to make some assumptions that there isn't many. And you know, that's the thing that gets really complicated as the amount of virus in the community goes up. That's where the calculus is going to get really hard. And I think that's where it's important that parents and students have choice, and they can decide and weigh up the full risks and benefits to their child.
Thank you very much.
And it's also where we would look to the state, who has a lot of experts diving into this at a lot greater level than we do.
Okay. Thank you. Melissa?
Very quickly, because I know we have other people that need to speak tonight. They've been waiting hours. So Karen, you mentioned something real quick when we were talking about the sewer testing. You're saying that all of Essex is considered in our testing? The 5,000 or 6,000 people that live in Essex?
I believe it's everyone on the town system in Essex, but Mike can answer that better.
So
it's whoever's coming, whatever wastewater is coming to our main wastewater station.
Yep. And then finally, my question is, we have daycares open right now, and we have Camp Cinder open right now with young children wearing masks, not wearing masks, interacting indoors and outdoors for long periods of time all day. Has there been any need to do any contact tracing or COVID response at Camp Spindrift or any of the daycares in Gloucester?
I do not believe so off the top of my head, but I don't do it every day. I can check for you. I don't believe we've had, as I said, we've had very few cases this summer in general. So since the daycares and those camps have been open and running, I'm not aware of any, no.
Thank you.
Samantha?
Just to piggyback on the daycare, child care question. And Karen, I know that you responded that you didn't know about the question that I'm going to ask, but I think it's worth putting out there just so that the committee and the community sort of has an understanding. Because I recently learned that child care center data is not made public. So when somebody tests positive, that data is not necessarily being made public. And so there's early educator advocacy groups trying to encourage that data is made public. Do you know if that is 100% accurate, and or does anybody know if that's 100% accurate? And also, if we are assuming, or if you're, I heard you say last week that the child care centers are doing well. Is that anecdotal, just from what you're hearing from the child care agencies in Gloucester?
So back to the first part of the question, none of the MAVEN data is public. I just want to be really clear. Part of the training we go through is that this is all HIPAA protected information. So none of it is. We contact people and we say to them, you have been exposed. We don't say where, we don't say by whom. So in terms of the daycare data, if you're referring to positive cases, again, none of that's public information. However, they wherever that child or teacher or janitor resides, if they have a positive test, it will come through to the local Board of Health. There's no getting around that. So if there's a positive test in a legitimate lab in Massachusetts, a licensed lab, it will come through to us. So I don't know other reporting requirements for daycares and who they, what else they might be reporting on, but cases of COVID would come through.
But you do get numbers based on age, though, correct? So you would know, how many positive cases for a certain age group, for, let's say, infant to 6.
Yep. Okay. And we had, it was in the information I sent out, but it was a very low number from the whole 300 and something between the 0 and 19 age group. And I can't code it off the top of my head, but, cases. And statewide, there were no deaths under 19. Was there a second part to your question, Samantha? Data to the state.
Thank you, Karen. I think it's after 9. We still got a long ways to go. Can we move forward, Ben, to Mike Hale?
Yes, I think I appreciate that.
Thank you, Karen, very much. Appreciate it.
Thank you, Karen. I'd like to relieve Karen of her duties and responsibilities here. Is the committee okay with that?
I don't mind staying.
Okay, all right. Sorry, Joel.
Karen, if you can at least stay until after Mike, because I probably might have more questions if Mike says something.
Yeah, I'll stay around.
Thank you.
Yep.
Thank you, everyone. That's helpful. Appreciate that. Mr. Hale, could you join us? I'm going to I'm just going to give a brief summary of what we've been doing with the, how we've been working with DPW, and really DPW has been helping us out. And then Mike will give us a further update. So we're working closely with the Department of Public Works, meeting with them regularly. They're in our buildings all the time. Mike told me that all air filters were changed in the spring. Will be changed again before school starts. They're reviewing HVAC for O'Malley, GHS, and West Parish. Mike will give us details on all of this. They're also reviewing East Gloucester, Vets, Beeman, and Plum Cove to see what can be adjusted in those rooms, including introducing fresh air and also looking at individual room air exchange units. That's the same as I reported to you last week. Mike will give us updates as necessary. And then also improving our work on daily and nightly cleaning. The big piece here is we'll be getting additional cleaning support through an external contract that we're lining up. That seems to be a better way to go all around. We'll have specific protocols for cleaning that's ongoing during the day, and then also after the school day is over. We'll also make sure that teachers and students have very clear guidelines and for how to maintain a clean and healthy environment. That includes between classes. So they'll have materials to clean off desks, wipe desks down. So if say it's a high school or middle school class where a new group of students are coming in, they're also helping out to make the area safe and clean. So just a quick update on that, and then let me close this down. And Mike, please join us.
Thanks, Ben. Good evening, Mr. Chairman. To hit on the question about the wastewater plant first, there were some questions on population that contribute to the wastewater stream. Probably 80% of Gloucester's population runs through our single wastewater treatment plant. So just get that out of the way right now. So I didn't really prepare a presentation, but to go over what we've done so far since the schools are closed in March. We went through a fairly rigorous cleaning of all the schools. We change all filters in their air handlers twice annually. We do it during February break and again during the summer. We changed them in February of 2020, and then we did it again the last week of March 2020, given the fact we just we shut the schools down for a potentially airborne virus. So currently we're going through all of our routine maintenance to our mechanical air systems, replacing filters. We're executing a ductwork cleaning contract that will take care of their air handlers at the intake. We're working with Siemens, who's an industry leader in HVAC, to evaluate our existing equipment, what our buildings are capable of, what we can tweak, how we can bring more air into the schools. Where air exchange is weak, we're looking at options. One of the options would be individual air handlers in each room. We're also looking at an ionization system that would couple with the existing univents in the classrooms. We just purchased, which should be delivered beginning of next week, 500 refillable spray bottles that will come equipped for the schools with these disinfectant tabs that would be placed in the bottles. You fill them with water. You have a safe disinfectant that can be used in the schools efficiently. We have all the common areas in the schools will have sanitation stations, as many as possible. We can continue to add those as necessary. There's some questions on directional signage in the schools. That's something we will work with the building principals on, but we will certainly be adding signage for all schools as we have done for the city buildings thus far this spring. I think it's important to recognize that we have 3 buildings, GHS, O'Malley, and West Parish, that are much different than the 4 small elementary schools as far as their systems go. GHS is equipped with 3 rooftop units and about 100 univents. O'Malley has 7 air handlers, and it's the only building that's fully air conditioned, excuse me, other than West Parish. West Parish has 8 rooftop units, which include heat pumps, AC, it's gas fired, they have energy recovery systems in those. All the elementary schools are based on individual univents in each classroom, and those are dated. They have limited capability of fresh air exchange for sure. And unfortunately, staff knows how to turn those off. Over the years, we've faced this issue repeatedly where the only means of air exchange in these classrooms are the univents. Some are noisier than teachers like, some blow cold air at certain times of year, and some blow warm air at certain times of year. We've battled with keeping those things running because they do provide fresh air exchange. But frequently, they're turned off. We'll have to have some sort of policy to make sure that does not happen, especially if we add an ionization system to those univents. There's been questions regarding the MERV rating of filters, which is the minimum efficiency reporting value on the air filters in all the systems. Most schools have MERV 8, which is a pleated cardboard filter. That's what they were set up to be, and that's what they are. Some of the recommendations through the American Society of Heating, Refrigeration, Air Conditioning Engineers recommends a MERV 13 and potentially a 14 if the equipment can handle it. Some of our equipment can't handle it. We will be burning out motors and univents relatively quickly by adding some of these filters that these systems, just these individual univents, can't handle. West Parish likely is all MERV 13 anyway, as it's a newer school. Some of the air handlers at O'Malley and the rooftop units at GHS can certainly handle MERV 13, potentially MERV 14 filters, and those will be added. Something that's occurred during this pandemic is the availability of materials. We can't get MERV 13 filters right now. They're not available anywhere. Varian's facing the same issue we are right now, one of the largest employers in the city. We've tried every clearinghouse that we have, supply house that we have. They're anywhere from 4 to 8 weeks out, depending on the distributor of these. We'll work with Siemens, see what they can provide us for options on the smaller classrooms and the smaller schools. And we'll also work with them on the larger schools to make sure that the air exchange in these schools is maximized. I think certainly, as listening to this whole discussion from Karen, you know, the behavior, you know, how we manage our behavior in these schools is going to be more important than necessarily the air exchange. Obviously, social distancing, face coverings, and if you're sick, don't show up to school will be a great benefit to the system. Understanding that these systems are big and that if someone's sick next to you, the filters aren't going to help you if someone's sick next to you. I guess that's the long and short of it. The duct cleaning for the fresh air intake is important. We do that every few years. We're doing it right now to make sure that any dust, allergens, pollens are cleaned at the source, not just at the filter, which is changed regularly, but the ductwork, things that may slide past the ductwork. So again, Mr. Chairman, I think it's best if we just go to questions because there's not a significant amount of a presentation that I can offer tonight.
Okay, thank you, Mike. Let's open it up for questions from the committee. Laura?
Thank you, and thank you, Mike, for that. I just have a question about how you're determining the air quality in the 4 smaller schools. What sort of, you know, I can see there's CO2 levels you can look at. There's all sorts of levels you can look at. I'm not an expert, but how are we judging the air quality in those rooms? And then, you know, obviously you're working with different organizations to figure out a way out of it, but you know, how many options do we have, and can the options actually bring us up to a healthy air exchange and air quality in those older buildings?
Certainly, the CO2 measurement is dependent on occupancy, and their rooms are unoccupied right now. I think if you read the guidance, you'll see that. So it's very difficult to measure. I mean, air quality. You know, what does that mean? I think we're talking about air exchange rate. That's what we're trying to manage right now. So it's easy to measure the air exchange rate. And we'll work with Siemens to make sure we have an idea of what that is. Some of the obstacles we face are, you know, what will the plan be for occupancy in these classrooms? Because we can't design around just the square footage or the cubic footage of a room. And that's a mistake to do that. And it's not uncommon to make that mistake. You add bodies to classrooms, you add technology to classrooms, and you know the temperature changes, the humidity changes. A lot of things change. You start adding population to these rooms. It's not just square footage or cubic footage. So understanding what the school committee's plan may be will help us make determinations on what equipment's necessary, what air quality levels will need to be met. There's no question that there are standards out there, and there's a fair amount of documentation that's floating around. You know, the Harvard School of Medicine, Harvard School of Public Health has a publication out for opening schools, and there's nothing tangible as far as what the standards are. They give kind of flow charts, what you should do. If you don't have this, you do that. Again, we're looking at the American Society of Heating, Refrigeration, Air Conditioning Engineers report, which is the best report we have that gives quantifiable levels. And that's what we're going to base it on. And again, once we understand what we're looking at for population, again, this is kind of the chicken or the egg scenario. If you guys want to hear that the buildings are safe, I need to know what the plan is so we can design around that.
Right. And can you explain a little bit what the ionization, is that the sort of sterilization stuff, or can you explain a little bit about what those do? Very limited ability. We don't have this in any school right now.
It's an add-on that comes in 6-inch increments based on the type of room you have. And it basically, it helps. I guess it's a positive ion that's discharged as air comes across the filter coil, which helps disinfect the air. And if it's not running, it doesn't work. And again, the four older elementary schools have limited capacity. Some of the modular units have rooftop units that provide heating and cooling, but the rest of the classrooms are based on the individual univents, which is the small aluminum cabinet in the back of every classroom next to the windows that has, a tapestry on it, books, and the terrarium and the turtle. So again, everything you stack on these things limits the airflow in and out of these. So they need to be free of anything. They're not shelves. This is a mechanical unit in the classroom, so it needs to remain free to work properly.
Well, I'm sure people look at that differently this year, if we're in those rooms. And there's also been a lot of talk about the rooms that the windows don't open. There's been conversation about rooms that the windows do open and you could put box fans, but there's a lot of rooms with windows that don't open. What can be done about those windows, or changing out those panels or whatever?
I think that classrooms that were meant to have operable windows have them, and there are some classrooms or some schools that were never intended to have operable windows. I think if you go to O'Malley, that's a closed system. I mean, that's meant to have the doors closed and the windows closed. And that creates the positive and negative, air pressure within the school to allow the air exchange through the air handlers to work properly. I mean, O'Malley has 7 air handlers. It's meant to work with everything closed. Now, again, you start opening windows, you start opening doors, the calculus changes dramatically. And so that's going to be a difficult exercise for any professional to make, because you're adding variables that can't be accounted for. Is there enough air exchange in this classroom now that we've opened all the doors? And there are other issues. I mean, we've focused for the last number of years keeping doors closed for security. Now we're going to leave them open. I don't know how that functions, and it's not my job. It's certainly up to the school committee to make. Public Works provides maintenance service to the Gloucester Public School System. That's what we do. We provide recommendations. We'll help Superintendent Lemus with his decision making. But certainly understanding that certain classrooms were never intended, or certain schools were never intended to have operable windows, has to be understood. Even in light of the idea of leave windows open. But there is a matrix or flow chart that says when windows don't open, you must do this and that.
Thank you.
Melissa?
Thank you. So Mike, I'm going to tell you a little bit about that, a little bit more. So, because I don't know if I'm getting the right impression. So we have windows that don't open in O'Malley. And you're saying the system is meant to operate and function properly with the windows in the whole building closed, therefore addressing no need for windows on the inside, correct? For the system to work?
Sorry, that's how O'Malley was designed. It was designed with inoperable windows for the most part. And it's meant to operate just like that. That creates the right air pressure in the system for air exchange based on the fact that doors and windows are in fact closed.
So there's proper air exchange with windows closed, and we don't need the windows open necessarily like we may in the elementary schools that just have those, I forget what you call them, not the A handlers, but the units in each room. Univents.
Again, when O'Malley was designed in the early 70s, it didn't necessarily anticipate a pandemic in 2020. So the idea that the recommendation of the experts are to leave windows open for maximum air exchange, you'd have to take a look at the next best thing for that school is, do the air handlers move enough fresh air and not recycle interior air enough? And again, that's a measurement. Most buildings for efficiency purposes, recycle a portion of the interior air and exhaust a proportion of it. You don't take 100% fresh air from the outside during heating season because you just exhausted everything you've warmed up. So these kids will be cold. And there's recommendation to wear jackets when it's cold or sweaters when it's cold, which again, that's gonna be a tough sell for kids that have a hard time sitting still with jackets and sweaters on.
Could you talk a little bit about HEPA filters and air purifiers being in the school? I mean, do we need HEPA filters? Some people I know with allergies might have them in their homes, but is the expectation that having HEPA filters to combat the COVID in the schools, is that necessary? And can you talk about people who want to bring air filters into their room? Or air purifiers, I'm sorry, whatever, the small machines that purify the air.
So the MERV rating on filters, again, that's the minimum efficiency reporting value on filters, ranges from a low number to 20. Typically HEPA is somewhere 17, 18, 19, 20, the higher range of the scale. You wouldn't necessarily, I don't know where you'd ever see a whole building filtered through HEPA filters. These schools were designed for something around a MERV 8. West Parish, newer school, maybe MERV 13. We still haven't reached the HEPA value at 13, and that's a school that was built 4 years ago. HEPA filters are typically used on smaller room settings, a server room, an operating room, a high-tech biotech room, where it's a small volume capacity in a larger building. You wouldn't necessarily see HEPA filters installed on any new school building anywhere in Massachusetts. You might see better than MERV 8, which that's what we have. You may see something 13 or 14 used. And again, some of the equipment can't handle a 13 or 14 without the risk of burning the equipment out. And again, you go back to the guidance, it says, can the equipment handle higher rated filter? Some can, some can't. You're better off with an 8 in a univent that functions than a univent that doesn't work because you put a 13 in it and the motor burnt out. And that's a real possibility in some of these schools that are 50, 60 years old. There's no question about that. So we need to evaluate with an expert. Again, we have one HVAC expert that works for us. He's a tech, and then we outsource everything else. There's no way to have a team of HVAC techs working for Public Works.
And you're bringing these people in now. I mean, it's not like we're working.
They are already in. They have been in for the last 2 weeks, evaluating our system, providing options for us. And Siemens is an industry leader. They are one of the biggest firms out there. They have the availability of equipment to them. One of the biggest constraints we're facing right now is materials. We can't buy anything. Everything is so hard to get these days. It's just the nature of the shutdown of the pandemic from April through August. It's the reality nationwide.
More important than the air filters answer, because I don't want to take up all your time. I know other people might have questions, but something that's been weighing on for me in many conversations over the past couple of days is the fact that Durham Whittier did an assessment of all the buildings years ago when we were looking at assessing the buildings and how to move forward with schools and functionality of schools and things like that, which helped us make our decision on what school to attempt to build next. So there's reports out there that parents and teachers and concerned citizens are Googling and looking up, reading how bad our HVAC systems are and need to be replaced. That is a fact that's out there in the community as recently as I heard tonight. Can you talk a little bit, because I know there's been many, many BNF meetings that I've attended in the past where we've heard about all the incredible, awesome HVAC upgrades that have been done throughout the district over the past years. I remember at one point you even said, you know, people wonder where all the money went because we didn't see it because it was behind the walls and in the ducts for many years, trying to just catch up and fix a lot of the HVAC systems and other systems behind the walls that we don't see when we walk in. Can you talk a little bit about upgrades that have been done over the past, say, 4 or 5 years, so that the public is at ease, that we're not operating on systems that are all going to crash because Durham Whittier seen them bad 6 years ago?
I mean, so the last two reports done by architects for the Gloucester Public School System, they were both very critical of our mechanical systems in our schools. Our schools are aged. We have one new school out of 7. We have invested greatly in O'Malley. We've invested greatly in GHS. And we've invested to a certain degree in these elementary schools that are slated to be scrapped at some point in time. I have no idea when. But we do have deficiencies in some of these smaller elementary schools. There's no question about it. How we manage that during this process will determine how safe these buildings are. Certainly, the four small elementary schools are all, the rooms are conditioned by univents. They exchange air, they heat these rooms. And so if we can't make sure that those are working properly and adding something else supplemental to those, especially during the closed window season, which is sometime in October, there's not much more we can do other than add components to those univents. They are aged, there's no question. Can we add larger filters or higher level filters? Maybe. That'll be determined by the manufacturer. And then you have to add either some sort of, whole room air handler or an ionization system to the existing univents. It'd be one or the other. I'm sorry.
Melissa, he couldn't hear you.
I couldn't hear you, Melissa.
Sorry, so you said adding components to those 4 schools that are lacking because they're just depending on univents. You can tell us and say tonight that between working with Siemens and Mitsubishi and whoever else is coming in, that you're looking to add components and looking for suggestions to support more than just having the univents in those particular elementary schools.
We are, because once it becomes cooler out, the idea of leaving windows and doors open goes out the door. No pun intended. You cannot leave windows and doors open when it becomes cold out. You can't learn, you can't work, you can't teach in that environment. You just cannot do it. So you would need to add some sort of component to make those univent rooms safe.
Thank you. I have one more question, but I'm going to save it for the end.
Joel?
Thanks. So if I understand correctly, Siemens is already in the district analyzing our buildings. And so, for example, will we know prior to September 16th at O'Malley, for example, will we have an answer that says your best air exchange protocol is all windows shut, system on throughout the building, or your best rate of air exchange is actually, windows in classrooms that have opening windows should be open. We'll have that answer, and we'll be able to instruct, staff members as to what the protocol is before people, resume occupying the building.
Yes, Joel, I think I need this answer sooner than later. And I also need to understand what the school department's plan will be for, occupancy in these rooms to make sure that we can adjust for air exchange. And again, we're not looking for efficiency here, meaning we're not looking to save gas or fuel. We're looking to make sure that we can exchange the air the best we can in accordance with some guidance from various professional groups, state agencies, and other groups that have a stake in this whole COVID opening of schools. So we will have some guidance that'll let us provide it to me, provide it to you, that'll give that information.
So based on your knowledge, I'm going to focus on Amelia because I think Amelia is an interesting one in that, you know, I personally struggle with trying to put my own prejudices aside from, you know, the time I spent in the building, you know, decades ago versus what it is today. But based on, you know, your knowledge of the building and the fact that that we've invested in it, but it is, as you say, an HVAC system that was designed by, you know, by engineers in the early 70s, you know, is there a potential that Siemens comes back and says, listen, you know, windows open, windows shut, doors open, doors shut. This building just doesn't move air around like we need it to. You know, you don't have a setting that's going to get this, you know, those interior classrooms, the kind of fresh air exchange that you're looking for in this sort of situation. Is that a potential answer we'll get from this?
I can't speculate on potential answers, but I can say that I believe that the handlers at that school in the last 10 years have been well maintained, and the air exchange is noticeable. You walk through the corridors of that school and you can feel the air draw. You can literally feel it. You can feel it just walking through the first floor, second floor, or third floor. Are there rooms
that have to be analyzed?
Well, all classrooms. I mean, the school has to be analyzed as a whole first, and then you start taking a look at the classrooms and trying to figure, are there any deficiencies in classrooms? And then you move from there. You know, I have come across events in my time managing the school facilities that have air exhaust fans, air exhaust outlets that have been screwed shut because there's a draft that comes through them that whoever was occupying that room didn't like. This is before we took the schools over for maintenance, and someone thought it was a good idea to screw that vent shut. That doesn't work in this scenario. So, you know, we've gone through over the years and tried to eliminate that as much as possible. And the explanation to the staff member in the room is like, you may feel a draft if you're leaning on the univent in January. Move to the other side of the classroom, you will not feel that draft. And that draft's important because that's how this system functions. And they again, it's a little bit old of a system for sure, but that's how they function. If it doesn't function as a whole, it doesn't function at all.
And so I don't know if this question is for Mike or if it's for Ben or for Karen, but, you know, how do we determine, you know, the report comes back on these buildings, what guidelines or what benchmarks are set for us, or are we setting to go, okay, you know, the air being exchanged at O'Malley or the air being exchanged in the older rooms at Plum Cove is adequate. Can you state for people who might be watching, you know, where those benchmarks come from and how we'll be able to decide whether after Mike and his crew get us the data, whether that data says these buildings are able to do what they need to do to move air around.
Joel, I'll try to take a stab at that. I mean, I think there are some industry standards that will indicate that a room full, and again, this isn't new data. I mean, there are other 900 square foot rooms fully occupied in the world that these large vendors have dealt with before, these designers, these specialists. So we take a traditional 900 square foot classroom, which the small elementary schools have, and you anticipate being fully occupied, which likely will not be. But if you anticipate being fully occupied with 20, 25 students, staff member, and maybe a para, what would be the necessary air exchange in that room to satisfy a positive exchange of fresh air? I think that there's some canned data on that we can use. Whether or not it's believed, I don't know, but I do believe there's some canned data that can be used for this.
I guess, and I appreciate that you don't want to speculate and give hypothetical answers. I'm just trying to figure out is the, you know, so that data exists and I'm wondering if I don't want all this work, if the district goes in the direction of opening these buildings up, I don't want the work to be for nothing if it turns out that there's insufficient airflow and there isn't anything we can do about that insufficient airflow. So, you know, based on just on your previous knowledge of the buildings and your knowledge of the industry, do you think that if some of our rooms or buildings come back substandard, there are solutions available both in existence and budgetarily, given our constraints, that we will be able to have those supplementation devices in there before, you know, close window season, as you're calling it?
So I'm being told that at least the ionization systems are 2 to 3 weeks out, which provides us enough time to retrofit the Univent style rooms, which we have, you know, 100 plus Univents at GHS, 50 at O'Malley, none at West, and 100% in the small schools, which is about 80 classrooms. So, you know, you do the math. I think we can make good progress with the right vendor to make these classrooms more equipped to deal with what we're talking about today. It's not taking a look at, you know, individual air exchangers in each classroom. They make them. There's a fair amount of labor to install them. It's not just not like an air conditioning unit. You just plug in a window and walk away. They're duct, they're hung. We have to make sure that there's enough power supply in the school building that can handle X number of units. I mean, again, we're talking 4 old elementary schools with, you know, electrical services that were constructed in the 40s, 50s, and 60s. Do they have the load capacity to carry, you know, 30 new air handlers? Maybe, maybe not. So again, there's other things that need to be taken into consideration. But again, not understanding the population of these classrooms for the initial opening makes it difficult to design around, because it wouldn't make sense to design around a fully occupied room if it won't be fully occupied. Or maybe that's what we do. We just say we're gonna design on a fully occupied room and it'll just be over-designed in the hopes that in the future, you know, this prevents, you know, other issues.
Again, just to, I think it's important people hear this. So Mr. Lemus, obviously the plans that are being recommended to the committee, you know, by school administration are on the presumption that Mike and the DPW are going to, you know, hit these benchmarks. It sounds like Mike has a plan. I assume that goes both ways. If the school committee goes forward and says, hey, we plan to have 20 students in a room, and Mike comes back and says, listen, after dealing with Siemens and looking at this, we can't handle 20 kids in that school, that then obviously changes the recommendation that comes out of the administration at that point.
Karen, I'm going to ask you a question related to this. Karen, from your point of view, is a specific amount of air exchange or a specific amount of, you know, air rating or, you know, that sort of thing, is that for you, you sort of make or break on this? Or is that not necessarily the most important indicators here?
So that's a good question, and it depends, I think, is the answer. If there's not community-wide transmission, I mean, that's the make or break indicator as far as I'm concerned. So low community-wide transmission, again, it's not going to be the most important thing. Kids returning to school, and as community transmission starts to rise, these are all factors that will contribute. What we know about the virus.
We lost you. She'll be back.
Sorry. What we know about transmission, I can see you all freeze, so now I stop. Sorry about that. Is that most of the transmission occurs when an infectious person is actively coughing, sneezing, and exposes someone else, you know, that sort of person-to-person exchange. So most of the transmission does not happen through air. And again, it depends. It depends on how many cycles through. It depends on humidity. It depends on how many people are in that room. All the things Mike just said. So it's not a simple calculation. And I think that DESE has provided us and these other agencies that Mike mentioned that are more technical on the air HVAC systems have provided us with a number of indicators. And again, you can't just sort of take one factor into consideration. But air quality, it's important. But is it more, you know, if you had to sort of rank them, well, community transmission and then active symptomatic people. So are you removing those people from the environment? Because frankly, if you have a sneezing, coughing, infectious person within 6 feet of you, no amount of HVAC or anything is going to protect you from that, even a HEPA filter if you were in a small enough room. So again, it's managing that risk. There isn't a simple answer, but I can tell how transmission normally occurs, and the most, you know, the most transmission happens in the way I just described, indoors. Again, depends how long people are in there. All of those other things will factor in.
Right. So I think that helps me just, you know, frame my answer. So Mr. Favaza, so I think in a lot of this, what's really hard about this for all of us is it would be nice to have some clear-cut, you know, have a clear-cut answer or a clear-cut yes or no, or a clear-cut, you know, checklist that says yes, 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 no, no, no. We don't really have that, and nobody has that, unfortunately. So I really do lean on what Karen Carroll says, which is you have to weigh these variety of factors, which I think you're doing tonight. But we have to weigh those variety of factors as we go forward as well. Okay, so we need to get the information absolutely from Mike and his staff and from Siemens, understand what it means. That may impact your decisions or our decisions. I think it's more likely to say, in this room we need X, in that room we need Y, oh, maybe we need to adjust in this way, that sort of stuff, and adjust those things, as opposed to it's a, you know, that equals shut things down. You know, I think it means that equals this sort of mitigation or that adjustment. Because ultimately, you know, what I heard Karen just say is above that, or above that, anything about the buildings themselves is community transmission and the variety of indicators that go into that. That's not just one number, first of all. And then also, you know, cases in the schools, you know, and then other things come after that. So I think, so that's how I think we should look at it, is from you know, that compilation of information and data.
Okay, Joel, if you have more questions, we can come back to you, but I want to give some other people opportunities. Samantha?
Thanks. I have a question for Mike and then a question for Karen, but I'm going to start with Karen. I think I might have misunderstood what you just said, but I thought you said that COVID doesn't spread through the air, but maybe you meant through ventilation or HVAC. Is that what you meant?
It does spread through the air. It spreads both through water droplets and through airborne particles. So that's another challenge to COVID. Normally our viruses aren't as hardy as that. So it would travel through, you know, an HVAC or whatever system you have. The particles can be airborne. What I meant to say is that the bulk of transmission happens when you're in close contact with a highly infectious, and that could be air or water droplet. But yeah, is that clear?
Yeah, thank you. And then Mike, just so that I'm clear, what I think I hear you saying is that lower occupancy is going to help with air quality and air exchange. Is that sort of the gist?
I think that it's fairly obvious that the less people in the classroom, the less risk you would have.
Right.
No amount of HVAC filtration is going to prevent someone next to you coughing on you, as I think we just heard. If someone's sick next to you, the HEPA filter 100 feet away is not going to protect you. The HEPA filter 10 feet away is not going to protect you. The individual air handle in the room is not going to protect you. So I do believe there's a sense of less population, less design criteria we're working with, the less risk you would have at transmitting person to person. And that doesn't even include, thinking about how good the filters are. Again, the filter room at the other end of the school. I think obviously the less people, less risk.
Mm-hmm. Thank you.
Kathy?
Mike, I just want to highlight how we have our discussions in BNF about the things that are not obvious to the average community member, such as HVAC work that you folks do. And hopefully everybody gets an appreciation for how much effort and money has gone into maintaining the backbones of our buildings that people don't see. So related to that, from a financial perspective, it sounds to me, and correct me if I'm wrong, but when Siemens comes back with recommendations, is there any budgetary issues we need to be considered? Are there budget implications, or is this one of the priorities for your department right now?
It's a tough question, Kathy. I think budget, money drives all of this. Yeah. We're not looking at this as a financial constraint currently. We're looking at this as how do we open these school buildings so that school year can start as normal as possible for the Gloucester school population. If the number is something that we can't wrap our heads around, we need to evaluate that. If we're talking reasonable accommodations can be made within either the operating budget or some of the additional CARES Act funding, that'll all be evaluated by the administration for sure. I'll make my recommendation that it's money well spent. There are things I think that don't make sense just to throw money at, but if we need individual ionization and or individual air handlers per room, that's something we will consider. Everything's on the table right now, but obviously if there's something that we feel is just unreasonable or not a step that makes sense, we'll have to make that recommendation to the administration and obviously the school department.
Thank you very much.
Laura?
So I just wanted to, this is sort of also a Ben question. So yesterday on the commissioner's call, he was clear that if any of our buildings need help to meet the OSHA and the federal and state guidelines, that there would be money for that. He didn't say where that money was coming from, but he said there would be money for that. Do you know anything about that? You're muted.
Sorry. So we have a variety, we'll talk a little bit later today, tonight, and we've shared with you before the various different sources of funding we have because of COVID. There is still some hope that further help would come through the federal government, although they are having some challenges there recently. There's also perhaps some of the COVID relief funds that the city is using that we could also access. We have accessed some of those. We could access more. Talking to John Dunn, we've discussed that. So it's not so I don't know if he was referring to a specific, additional, source, but he's been pretty clear with us all along the way about the various sources, and we're all, all aware. We're very much aware and deciding how to use those dollars. So I will say this, in general, we're not overly concerned about, because there are so many sources and they're quite flexible, we're not overly concerned, with finding dollars for this sort of thing. I'm not saying it won't be a challenge, and there'll be more, needs that arise, but it's not. It's surprisingly not the stressor or limiter that we would normally expect it to be.
Thank you. And can I just ask one more question, which is sort of to compare? sort of to Karen and to Mike, maybe secondarily, but Karen, my understanding is that, you know, as we've come through the months of the pandemic, we've moved away from the sort of touching things as a primary course of, you know, source of transmission to what you just said, airborne and waterborne, right? So, you know, all of the wiping down our groceries may not have been necessary, but the air we breathe matters more. So just as I think about prioritizing the air and the airborne, anything airborne, just wondering, I mean, you know, maybe overnight, like what would be a goal, say overnight, and having, you know, having certain systems running to clear the air before the next day if we are in the buildings? Or, you know, I'm just sort of thinking about, I know we talk a lot about custodial services and disinfecting surfaces, but what are the things, what would it be more effective or equally effective to be focusing on how we clear the air when the buildings, you know, between students, in addition to surfaces and touching?
Yes, and again, the research here is changing really quickly. And, you know, initially we thought the virus could live on surfaces and in the air for a lot longer than we think it can now. But again, it's a moving feast. So I think you are correct in that we're focusing less on surfaces. Again, only if there's, you know, active transmission going on, that's going to promote transmission as we originally thought. And there is a lot of research that if you leave rooms alone for 2 or 3 days, the air droplets will settle and, you know, there's less risk. So a lot of the sector-specific guidelines from the Department of Public Health recommend, like for hotels, I mean, they recommend the room, you know, don't use it, not to use the room for a couple of days. So I think that there is some science behind that idea that it makes sense to, you know, leave a space, but it's usually in conjunction with cleaning.
So to add to that, there is guidance on how frequently air exchange should be done. And certainly, you know, we work on a percentage of fresh air versus recycled air. The model is more fresh air than recycled air. And, you know, having systems run for certain periods of time during the day and after hours. That's easy in some of the schools and a little more difficult in the others. That'll have to be adjusted as we move through this, if we open up as we would traditionally do.
That's great, thank you.
Melissa?
So very quickly, a question for Karen and then finally from Mike. Karen, we've been talking about coughing and sneezing and kids being next to each other if they're allowed to go back in with all these symptoms. I have to believe, well, let me just say, if 2 people have masks on, you know, near each other, 6 feet apart, or maybe passing each other here and there, or dropping a pencil and picking it up, or a teacher walking by, not more than being in that presence for more than a few seconds or up to a minute, with 2 masks on, how high risk is that? Because from everything I've seen and watched and learned, when there's people near each other with 2 masks on, that's really a protective environment. I'm not going to say you can't get COVID that way, but it's supposedly the most protective way to be out and about. So do you think there's more that can be done when 2 people have masks on and they're 6 feet apart to protect from all the air droplets? I don't even know if this question makes sense, but just trying to find out, do you consider that a safe environment, I guess? You know, masks on, because we all know the first sniffle or cough that a kid does, they're going to the nurse's office and then going home, and they're probably likely going to get tested, and it probably could just be the flu, you know, the flu season's coming. So how safe can you really say that it is with the 2 masks on?
Yeah, I mean, that's definitely going to reduce transmission. Two masks is better than one mask there. And it's not to say that if you walk past someone in the supermarket crossing or, you're there for 5 minutes that you can't get infected, but there's a much smaller chance of that. Again, it depends on how actively sick someone is. So sneezing, coughing is spread quickly and project. But if someone is asymptomatic or mildly symptomatic, you really need to be in close contact with them, like I talked about before, for that period of time. And again, that's how the Department of Public Health defines a close contact. So in other words, that's how they define risk. How much risk is it? And they say if you've been hanging out with someone who's confirmed positive for 10 or 15 minutes or more within 6 feet, then you are considered at higher risk for having contracted the virus from that known case. So, that guideline that we use all the time when our contact tracing is based on the best science that DPH has at the moment around the level of risk. Now, we use that's it for the guidelines for defining a close contact. We don't take into consideration, DPH does not ask us to take into consideration, was that 10 or 15 minutes indoors, outdoors, mask, no mask. So, but we know, that it's since been refined that an outdoor is going to be a lot less of a risk of transmission. And so when the contact tracers are talking to the case and their contacts, these are all the kinds of things they're asking. So even though we have that general guideline, it's the nurse considered as contact, and it's all those things, the general guidelines plus a lot of sort of nursing knowledge and conversation about what was going on, how actively infectious, were they in an enclosed space, how enclosed, how many of all those things.
And I just want to ask Mike, because Joel asked Karen this question, so I think it's only fair to ask Mike. You have kids in the Gloucester Public Schools. Do you feel safe sending your children back to school this year if that's the route that we take? Sorry to put you on the spot.
Nope, that's fine. Thank you, Melissa. I have 3 kids at GHS this year. If the schools are open, they will be there in attendance.
Thank you very much.
Joel?
Thank you. Just to piggyback on a conversation Melissa and Karen were just having. So Karen, one of again, my understandings of how transmission works and how severely one reacts to getting COVID is in part based on the viral load they receive. And they think that's why first responders and people working in hospitals were getting so much sicker than other people, because if I walk by you in the supermarket and you sneeze on me and I take in a certain viral load, I'm likely to get COVID, but there's only so much of the virus in my body at the time before it's just replicating, versus if you're sick and I spend all day with you, I'm going to take in more viral particles and potentially get a worse case of COVID. Is that your understanding of how transmission works also, or no? Again, there's so many competing studies out there I'd like to hear from.
Yeah, I think the first part was correct. Threshold, a number of particles that you need to take in through your eyes, nose, mouth, in order to get sick with COVID, in order to contract COVID. I don't think that the severity of the illness is correlated to the amount of virus you were initially exposed to, but I could be wrong there. I've not seen that or heard that. There's a lot we don't know about who is affected more seriously than other people. in terms of once they contract the virus. And there is some thinking now that some of us have an immunity, some of us have some sort of previous immunity from exposure to COVID or another COVID-like. But again, this is very new, and we really don't know why some people and others.
So it's your understanding there's a threshold to use, fake units. If the threshold is 10 units of virus to get you sick, once you cross 10 units, whether you took in 15 or whether you took in 100 units, once you've crossed that 10 unit threshold, you're getting sick. And the severity of the sickness is then based on that myriad of conditions about pre-existing conditions, your personal health, maybe your blood type, et cetera, et cetera.
Okay, I'm going to qualify my answer. Definitely, it's based on the myriad of conditions and, your own factors. One of the factors may be the amount of initial viral load. I just don't know that, but I will find out from our EPIs and get back to you. I also don't know how you would ever really assess that in the process of contact tracing. I mean, all you know is, yes, I was with someone who was actively symptomatic, sneezing, coughing, or not. It's hard to know what kind of virus load you were hit with, but I will ask that and get back to you.
Right, because I go back to the, if I go into a bank, I've got a mask on, the teller has a mask on, we spend 2 minutes on either side of a piece of plexiglass, because there's still a chance that if we weren't taking all those precautions, I could get, I could hit that threshold. I'm just picturing, again, a group of 20 humans in a 900 square foot room for 4 hours together. And if one of those humans happens to be actively shedding virus particles, if that teller could have gotten me sick from a 2-minute interaction, what happens in that 4-hour interaction where for 4 hours someone was pumping virus particles into that classroom?
Mm-hmm. Again, the answer will largely come down to community transmission. The fact that all of us are moving out and about and virtually all industries are open now, and we still have very low numbers, means community transmission is low.
Sure, but that's not, I'm going with the scenario where, that bank teller I'm dealing with is sick and one of the students in that room is sick, and that bank, is there again a higher risk because that student is in that one room with those people for 4 hours versus that that bank teller, that bank customer is having a 2-minute interaction with the healthy person?
Yes, absolutely. You are correct. The longer you are exposed to an infectious person or an index case, then the more likely you'll be defined as a contact and at risk. And the more likely you will get to have contracted the virus. Yeah.
Okay, I'm not seeing any more questions. Ben, I'd like to thank everybody, Karen and Mike, for your input tonight. We're, I guess, probably about halfway there. So I think it's time to move into the options that we got to consider, Ben.
Great. Before Karen goes, first of all, thank you, Mike. Thank you, Karen, for all the time here and all the support you and your staff are giving us and the whole community. It really is, we're leaning on you and your staff so heavily and have been for months and months, and you guys keep on delivering, keep on supporting, and just really appreciate it. I do have one question for Karen before she goes, which is important because I heard her say that surfaces aren't that important, and one of the members mentioned about cleaning groceries. This is recorded so I can play it back for my wife. Is it necessary still to clean groceries at this point? I would like to know that answer, please.
Look, I would say no at this point, but again, it depends on how much risk you can live with. If you want to clean, there's other reasons probably to clean groceries if but no, I would not recommend that. And at this point, you're good.
Mr. Chair.
Thank you very much. I will.
But if you hold on 1 second, again, my apologies in advance to Karen, and I would love to be able to cut her loose, but I can't imagine that we're going to finish this conversation and go through these possible plans and not have a question that may need to go to our health expert. This whole meeting is surrounded, based on health crisis. And I'm sorry to do this to you, Karen, but I really appreciate it. You could just hang out with us for the duration.
How about available by text or phone if we have a question?
Now, I agree with Joel. I would feel more comfortable if we can direct some health-related questions to Karen.
So
I also think the community would.
No, I'm good. I'll stay here and.
All right. So let's then proceed.
Absolutely.
Okay, thank you, Karen. Thank you very much. Let's proceed back with the presentation. I do want to keep on just going with, and I'll go through these quickly, but there is further context that committee members asked for me to share. I'll go through these quickly. This is just the guidance that DESE continues to give us even into August about how to do things. Just quickly, this was shared with all the family forums, but not really with the school committee. Our various remote learning working groups that are helping us plan. Remote learning groups, mental health. I actually forgot to add here the mental health working group, but just as a reminder that there's so many teachers and staff involved in so many different ways. So many of these folks are also, leaders in the Gloucester Teachers Association as well. And this doesn't actually even capture it because even within these our schools, they have operational teams that are going. The high school itself has its own, district own reopening team committee rather, which is listed right here, which we shared at the family forum. So just, and then the different groups of teachers helping out sort of all along the way that aren't even informal committees or teams. So it's just been a collaborative effort since well before I joined the team, and just don't want folks to lose sight of that. It really is taking so many of us. The planning process and specifically public communications and engagement, we've done quite well on this. Family and staff surveys, both in June about remote learning, which has really helped us focus on improving remote learning. Our return to school surveys at the end of that last month. Reopening email updates in June, but also then recently, the last couple of weeks. We launched the Back Together GPS website, which I think seems like many folks know about. Virtual staff meetings, office hours have been happening over the last week and a half at all schools. Virtual family forums, this was a big push. We've 8 total family forums. We've already done 7 of them since the 6th, which was just last Thursday. And then Principal James Cook has put together 2 student forums. So first a meeting yesterday with the high school student leadership, the officers of the classes and that sort of thing. And then this morning, a student forum opened to all high school students. We'll hear a little bit about that from James. The committee asked me to sort of summarize just, well, let's go to the survey results first just quickly. So again, these were our return to school surveys, great response rate, both from teachers and from staff. And also really looking at reopening issues. Just a quick summary on some of the highlights. All the family surveys are available online. Families strongly support having students back in school.
Let me get my things and drive home quickly.
Mary, you might want to mute. I think we're hearing you. And then, so families strongly support having students back in school for at least part of the time. 80% of parents who responded, there's a very large number of parents, said they want students back in school to some degree. 39% of those responding said all in-person learning, and 41% said they preferred a hybrid approach. That's of respondents. 30% of parents, only 30% of parents said that if we meet the physical distancing guidelines are met and safety precautions are satisfied, that they would support all remote learning. Similarly, families, 20% of students said they only want to do remote learning. And then one of the staff highlights that I shared last week and will repeat, 66% of staff preferred some type of in-person learning, with 26 of those responding, well over 300 people, preferring all in-person learning and 41% selecting a hybrid approach. 32% are favoring all remote. So that's, that's a different, there's divisions there, obviously, like there are in the community. Excuse me. Sorry about that. But clearly, looks like 2/3 from our survey, which went to all staff, support some version of in-person learning. The Family Staff Forum, School Committee asked me just to sort of characterize or pull out themes. Staff meetings, so this is going to be just very high level and just trying to sort of focus on a few areas here. It isn't comprehensive. It's not meant to capture all the details and all the conversations that have happened in these staff meetings and office hours. So it was a combination of staff meetings, which are mostly presentation last week, and then ongoing office hours, which are typically smaller groups of folks and allows for more questions and answers and discussion. Most of the questions, or a lot of the questions, were focused on operational issues. So everything, PPE for teachers, cleaning between classes, equipment training, that sort of stuff. Substitute teachers, bathroom visits, really it really speaks to, I think, from when I listened in, we have a lot of open-ended operational questions. We know that. As we decide tonight how to move forward, that's when we have to continue to nail down procedures and make those very concrete, because people do need to know, whether it's a regular school year or especially a new situation like this, sort of what the procedures are and how they operate in a new world. And so it makes sense that folks have there are a lot of unanswered questions at this point on these pieces. Concerns, of course, that we've heard from the public, from yourselves, and also teachers about heating, ventilation, spacing, mask wearing, and enforcement of mask wearing, protocols for when a child has symptoms. So sort of real health concerns there, and keeping people safe. Also questions about remote learning, staffing, how that'll happen, the academy, the 10-day staff preparation period, and how professional development will go. And just to characterize it very generally, tone and tenor was typically, this is principals reporting, about how to make it work. Not always, but there was a lot of questions about sort of how to make it work, but certainly concerns voiced about operational detail, and also health and safety, of course. So a lot of mirroring similar conversations we've had with the community and with yourselves. But certainly teachers have an understanding to much greater detail, or need to understand and know at a much greater detail than, say, the general public. The family forums range from 20 to 120. We did have a problem with the elementary forum, the first one, where we didn't realize we had a limit to the number of people. So some folks couldn't get in. Not all folks who wanted could attend that one. But we did record all of them, and all of them are now on our website and got up on our website within a day of the forums actually happening. Well, we also received questions from our online forum, and those questions are forming the basis of our FAQs that we'll put on the website starting next week. The questions were quite wide-ranging. People were really looking for facts information. There wasn't too much sort of expression of opinion or where people stand on returning. But the questions were pretty wide-ranging. Sort of three main themes, I would say, would be about health, cleaning, ventilation, and facilities. Then learning models around how will learning happen, especially about the Remote Learning Academy, and the quality of remote learning. Also operational logistical around transportation, start and end times, coordination between school levels, that sort of thing, how cohorts will be made. So that's a general, just trying to give you a sort of top line overview of those two types of meetings. Many of you were obviously in the family forums, so you saw that they went quite well. And it was great to have people have the ability to ask questions, live, but also have the questions that came in through the online form, so we could really make sure we work through a bunch of questions. Some additional resources, just that in terms of, we mentioned this earlier, but want to go more in depth here. The resources that we expect to be needing are really on human resources, and at this point, and then also additional supplies and materials. We estimate as much as $1.5 million of additional staff needed or services needed, and that's cleaning, nurse and health aides we're planning for, special education teachers, especially to help the O'Malley, full and hybrid work, paraprofessionals as well. And then additional supplies and materials we've talked about. At this point, the cost is an additional $32,000 from what we already have supplied and have in supply. As I said before, and on the top line here are these variety of funding sources that we have access to. And those are not used up fully, but we are, getting close to that maximum. But we anticipate there may be more flexibility, maybe through the city in terms of the CARES grant from the city, but also other funding may be coming our way as well through the state or federal government. So that's sort of we have spreadsheets and hiring and job descriptions and that sort of thing. We are advertising the positions already because we do need to, if they are needed based on the model, then we need to have it already in process, and it is already in process for most of those positions. Responding to COVID cases in schools. So this is a question that folks have been asking. We have very specific protocols from the Department of Education that they've developed in conjunction with health and safety experts. It provides us information in a variety of ways about what we should do with a symptomatic individual, what should we do if someone tests positive, and that's regardless of a teacher, staff member, student, if it's on the bus, so where it happens, when someone would need a quarantine, who should get tested, and also how should we monitor the spread of COVID in our communities. So the guidance is very extensive. I'm just listing out the protocols here, just so folks can understand what they are. You are from our Back Together website. You have access to this document, and anybody in the public can read it through. I won't go through it all now, but you can see very specific protocols for a whole different variety of cases. Student is symptomatic on the bus, student is symptomatic at school, staff is symptomatic at home, and they tell us the different steps to do. We are reviewing this. This is part of what Karen Carroll described as being somewhat is still being worked out and may be changed. What we will be doing though is, these are available for the public to see now, but we will, if necessary, based on public health, the local public health department may adjust these, but what we will do is make them very clear on sort of a checklist approach of what to do when one of these happens. It may mean modifying the language from DESE, but once they're finalized, we won't change the protocols, but we may make them just clearer for both our staff to understand and also family members to understand as well. So, so I just want to assure the school committee and others that these are things that are already in place. We just have to modify them as necessary, or if necessary, and then operationalize them with our nurses and training.
And can I ask you a quick question on that?
Of course, yeah.
Just a quick question on that. So we had a question the other night, you may have heard, and directly related to this, that that some of the DESE guidelines aren't following the CDC guidelines or what other states are doing, which is also part of the CDC guidelines. So just want to clarify, we can work with our Department of Health to have the guidelines that we choose to operate. We don't have to stick with the DESE guidelines, correct?
Yeah, I mentioned this earlier, and you may want to just repeat it now, is that there's a little discrepancy on this in terms of quarantining, I believe it is, and length of time. And so that's something that folks have given DESE feedback on. And I think, Karen, they're working through that at state level about whether they need to adjust. Do I have that right?
Yes, you do. And we will try to stay in step with the state guidelines for all the reasons I talked about earlier. But if we feel that, or the school community wants to discuss some aspect of it and opt for a local regulation that is a little bit different than the DESE guidelines, that can definitely be discussed and would go through our Board of Health.
Thank you.
Great. So here we are to the learning model. So that's all not all the background information, just a lot of pertinent background information to the real part, the real meat here. So just want to remind folks that we've been doing feasibility testing in our schools. So seeing, how kids can move around, what our rooms can handle in terms of distancing, what our other common areas can, such as cafeterias and that sort of thing. We've been doing that in light of the DESE guidelines along transportation, transitions, lunch and snacks, and different types of classes. So based on that, as I said last week, we believe pre-K can, preschool, sorry, can happen with fewer students in class in terms of in-person learning. But because of what we learned here, we're aiming towards hybrid models at K through 12, so elementary, middle, and high school. And we are also aiming at as much in school as possible, which I'll go into further detail now. So I'm going to show you a table for each each level that tries to summarize with some key sort of factors the different models that we've looked at in each area, on each grade level or grade span. So this is beginning with Gloucester Preschool, our youngest folks. So what you have across the columns here are the different approaches that we looked at and and thought through. And then on the left-hand column here, you have different sort of a summary of different sort of key pieces of the model, so to speak, okay? Just to try to get some numbers in here that are easy to compare of sort of most relevant factors. So days per week in school, you see full in-person, full school day is 2 days instead of 4. Instead of 4 meaning instead of the current model. There has to be some adjustments with preschool, not only because of number of students, but also in terms of health and safety. And the key one is not wanting to have our double sessions, essentially. So we typically offer a morning session and an afternoon session 4 days a week, and we're moving towards 2 days a week for a little bit longer day, which comes down in the next row, hours per day in school. So of those 2 days, students would have 5 hours instead of 3 hours. Students in each class, 11 instead of 15. The typical distance between the students is 6 feet. And in that case, obviously, there's no hours per day learning remotely in any full in-person school day. Hybrid, the X's mean we are not actively pursuing this approach. Because it's a short school day, to have the combination of in school and out of school doesn't quite make much sense because also, limited number of days. The full remote though, when we say days per week in school, we mean actually physically in school. So obviously 0 days there, 0 days per hour in school. The day itself, the remote learning day would be 3 hours, and there'd be 4 hours, 4 days per week, I believe, on that in terms of the amount of learning kids would happen remotely. In the integrated program, so there are a couple different programs we offer at preschool. The integrated program adjusts from 6 hours per day to 5 hours a day, but remains 4 days per week. That's an inclusive program. And then our special education full day program remains the same as it does in the in-person model, or as it is today. So that's not describing too much of the sort of the narrative or the details of what happens in those classrooms. Anne Marie's here. Folks have questions about that to ask her at the preschool level. Principal Anne Marie Jordan, I think, is available if folks have want to know more questions about like actually how it's done, or what the learning day looks like, or how they're making adjustments to make sure remote learning is appropriate. This is something we went over last week, and I also went over in the preschool family forums as well. Any questions? Okay. All right, so moving on to elementary.
Kathy has a question.
Oh, good. Sorry, I can't.
Kathy has a question.
Quick question. Are we still talking about an integrated model under that scenario, given that we're doing less students?
Yes, and that's well, Anne Marie, if you're here, I think I know the answer, but I'll let you answer that.
I am here. And
Great.
yes, Kathy, so that would allow for us to have integration. That's why we did the odd number to be able to accommodate the special education regulations regarding integration, which would be up to 49% of children would be typically developing peers, and excuse me, it's late. 49% would be children with IEPs, 51% would be children typically developing. So that's where the 11 number came in. So we could still accommodate those percentages.
Thank you.
You're welcome.
Melissa?
I have a question. So how many kids are we taking in the preschool program if this is how we're operating?
Hi, Melissa. So,
Thank you for staying up with us.
you're welcome. It could become a conundrum because at this point, our numbers can accommodate this with the classrooms that we have. And primarily the reason why is because we have a somewhat low number of children with IEPs who are starting the year. A couple of reasons why. We did have an unusually large number of children moving on to kindergarten, you know, depending on the year and when their ages, when they turn 5. So we had a fairly large number of kids going on to kindergarten, which freed up spaces. Plus, we have to keep in mind that due to school closure, there are an awful lot of children out there. We bring children in based on their age and whether we find them in need of programming and services. So we have a huge backload that our special education staff intake team are going to have to evaluate starting in the 1st of September when we come back, when staff come back. I will just say that we were happy that EI, a large percentage of our children who come into our program with special needs come from early intervention services, and the state did change regulations. So children who have turned 3 and have been in EI have been able to continue in EI past their 3rd birthday. And I don't know if this is 100% accurate, but I believe that they are able, the state has allowed them to be able to stay in early intervention services until the end of October. So that will give us time to kind of catch up on our evaluations that need to occur and follow the required timelines regarding special education and evaluation and IEP eligibility meetings. Does that answer?
Knowing that, oh, I'm sorry, I thought you were done.
No, I wanted to make sure that answered your question.
No, it did. But I still have a concern, and I'm wondering if you're planning. So we know parents overwhelmingly want their kids back in school. I mean, while there's some that are being very cautious and choosing remote, the surveys, the conversations all indicate that the majority of parents want kids back. There's a huge concern of mental health and socialization. So I guess my question is, because we've usually had a really good full preschool program, and I think the registration date is in August, the end of August, correct me if I'm wrong, so we don't actually know how many, I mean, there's still time to apply, I guess I'm saying.
That's correct. We have a large not a waiting list, but we have a large number of families who are interested in the peer slots that are waiting. But I don't think at this point we have over capacity. And really it is the number of seats for IEP students that are really, I mean, we want to have that integration and enough peers, but we really need to make sure we have enough slots for our IEP children as well.
So my question is, because we're probably not using all the spaces in our schools, like cafeterias and gyms, have other spaces been looked at to accommodate any increase in enrollment, if there is any, this year? To have class?
Yeah, we've talked about what the possibilities are for that. And again, it's a hard balancing act to know what numbers of children we will see. We can't predetermine, you know, based on initial information we've seen. But yeah, we have talked about some alternative spaces so that we could accommodate that. We really felt that the 11 students with the age group, trying to keep social distancing and plus keeping them engaged. It's not a group of children that you can keep seated for even our typical 2.5 hours. These are, you know, it's a play-based socialization program that has a lot of academics and pre-academics interwoven into it. So.
And with 11 kids in a class, I'm just curious because I can't even imagine trying to social distance 11 preschool kids. How is that going to work? In other words, So you have a teacher, you probably have at least a para or a sports staff. Is there going to be extra people in the class of 11 to supervise?
It has been my,
Just-
some of those paraprofessionals, I think, that are on that list, I have requested extra paraprofessionals, so I can help with the it's socialization and engagement.
Yeah.
It's, you know, it's socialization adequately so that you can engage children as well too. So yeah, I'm one of those people that requested extra paraprofessionals.
Let me know if you need extra push.
Thanks.
Good luck. Thank you for asking. I mean, thank you for answering my questions.
You're welcome.
May I ask a few questions?
Go ahead, Joel.
Yeah.
Thank you.
Oh, I'm sorry. Jonathan, yeah, I didn't see Jonathan.
Yeah, I'm here. I just can't see everybody.
So touching base on what, you know, you were kind of chuckling about a moment ago. So, you know, realistically, I see on this chart that, you know, you're going to keep 11 students, preschool students, 6 feet apart from each other. I don't understand how one, you keep 11, you know, 3 to 4 year olds 6 feet apart for 5 hours, and 2, how can you give me an example of how you're able to educate these preschoolers again about social emotional growth when, you know, they are forbidden from working in group projects, forbidden from getting within 6 feet of a peer, forbidden from sharing, you know, any tool that they're working on. What does this look like, right? We get to that classroom, what are these kids doing? How are you keeping them 6 feet away? And how are they learning those social skills when you're telling them, don't touch anything or anybody, and, you know, stay in your little zone in the class?
So I apologize for my chuckle, but I do think I have some answers for you. First and foremost, I trust that we have a good core staff who have a lot of years of experience. That's the baseline. The next piece is that we've done a lot of investigation around other programs, private preschool programs. We've been in discussions with Pathways and their Head Start program. I was able to find information on the Boston Public Schools regarding Copenhagen and how they in Denmark were able to social distance when they went back to school in the spring. And we've been finding some interesting ways of doing that. For instance, a group of the preschool staff have requested purchasing individual you know, shoebox size plastic containers. And we're going to be purchasing individual types of items, sensory items, manipulatives, Play-Doh, crayons, so that they have their own containers. It might be a sensory box, a literacy box, a numbers, math games type of box. These are examples, they're not specific, but those types of things so that children can work. We've talked about purchasing, in addition to individual tables, sectioning off so you can have some floor time and they might be able to do some of those activities together. One really interesting example I saw was for an art project to work together, put a whole bunch of contact paper up on the wall, tack it onto the wall, and have children, you know, say you're going to draw a tree, you know, different children would be responsible for drawing different parts of that tree. Those are just some examples. In fact, just today, one of our teachers and 2 paras were in just really experimenting with how can we section off the rooms. We have a lot of furniture right now in the hallway, but they're starting to bring a little bit of it in to see how we can work that out so that, again, they can be socially distanced, but also engaged. I'm also investigating the playground, and are there ways that I can, you know, section it off so that they can spend longer periods of time outside, possibly even purchasing those big tents so that even if it's raining a little bit, they could be outside.
Yeah, I guess my real question is, I have this fear that a lot of what's being discussed is sort of kind of a, you know, I can't think of a better word than a fiction. You know, we go, listen, like, here are our goals. Our goals are to keep, you know, these students 6 feet apart. We're gonna buy some, you know, independent sensory boxes and try and position them throughout the room. But then I, you know, as I've said before, I have this thought where I go, yeah, but have you met kids? You know, have you met 4-year-olds, right? Like I have little kids, and I have 3, right? And like to keep my 3 6 feet apart from each other for 5 hours, you know, you can give me all the toys and tools in the world. Again, I'm not professional, so that's probably my handicap. But I'm just trying to figure out whether we're having a real conversation about what's really going to be happening in these rooms, or if this is not what's really going to be happening in these rooms, if these are the ideals, but we're going to have to, you know, get a little more realistic about what's really going to happen, then I just want to have that conversation and run that kind of stuff, you know, by Karen and say, hey, listen, if these kids are, you know, for a majority of the day 6 feet apart, but there are some activities where we just know it's going to be herding cats and they're going to be on top of each other, are we still okay there? Or am I wrong? Is it really going to be this rigid and you really can keep these 4-year-olds 6 feet apart all day long?
So I would say, I can't give you an honest answer because we haven't done this, but I have to have some faith in staff that they have that ability to engage children. So if we do have 11 children in a classroom, and if we are able to have a third person in the classroom, that leaves, you know, 3 to 4 children. You know, we would probably have it sectioned so that, you know, each adult would have very small group that they would work with, and then they can shift it. And then they might do some large group activities such as, you know, dancing in there. And if you had something like hula hoops or a taped off square, they'd stay in their square and they could do some dance and movement, yoga. You know, I'm just throwing some of those ideas that we've talked about out there. But I will honestly say this, I can't tell you yes, because this is something we're trying that we've never done before. But I have to have faith in the staff that I've been working with for several years now, and their abilities. If I didn't have that faith in them, I wouldn't be able to say that we could do it.
And your staff shares your cautious optimism. They have the same, yeah, we can pull this off attitude.
I think they're going to try. I mean, they're all educators are very optimistic people. They are really concerned about a lot of things. I will be very honest about that. But I also believe that, you know, in all my conversations with them, despite their concerns about this overall, they are putting 100% into effort, into working and using their knowledge and skill base to try to make this work.
Kathy?
I understand that most of the private preschools are open in town, Anne Marie, and I hear they are doing exactly what you are planning to do, and they've been successful at it. Have you heard anything different, or have you heard any issues regarding the kids' health?
I've been speaking mainly with Pathways. I've also had a couple of meetings. Although I don't think we've met since they've opened with Happy Day and Majestic Harbor. They were still finishing up their plans. The Y and Pathways were the first to open. It's a lot of work. It is really difficult for them, but they are definitely making it work. It's still a learning process for them. I know I can speak specifically for Head Start and all my conversations with them. They're being very strict on you know, having those cohorts or bubbles, keeping those intact, and it's hard, but they're doing it.
Okay, I don't see any more questions. You want to move on, Ben?
Yes, I do. Okay, great. So elementary school. So again, here's a summary chart, but then I'll give you some more information, just sort of highlight a couple of things. Oh, sorry, I meant to mention the green column is always the recommended or preferred column, or approach, I should say, I'm sorry. So in person, as I mentioned before, through our stress testing, and primarily because of serving lunch and a few other common area issues, we don't believe that all kids in for the full regular day as it used to be, even with the safety guidelines and precautions, is a really feasible option here. Okay, so we've looked at that thoroughly and really moved away from it as a real option. In-person +1 hybrid is our preferred hybrid. It is essentially getting all students in 5 days per week in school, as you can see, 4 hours a day, so an adjusted day. And students in each class, 100%. That little asterisk you see there is we do anticipate some number of families opting out and being remote fully. And so the class sizes across the district probably would reduce some. Hard to know yet, but we'll begin surveying late this week, early next week to really nail that down from families once the decision's made. The typical distancing between chairs is 3 feet to 6 feet in alignment with the guidance. Hours per day learning remotely is about an hour per day. So kids are getting 5 hours of learning per day, which is in a hybrid approach, 4 hours in school, 1 hour out of school. And that is in alignment with the Department of Education state guidelines for the year. There are no full days learning remotely in this model. So 5 days in school with their teachers, 4 hours a day. And then, but all for high needs, they're all in 4 or 5 days per week. Actually, in this case, sorry, 5 days per week. So another option that's also hybrid, so that's a hybrid option, in-person +1 hybrid. Another option that's hybrid is 2 days per week in school for students. That's for 6 hours per day, a regular school day. But we have 50% of students approximately in school for those 2 days. Spacing is a little bit better because you have half the kids, 5 feet to 6 feet, and more even than 6 feet. And you'll see, I'll show you some pictures in a moment. Then hours per learning day. When they do remote, it's 5 hours of remote per day. As we described last time, the remote days will be organized and structured differently than before. It'll be a combination of live synchronous learning and meetings and check-ins with students. It'll be small group. It'll be synchronous or video. It'll be computer-based work and also packets and projects and that sort of thing. But it'll be much more structured and scheduled. Students will have a schedule every day, just like they do it when they're in school. And there are 3 days per week of that 5 hour remote learning day. So that's a substantial difference from the in-person +1. And then full remote, is what I just described in terms of remote learning, but it's 5 days a week, 5 hours a day. On both of these models, on all of these models, students, high need students, as we described last time, are in for full weeks essentially. 4 days for the hybrid and 5 days for the full remote. I think high need students could have 1 day that's fully remote in the AB hybrid. Let me show folks just how this sorts out. So just one more slide on the in-person +1. As we've described, this is really prioritizing actually quantity and quality of learning time. Quantity over the split hybrid, or the 50 AB hybrid, is much more time learning in school, and then certainly quality over the amount of remote in the full remote, and also the amount is much more remote learning in the AB hybrid. It allows us to have a regular school learning environment for students every single day. It also allows time at the end of the day for teachers to engage with individual student needs, support, to post online material, to have their planning, their regular planning periods. And then also that hour or plus at the end of the day where students aren't in school, or most students aren't in school, allows additional time for cleaning and disinfecting. So these are some photos. These are both photos for the in-person, the full-in hybrid, or in-person hybrid, sorry. So you have Plum Cove on the left, and that's a 5th grade classroom set up for 18 students. So that's actually set up for the actual enrollment that would be in this class. What you can see here is their trapezoidal tables for the most part. and they're arranged. So while the desks are touching, the chairs are 4 to 5 feet apart. So this is, again, all students in this class, fully enrolled class, full and hybrid. That would be for 4 hours per day, and the students are 4 to 5 feet apart. This is West Parish. You can see using individual desks here. This is also 3+ feet apart, I believe. You can see it's a larger classroom, I think, but a lot more kids in this class. I think there are 20 kids in this class, and you can see how they're spaced to give folks an example of West Parish. A couple more here. Vet's classroom. Today, the school committee went on a tour of the building of Vet's and sat in the class. This is arranged for the full and hybrid. There are 20 desks in this class, maybe 19. You can see myself and a couple of school committee members. I think they were listening to Principal Fusco talk. This is on the right-hand side, another Vet's first grade classroom. You can see these are trapezoidal tables too. They're arranged the opposite way. So the narrow part is where the student's sitting, but they're still a little more than 3 feet apart. So you can see what that looks like. This is East Gloucester for the in-person hybrid or full in hybrid. So this is all students in the class. And I think in this example, it looks to me like they're more than 3 feet. They're probably 4 feet plus separation there. See what that looks like. So let me pause there. And you may have questions for the principals who are all on the call and have been waiting patiently.
Okay. Joel?
And so this, the answer may have been in the vet slide you just showed, but if you can go back to the Plum Cove West Parish slide.
Mm-hmm.
Like, again, this is one of those things where, I want to have a real conversation of what's really going to happen. And so I appreciate that every morning you can get these chairs set up so that they're 4 or 5 feet apart, but, all it takes is student on the right to shimmy left and student on the left to shimmy right, and you're going to, lose that separation. And I'm trying to figure out, how much time is being spent by the teacher, saying, no, so-and-so, send her back up. You need to move, like how much time is it just like, again, herding cats. I think when I toured West Parish once, they had some of those, what they call like wiggle chairs or something, where or fidget chairs or something like that. And the people giving the tour of West Parish said, oh, these are like the favorites of the students, because as you know, elementary school students really can't sit still, and these chairs enable them to, while they're getting work done, still kind of bounce around. And so, while these pictures look great, these desks aren't bolted to the floor, these chairs aren't sliding in and out of tracks. So the reality is, are we going to spend an immense amount of time keeping students perfectly separated, or is there a tolerance that we're not really discussing out loud for, violations of the social distancing that we are kind of building into these plans? I just don't know, where we are on that.
Yeah, so it's a similar question that you asked. It's a similar question to the one you asked to Anne Marie. It would be great to get a principal or two from an elementary school perspective.
I'd be happy to address that. Again, my name is Dan Jewett. I'm the new principal at Plum Cove, and I think we all know that kids are kids, and I think we all know that teaching is hard, and doing this, teaching in the midst of a pandemic and national crisis, is hard. I think that it's important to remember that we have several strategies here to mitigate the virus. None of them is perfect, but the idea is that they work in harmony with one another. The first is that low community transmission is essential to our proposal. We would not be proposing this if we were in the heart of Texas right now. So that's one mitigation strategy and the most important. The second is being very vigilant that people, students, staff need to stay home if there is any signs or symptoms of any form of illness. That's another layer. Then we promoting and teaching hygiene. Distancing is certainly important, and promoting as much physical distancing as possible throughout the day. Masking, and the shortened day itself, in terms of being in for a shorter period of time and having people really focus on the task at hand. And so I think we can all think of all sorts of scenarios in which one of those things will break down. It's a matter of being vigilant about all of those elements simultaneously, and working with students to when people are moving too close, and teaching that. You're right, preschoolers and kindergartners have different developmental needs than fifth graders, and they're going to come in at a different place. And it's our job as educators to teach that. We'll spend significant time on that, and there will be challenges as well.
If I can, while you're still there, so when you have your staff meeting with your teachers, and they're asked, what's the priority here? Is the priority get through my lesson, or is my priority keep the protocols in check? What's your answer to that?
I think it's the same as it's always been year after year, which is first and foremost, it's the safety of our children, and promoting the safety, and that gets a lot more complicated in a pandemic. And so the message to my teachers is certainly, we first and foremost care about the physical, social, and emotional well-being of our kids, and making sure that when they come through our door, they feel safe, that they're taken care of, that's the priority. And then we're getting to the math and reading and writing as well. But the physical and emotional well-being of our kids is at the forefront. And how we teach these things, we can do that, I think, in a successful and age-appropriate and developmentally appropriate way.
Any other principals want to chime in on this one? Just about, what's the reality of the complexity of teaching this situation, and how do we, I guess I want to sort of have one of the principals talk about the nuance here, because it isn't either or, and I don't, it's an orchestration around both, really. So I don't know if other folks want to chime in on that.
Well, I just wanted to sort of add to what Dan said. Is just, what the driving force here behind having the students all in is the social emotional piece to this, because the connection with the teacher, the connection with school is hugely important. And right now with community transmission low, this is the time to do it. And I think that's what's been really driving us for this.
Great.
This is Amy Pascarello. I would add, no teacher that I know of just gets through the lesson. The priority is never to just get through the lesson. Every teacher is in that building for our students, for their well-being. My number one rule when I open school every year, I talk to the teachers is, yes, we're here to educate our students, but we're first and foremost here to make sure they are safe and they feel safe. And teachers take that to heart. They are constantly changing their lessons due to individual needs, whether it be academic, social, emotional. Somebody needs something repeated, somebody needs something more enriched. They are experts at this, and they do it day to day. And we're adding in, they're going to have to make sure they're not sliding out of their chairs. They do a lot of that anyways. We're now adding distancing and wearing a mask. A lot of our schools practice day to day, particularly in the beginning of the year, how to walk in a line, how to wash their hands, how to order their lunch. And this year, it's going to be how to wear a mask, how to keep in your 3 to 6 foot bubble, how to keep your hands to yourself more than ever. This is something that teachers are going to do day to day in every lesson. And it's never going to be to get through the lesson. It's going to be the best serve our students and make them feel safe and supported throughout their day.
Other questions from the committee?
I'm not seeing any, Ben.
I see Laura. I see Laura's hand. Sorry, I can see everybody.
Oh, okay.
I see Laura.
So question for the principals. I mean, we don't know how many kids would come back if this were the plan voted on, but how are teachers feeling about teachers and paraprofessionals and the adults who are going to be in these rooms that look sort of crowded to me. So I'm just wondering what you're hearing from teachers about how that feels to them to be, to stand in a room set up this way.
So this is Talina. I have the picture that you see of West Parish is our largest class at the moment. It is 23 students. Again, we don't know if that will be the number of students we have on the first day of school, but that would be our first class. And you're right, it is tight. So we are talking about ways to have students have their ELA or math block in the library, for example, so that we can reduce class sizes to make it more functional on a day-to-day routine. But we haven't finalized those plans because we don't have a final plan yet. I am hearing from staff that whole gamut, very, very nervous to, I just need to be with my kids again. So it's completely all over the map where people are, and there is a lot of very realistic fear out there. There's also a lot of staff who really are like, just tell me what to do and I will be there and I'll do it. And they have, even people who are nervous are showing up, asking questions, helping move furniture, really think through processes. Just to add to the last question, the other piece that we really are wanting to do, whatever the model is this year, is find a way to bring joy, make that connection social emotionally for all of our kids. Really, how do we bring joy and engagement into learning for all of our kids?
Thank you.
Okay, Melissa has her hand up.
So I don't have a question. I just want to remind you that it's 5 minutes of 11 and we have to vote to continue this meeting. Because our policy says we have to after 11 o'clock.
We will at 11.
Okay.
Jonathan,
I have a question.
And then I see Kathy's hand up, and then
Okay.
Samantha's hand up.
Yeah. Kathy?
So my question is, in terms of the visuals here of the classes, that is if everybody, all of our kids choose to come to school instead of that does not take into account the potential 10 to 20% that may choose full remote, right? So when we know what families may do, it's probably unlikely that any class will probably get 100% of families to choose to come in. So, there might have to be decisions made, or maybe the situation gets better if all the kids do choose to come, which would be great. Then it sounds like people like Talina have kind of a plan B or ideas on how to accommodate safely in other spaces. Am I correct in saying that?
Kathy, to answer your question, not only do we have ideas for some flexible groupings in different places to put children to provide for some more spacing, but you're correct in not only might not all of our families choose to come back if we're fully in, but we base this on your typical classroom size of 20, which is average, but it's certainly not everybody. And so today I worked with a classroom teacher and we set up her room for 20 because that's what we wanted to give you as a sort of worst case scenario. But she really would probably have about 15 in there, in her case, if everybody was all in. So there is some variation to that number. When we say 20, I think we all tried to move to the high side just to show you what sort of a max capacity would look like.
For example, on the East Gloucester now, we have this is 18 students in here, which is I think Amy set up actually for how many students would be in that classroom, correct? Like actually enrolled.
Yeah, that's actually a 5th grade class, and that's my largest cohort. So if 100% came back, I would be breaking that grade level into 3 cohorts to lower the class size. So if I took 23 kids in both classes and divided by 3, I'm going to be well under 18. So that is more crowded than it would be if 100% of the students came back, because I would spread them out in other places in the school.
Which speaks to what Jody said about, looking at other scenarios, that sort of thing. Great, thank you.
Yeah, I think all the principals have gone through their buildings, and we're looking at shifting rooms, and we're finding other spaces, breakout spaces, different things like that. So I know for vets, I've got 2 breakout spaces right now that if there was overflow, we could move into those.
I also want to add that I've had staff reach. I'm sorry.
It's 11 o'clock, and our policy is that for us to continue after 11 o'clock, we have to take a vote, and we vote in increments. And are they a half an hour or 20 minutes, Kathy? Do you remember?
Half hour.
Half hour, okay. So at this point, we need a motion to continue this meeting until 11:30.
So moved.
Second.
Okay, is there any discussion? Maria, could we get a roll call vote? I can't see everybody, so I'm sorry, but because when the thing, so if I speak up if you want to, if you have something to say and I can't see it. Okay, so Maria, roll call vote.
Mayor Taken.
Yes.
Ms. Watson.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
And Ms. Prince.
John, I'm not sure if you can see Samantha, but she's got her hand up.
Samantha, you have your hand up?
Yeah, are we okay to keep going and ask questions, or do we still?
Yeah, I didn't hear Melissa vote, but you did vote, right, Melissa?
Yeah, I did, yeah.
All right, so it's unanimous. We're going to continue until 11:30. At 11:30, we can do this again. So let's continue with the, Amy was in the middle of speaking, so let's let her finish. And then we'll go to you with Samantha for a question.
So I was going to add that in addition to using flexible spacing, I have had staff reach out to me about being flexible in their roles too. For example, I spoke just today with a paraprofessional that came in and basically said, put me where you need me. I'm ready to go. So the staff are very dedicated and ready to make this work. There is definitely a level of nerves and fear out there, as normal and expected. But I can't say I could ever ask for a more dedicated staff than what I have.
Samantha?
So I'm just curious in terms of how we're going to proceed. So I have a lot of concerns about this particular hybrid model in the elementary schools, and those concerns have been echoed quite a bit in a lot of the emails and the letters that have been sent to us from the community. So are we, and I just want to sort of have a conversation about that, because most of my questions are logistical questions that will apply for either hybrid model. So I don't really need to spend a lot of time working through those questions. So I guess, can we talk about like which hybrid we're comfortable with based on some of the feedback we got? Because we all got the same feedback.
Can I just ask one thing about this specific model before we could move to the other one?
I think we need to let everybody ask questions about the specific model before we move into a deliberation on which one's the best. We haven't actually gotten to them all yet. So Laura, go ahead.
Well, I want to say, like, I appreciate what Sam's saying. I want to speak about both, but just specifically on this one, and specifically for the principals of the 4 older elementary schools, given what Mike Hale said about, you know, the more kids in a room, the more difficult the air quality issues are. you know, my assumption is that, you know, even the overflow rooms are, you know, in the older schools are old and sort of, you know, a little bit limited. How are you feeling about the ability to have even 15 kids or, you know, potentially 20 kids in a room where we haven't quite figured out the air quality yet?
I guess I would just go back to my earlier comment of air quality is certainly important, and it looks different in every building and it looks different in every classroom. And that is a task to go room by room. And air circulation, air quality is very important, but it's also in conjunction with low community transmission, sick people staying at home, good hygiene, distancing, masking, and a shortened day. And so that is air quality is a challenge, particularly in some areas, but I would just frame it with those other elements as well as you weigh your decision.
At East Gloucester, we are accustomed to keeping windows open. Our heating is fluctuating on a normal year. So I feel like we are able to create airflow, which is what I'm hearing is what we need to do the most. And I'm fortunate that the majority of my grade levels are small class sizes. So I feel I'm confident that this is the best route. I'm nervous about not connecting with these kids fully. They have been out of school a long time, and their social emotional needs, they need a connection. They need the relationships with teachers, and I need to see them every day. I miss them.
I think it's if we're talking about a health crisis, I think students not coming into school every day, some of them with very challenging lives, and what school provides for them, I think that's a health crisis too, that when you compare to low community transmission and all our ways of working with that and working against the COVID, I feel that, you know, this is the model. I'm passionate about it. I think all the other principals are very passionate about it as well.
I agree with Mr. Fusco, and as principals of buildings, we collaborate with community partners throughout Gloucester, and some agencies like DCF reach out to us to check in on students, and it breaks my heart that I can say I don't know how they are. I haven't seen them since March.
Do any other principals want to?
I was just going to say I agree with my colleagues in all that they've said. I think that, you know, all four of our buildings in particular have always been plagued with issues, and we have managed to be creative in the way that we would work around that and find good spots for students to do their learning. And I think what we need is our students in front of us. I think our students need their teachers on a very consistent basis so that we can kind of get back to business, the business of learning.
Thank you.
Okay. Ben, we want to continue?
Sam has her hand up, I think.
Oh, okay. I don't see it, but Sam, you have another?
That's okay. We can move forward. Thanks.
Sorry. Yeah. So so moving on to O'Malley. So again, just similar process here. Days per week.
Sorry, Ben. We didn't do the other model.
Are we going to look at the 50% AB hybrid?
Yep. Sorry, let me just change to another window here. Give me a moment. Share. Second here. Are you seeing pictures of the AB split?
Yes.
You know, the presentation mode, we can see the slides.
Okay. now. Can you see in presentation mode?
Yes.
Yes.
Okay. So just not, we don't have as many queued up of these, but I think you get the picture. So West Parish is on the left. Talina, can you tell us about this classroom, what it's set up as and how many students? Can you see that?
Yes, I just had to unmute. So yes, this is a second grade classroom. It is set up with 11 students. I could maybe get to 12 at the exact 6 feet in both forward and backward and side to side. So hitting exactly 6 feet is challenging, but as you can see in that 4 to 6 feet range, we could probably get to 15 students.
Mm-hmm. And so in terms of half your classes, this is a class that has 22. Were you trying to fit the maximum students in the classroom, or just like based on how many kids are actually enrolled?
Maximum.
Okay.
Yeah,
Yep.
11 to 12 would be our, if
Okay.
everybody came back.
Great. Okay. And then on the right hand side is vets. So you have a few adults in there from today's visit, and Mr. Fusco leaning on his picket fence pole there. But Matt, tell us about this classroom and how you set it up.
Yeah, that was, I believe it was 11 desks at the 6 foot mark. So that is what my picket fence is for 6 foot measuring. That was a max capacity. We currently don't have a classroom of 22 students.
Right. Okay. Great. Right. So even you're 11 desks in there, it'd be even fewer than that. I think I don't have too many of these pictures set up, but I think to notice the difference between the West Parish class, which you saw before, to this, it is a substantial difference just in terms of open space in the classroom.
So can I ask a question?
Yeah.
So Karen, Carol, I hope you're still out there. I can't see everyone's face right here. But we had talked earlier today about, when you're ranking the various steps you're taking to keep people safe, the top one that I'm hearing from Karen, that I've also heard echoed by all of the principals, is that obviously low community transmission. But this other one is this 6 foot separation that, again, the rest of the Commonwealth has been kind of beaten over the head with since March, about 6 feet, 6 feet, 6 feet. And so Karen, in your opinion, how important is 6 feet, or how big a difference, in preventing transmission is it between a 3 foot and a 6 foot separation?
Can you hear me? Yeah. So again, I can't personally answer that. I mean, it's, 1 foot is better than no feet, 6 feet's better than 3, staying home is better than all of that. When transmission is low, again, that's going to be a factor. So the 3 feet came out of, again, this commission that was set up at the state level. Oh, I think I might have froze. So the commission was set up at the state level. And again, that was the recommendations of that particular committee. And you can see who was on that, but it was a variety of professionals and pediatricians and whatnot.
I guess, is it a big difference maker, or again, it kind of sounds like the amount of air circulating through the rooms is a difference maker, but not nearly as big a difference maker as some of the other protocols like masks and staying home when sick and that sort of thing. So is this distance thing a significant difference maker in preventing transmission? If an asymptomatic carrier is in one of these classrooms, is this a big difference maker or a small difference maker in keeping the rest of the class safe?
I don't know if you can hear me. I don't really know how to answer that. I mean, while transmission is low in the community, I don't think it is that relevant. but obviously as it goes up, and it depends on how well people do about managing the symptoms. If the community in general stays really good about that and stays away when they're sick, you should be able to be, that should be fine, hopefully. But again, I think we have to sort of trust, if you read the report and you look at the experts that worked on that committee and the science behind it, they felt the 3 to 6 feet was safe with children. So, I mean, again, there's a lot more experts on that panel than I would be on determining that. And again, I think we'll know more over time. It's the kind of thing that schools close down pretty early around here. So we can learn from schools in other countries, but we'll know more over time as more data comes in. Yeah. Can you hear me, or I'm frozen?
No, I can hear you. Thank you.
No, we hear you. Samantha, you have a question? You're muted.
I guess I just wanted to say one more. It's not a stop-go. All of the indicators have literally yellow and green and red lights that the state uses. And that's how we think about things in public health. So if we start to see transmission go up in a school, in a classroom, in a situation, or citywide, we would pull back like the governor has done with his phased actions. It's a slow, there won't be a stop and a start. It'll be more about, okay, we're seeing some transmission. We've had a couple of cases. Let's pull back. Let's see if we can put some other things in place to mitigate. And let's try to extend everybody a bit further apart, or, reduce capacity somehow, or tweak all of these factors that we've talked about tonight.
Karen, am I allowed to ask a follow-up for that? Jonathan?
Go ahead, Amy.
So do you mean that if we were to be in the 4+1 and transmission rates went up, that might be a good time to go to the AB model?
You could do something like that. Anything that reduces any of those risk factors we talked about. So there are a lot of mitigation strategies we would look at in between, depending on the population that was affected. But yeah. Thank you.
That was my original question. Is there a significant enough difference between having 20 children in a classroom, 10? So again, is it a big enough difference maker, or is it really just, listen, if the community is not sick, these classrooms won't be sick. And if the community is sick, whether there's 10 or there's 20, that classroom is going to start getting sick.
I think it's more the latter.
Laura?
So following up on that, I mean, I think from my perspective, as we look at these plans, as we don't want any sick kids, we don't want any sick staff, we don't want any sick teachers, we don't want sick, we don't want anyone sick. So for me, like, I understand from a public health perspective, we see the case happen and then we react. But if we're trying to mitigate as much as possible the risk before we get that case, right? That's, I guess, that's the place where we are, right? Once we see the case, once we see then we react. But how do we mitigate getting to that case? I understand community transmission. I understand I do, and I think you've explained it so well. And then now in the idea of bringing kids back into the buildings, which, is very, very important to me. How do we keep them as safe as we possibly can? And that's I think where these numbers, and at least this is what I'm hearing, like, does 6 feet versus 3 feet matter? And what you're saying is maybe it does, because that's a mitigation technique once we start to see cases. Am I right about that?
Absolutely, it all matters. And I mean, these same messages you hear over and over: wear your mask, stay home if you're sick, wash your hands. these things matter, and they're the front line of defense with most public health viruses, and in this particular case, they absolutely are, and we just cannot reiterate that enough. And we would also, you know, as we move into the winter months and we're facing flu, we'll all have to do even more of that if we want to try to continue to keep our society somewhat open, if we have it possible. So there's no magic formula to say one thing would be better. And it's not, I think someone said earlier, it's not about doing one thing versus the other. It's about prevention is always about minimizing the harm and the risk. So we're not going to prevent any cases of COVID happening in this community, probably, but we're going to work on all fronts to bring down the risk everywhere. And that's going to involve community-wide things. It may involve policies that the city makes around, you know, number of visitors that come in. It'll be all of the other policies that the state has made. It'll be the social gatherings, that was just adjusted. So yeah, I think it does all matter. I can't tell you which one matters more, and does 3 feet to 6 feet. Yeah, I mean, if we all just stay home, and at the point in which we were last spring, that's exactly what we did. We all stayed home and we saw transmission eventually come down. So I agree with you, want to try to prevent that. And the prevention strategies are the same as they've always been basically with COVID, they're the same as the flu or colds, and it's those basic things I mentioned. And I think the trickier thing with COVID is the symptom management, is really teaching people and families and kids what are the symptoms. And they will change. You know, they've changed several times since we've been at this. Knowing the symptoms and then feeling empowered, safe, whatever, to call your employer, to let your teacher know you won't be in, and that you have significant. So that's a really important part of people, is a symptom management. And that's, again, not just for the schools. It has to be all of us. And it is a challenge for any employer to really make sure that people know the symptoms and feel comfortable saying they can't be in. And so all the sort of continuity of operations planning that needs to go with that, with any business, any school.
Thank you.
Yep.
Thank you. Ben, could you just explain the difference in the class day between the two hybrid models?
Sure. So let me, while I'm doing that, I'll also show it to you. The class day, first of all, it's easier if I just talk from this. So the class day for the in-person +1 is, it's a 4-hour day. So, you know, I'll just use sort of round numbers here, 8:30 to 12:30. That's 5 days a week. So every single day, all students get 5 hours, say 4 hours of being with their peers, being with their teachers, being with special educators, related service providers, that sort of thing. And then an hour, then they go home, travel home, and have 1 more hour of learning that's assigned by their teachers to do. That could be a video, that could be a taped lesson, that could be a computer-based assignment, that could be a project they're working on. Could be a check-in there at that point. So it's a variety of different options, all that would happen in remote, in any of the things that we could do in remote learning. In the A/B hybrid, it's just 2 days a week. They're a full regular school day, sort of as you imagine it today, or we used to imagine, I should say. And that's half the kids in the class. But that's only for 2 days a week. On 3 other days of the week, they have remote learning, 5 hours a day. And that's so that if you think of that 1 hour that the in-person +1 had, it's 5 hours of that. And then again, a combination of synchronous learning, asynchronous learning, taped lessons, small group check-ins, full group, class instruction that's live, computer-based work, project work, packets, so it's sort of the whole gamut there. Again, that's 5 hours per day for 3 days of the week. It's a significant difference between these two models in terms of having our kids in school, supporting them, having them connecting with their peers. Joel was asking some good questions earlier, and we all acknowledge that it'll be a different learning environment, when kids have masks on and they can't move around as freely, but we can't compare that to what we're doing now. We have to compare it to the other potential models, okay? So even that, a challenging learning environment, I won't understate that, okay? A new learning environment compared to the other ones, the 50% AB hybrid or the full remote, that's what you have to compare them to. And even with the challenges, because you have the challenges, the same challenges Joel was alluding to. Kids have to, stay put. They can't, tackle each other, run with each other. That's the same thing in the AB hybrid. A little more space to do that in, which is not a small thing, but it's only two days of the week. So I'm not sure if that was coherent, but there are real trade-offs, and because there are real trade-offs here, is the reason all the work folks have done. At this point, with community transmission where it is, my recommendation is for the in-person plus hybrid, in-person plus one hybrid for elementary.
And in the 50% AB hybrid, you would have to accommodate kids eating lunch in class, correct?
Yeah, it'd be a combination of eating lunch in class, eating lunch in the cafeteria. Principals have been looking, at various spaces. Can be outside if the weather permits, that sort of thing. But you have a much more varied approach than you typically would, because kids have to be 6 feet apart and obviously be unmasked.
Laura?
And in the AB hybrid, who's teaching? Who's teaching on the off days when the teachers are also teaching in person?
Teaching on the off days.
So you've got one cohort's 2 days, one cohort is 2 days, right? So someone's teaching those other 3 days if there's any live classes or small group work.
May I jump in?
Yes, yeah.
So I do think that the AB model is probably the very most taxing model on our classroom teachers, because the reason it is a 4-day model is that on that day off, it wouldn't be so much a lot of remote live synchronous instruction. It would be a lot of planning, pre-recording lessons for the students who are on the 3 days of remote. Those students on 3 days of remote instruction will be very much on their own, very minimal ability to check in, because if we're running a full day schedule in our schools, we'll need our specialists, our classroom teachers, our special educators, our prepare professionals, ESPs, to all be doing what a full day of school looks like at the elementary level.
So it wouldn't be live group work, I guess, on the remote days?
It would be minimally live is what I'm expecting at this point.
Yeah. The live check-ins there, live teaching in the AB hybrid would primarily happen on that 5th day when both cohorts are remote.
I see. Okay.
If I could just put the hybrid +1 into perspective, if you consider a typical 6-hour school day, by the time you take out the 45 minutes of lunch and recess and the 30 minutes of a prep, and I'm not even going to go with transitions and all of that we know are just definitely built into a day, you're talking about 4 hours and 45 minutes roughly of learning time. So even though we've got a shortened day, we're still giving our students the 4 hours with their teacher and then remote learning on top of that as they go home. So it's the most robust model and it's the most time on learning.
So can I appreciate that, Jody. I appreciate that very much. And I have no doubt that it's the most robust from an educational model. What I'm looking at is how to get an educational model and a safety model as best we can in these strange and awful times. So I don't doubt you guys are the educators, you know what the kids, need. The question is, as parents and as a community, how do we thread this needle and also keep them safe? My personal fear is that, yes, I trust all the, indicators, and we are very low transmission, but that if that were to change quickly, we may be a little behind the curve when we find out. And so for me, I'm just trying to figure out how we do both as well as we can. And, that's where I'm coming from.
Laura, I would add into the safety of the students, all of the things that are happening in addition or to COVID. So not seeing our kids that long is taxing on them. The hybrid +1 model, they have 20 hours of in-person instruction with 5 hours of remote in a week. The AB, you go to 12 hours of in-person and 15 hours of remote instruction. Most of that remote instruction is not live because we have cohorts. So I know it was hard on students in the spring, and we will have a better version than we had in the spring, absolutely. But 15 hours is a whole lot more than 5 on remote for little kids. And I think the safety of their social emotional needs to come into play as well.
No question. Absolutely. I hear that. I'm sorry, Dan, were you going to say something?
I was just going to add that I think we all share your concern about, when building the model, we very much are aware that we can't predict the future, and this might not be tenable on the state level. But what we're really trying to focus on is we have a moment in time here where we have a window where how do we maximize this learning? Kindergartners who have never met their teacher, first graders who have never met their teacher, how do we maximize this time? And so we agree, like it is weighing, maximizing education with mitigating the virus. And everybody does a slightly different calculation with that. In our preparation, we're trying to maximize the opening of school to the best of our ability.
Okay, it's
I'd like to make a motion to extend.
We're going to have to take another vote to continue this meeting. So we need a motion to continue the meeting until midnight.
So moved.
Second.
Any discussion? Maria, can we get a roll call vote?
Mayor Taken.
Yes, until I stay up.
Ms. Watson.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
And Ms. Prince.
Yes, and can we consider releasing the nurse that probably needs to be to work in about 8 hours that's been hanging on with us?
If I can ask one more question, I'd be into that. Can I ask one more question?
All right. I just want to, the motion carries unanimously. Go ahead, Joel.
So, if apologies in advance for oversimplifying this, but I'm trying to wrap my head around a very complex thing, and I'm wondering if maybe, we're getting a little lost in the weeds here, because everything I keep hearing for the last 4 hours really keeps coming back to the relative health of the community. And so it sounds to me like all these things, how do I say this? It sounds to me like we're planning to get into a car and go drive somewhere. And all we're talking about tonight is like putting on a seatbelt and making sure the headlights work. And it sounds like maybe mask is shutting your door before you leave, but it sounds like the community transmission is like making sure you have 4 tires in the car. And if that community transmission goes away and you lose one of your tires, it doesn't matter how well buckled you are or how well your headlights work, you're still going to be in really rough shape. And vice versa, all these ancillary things we're talking about really aren't what's driving this. And so I'm trying to figure out how crucial it is that we are drilling down into these. If the reality is it keeps coming back to that community transmission standard, is that really what we're talking about here? Does that so far outweigh the rest of this that, you know, we don't need to keep drilling on this. Listen, anyone knows me, I'm happy to go through all this minutia because that's what I do. But I'm trying to, are we being misguided here? Should we just say, hey, listen, you know, the state system on that, you know, clear, green, yellow, red map is all based on community transmission, nothing else. Everything that's been said tonight from administration, principals, and Karen, you yourself, starts with, well, while transmission levels are low, the following things are okay. So can you give me some sort of perspective, some sort of quantification as to how much the rest of this really matters in comparison to this community transmission variable?
I can try. I mean, it does matter. We see people that work every day in long-term care facilities where 70% of our deaths happened with COVID. So you need to kind of keep that in perspective. We see people that go in every day to work there, to serve food, to deal with patients, to, you know, bathe patients, very close proximity, who end in long-term care facilities as well to a lesser degree, who by proper hand washing, symptom management, and PPE and knowing how to use it, using it properly, they have very low rates of infection. And that's been a question. Again, this is all new, but it's something that sort of surprised people as we started to watch this. We were very worried that our healthcare professionals were going to get very, very sick, especially when there was inadequate PPE at times for those people. But in fact, we didn't see that universally. Now, there may be pockets or maybe, you know, certain types of environments, but they absolutely do matter. And I don't want to imply for a second that they don't matter. And, you know, they're prevention measures. That's why we do them. It doesn't make the decision whether, you know, a business should stay open or not, or all of those other things. The prevention measures work. If people heed them, and we've seen this with flu every year, vaccines, if people get the vaccine, if they wash their hands, if they stay home when they're sick, they absolutely, it will matter. And in fact, they project that maybe if people do follow this guidance in areas when they do, our flu rates will be down as well, because we'll have people following these basic infection control that prevent the spread of all disease. And, you know, all of these things, they're not new. So they absolutely matter. And in the face of a pandemic that we do not yet have treatment or vaccine for, we have to really amp up every tool in our toolbox. Does it mean we all should stay home? I mean, that's a calculus some people make, and there are people who have completely stayed home since March. And if you are high risk, if you are in one of those elderly, those, when we talk about risk, underlying health conditions in the older population are at greater risk. And again, 70% of the deaths have resulted in long-term care facilities. So and I think that's part of the comfort level in reopening, is that this is a community in general that have not been affected terribly by the virus. Now, that's talking about children. So worldwide, and I said earlier, in the state of Massachusetts, we've seen 0 deaths in the entire state in 6 months for this age group. And we've seen very little hospitalization as well. That's not to say there aren't children who will, you know, who things won't go as well for them. And we've heard cases throughout the United States. But so, yeah, I don't know if that helps, and I wish I had more of an answer, but I think all of those things you can factor in to the level of risk. Yes, we have the teachers who are older and might have underlying, so that is a very real concern. And there are laws that are in place to protect those folks. And There's creative ways in which people have tried to work with that population and have them doing the online, working with the online kids. I don't know. But yes, I think they matter. But does it matter enough if you can't achieve 3 feet between 3 to 6 between every desk, or 6 feet between every desk? I don't think so. I think that what they say is, and there's great models online you can look up, when you have a virus that transmits person to person, if most people wear a face covering most of the time, you can even begin to see it at 40% and at 60%. You are going to stop transmission at some point. The virus will not have enough hosts and not have the ability to move through a community. So every little bit all of us does matters. If one person goes into CVS without a mask, I don't think it's a big deal. No, I think that's playing at the margins. And I think if we focus on the principles of infection control most of the time, we're going to have good results and be able to contain this thing. Is that helpful, Joel? I know the struggle that you got. This is really hard. This is a really tough questions.
I very much appreciate that. Thank you.
So before we move on to O'Malley, are there any further questions about any of the elementary options?
Jonathan?
Okay, Laura?
Can I just ask a structural question? So, I mean, I have more questions, but I'm happy to move on. I guess my question is, are we going to have more time to discuss this before we vote?
As always, a motion will be made, and then it will be debated.
Well, but
so the discussion. But if you have questions, now's the time. If you have questions of the administration or the experts, this is the time to ask them.
Okay, not Karen. I hope Karen can go home. So it's more a question for the administration and for the principals and the administration. So I'm listening and I'm hearing. I'm very much hearing what you're saying about the needs for the kids to be in school. And I'm a parent with 2 elementary school kids, so I understand how hard it was, the remote learning, and what this means at that age on a very personal level. And when I look at those desks and when I look at these numbers, I think that's too many kids in a room. I'm just being really frank. So I keep harping on to anyone who will listen, but like, how can we work creatively to change that? And the thing I'm thinking about a lot is, how do we use the outdoor space? How do we use our outdoor spaces in these first 6 weeks when the weather is decent, not perfect, but decent, sometimes wonderful? How do we, if the priority is to have these kids in as much as possible in this the +1 model, my question to all of you would be, okay, what can we do outside? What can we do that diminishes that crowding? Because that crowding feels very uncomfortable for me. So, and that's open to all the principals and to Ben and to,
we've discussed this we haven't discussed this in depth in any way, and I'd like principals a couple of principals to chime in, including James or Lynn as well. And the reason we haven't gone too far, raises also with the community stakeholders group, is it's just a sort of a bandwidth issue. This is it's a great idea, and it's great space to utilize, especially for the time that we can. But operationally, it's hard for me, I'd say, and I think hard for principals to, one, get their heads around, because it's shifting quite a bit, but also, and then therefore sort of come up with ideas, because we're working on so many of the other pieces right now. So, but having said that as more of a preamble, and then just to state the obvious challenge of it, it'd be great to have maybe a couple of principals talk about what's possible, what can be done, or is it feasible, that sort of stuff. In some ways, I think a few teachers or a team of teachers, a grade level team can get their head around this really much faster than some of us can, to come up with ideas and solutions and generate things. But I'm sorry, principals, anybody want to chime in on thoughts on this and how it could happen?
I would. Oh, we're all ready.
You go, ladies first.
I would say, I've talked about this with some teachers already. Outside is always best, as Karen keeps telling us, and I would encourage teachers to take their kids outside when they can. To schedule it in as a regular part on Tuesdays at 10 o'clock, third grade goes outside. That's hard to do just logistically. There's weather, is there a gym class out there? So it would be more of an informal, a teacher decides to take a group outside, or I envision more, say a 5th grade class, a paraprofessional takes a book club outside and they sit down and discuss a book they're reading. So I think it would be worked in throughout the day, but it would be in a more informal way. In addition, looking at those pictures, I just want to remind you that that's assuming we're at full capacity and everybody comes back. And the survey's saying 20% are not. And we showed you rooms that were full of capacity. My 5th grade, if they all come back, that classroom will not be that filled because I already am going to use alternative spaces. And I know the other principals have similar ideas. So we kind of showed you the most, and it's not going to be as tight as it looked. But we definitely will get them outside as often as possible.
Okay.
Yeah, I've spoken with my staff. We put together like a rudimentary sort of wish list of items we'd like to have if we, to go outside, to have some classes out there. I know that specialists like music and PE will be using outside as much as possible. But yes, I mean, as Ms. Pasquarello said, we're gonna, they can go outside as much as possible.
I think where my brain, I won't speak at anyone else, but things sort of like frazzle for me, or just is thinking about setting up like real classrooms outdoors. We've actually priced out tents, that sort of stuff. But beyond that, the operations of, for example, I saw in one photo, hay bales being used as seats. I don't know about that. That seems a little out there. But what's the furniture? What's the seating? That sort of stuff. And so, again, I'm not saying this to squash the idea. I'm saying it like we just haven't had the bandwidth to really plan that out operationally. So you actually have a functional classroom out there in any way, shape, or form. I think the informal ways, certainly teachers will take advantage of, principals support that sort of stuff. But the sort of like setting up classrooms out there is a level of just a level we haven't gotten to yet. I'm not sure we're going to be able to do like a formal use of that without community help, without, community partners helping us think it through, without community partners thinking about access to resources, with that sort of help and assistance, I think we can get something off the ground. Maybe I'm just throwing out ideas now. Maybe it's a PTO really, coming through around planning it operationally and then helping, working with us to get it done. But it's sort of one of those things where it's like so different and so complex. It's hard for us, I think, to get our heads around.
Did anyone else want to speak to that? So let me just say, I don't know what it would take. You're the educators, I'm not. I'm just saying that for me, it's very hard to think about this density in a classroom all day, for 4 hours. So I'm trying to think of creative solutions. I know there are other districts who are doing it. So I hope, and not necessarily as classrooms, Salem is doing like hub space, but there may be resources from other districts. So not every district is reinventing the wheel every time. So, but I get that you guys, the bandwidth, how can you do anything? It's almost midnight.
East Gloucester does have an outdoor classroom that does not get a lot of use. I'm expecting it to get a lot of use this year.
Thank you, guys. Thank you.
Okay, let's move on to O'Malley.
Okay, I think it's up there already. So, Lynn, how about if you describe You haven't gotten a chance yet tonight, so here you go. How about if you describe just the comparison between the, if you can you run through this table in terms of the showing the different approaches? You want to do that?
Sure. Yeah. I mean, we've spent most of our energy on the full-in hybrid, primarily because it was an exciting model for us, given that we could get kids in 4 days a week as opposed to 2, which we'd have to do in the hybrid. So it has caused us to be quite creative in our thinking. So we've got the kids in 4 days for 4.5 hours in the morning. The cohorts are 12 in a class. That doesn't mean it's just 12 kids in the bubble of contact, but within a classroom at a single time, 12 kids 6 feet apart. And then there's remote instruction in the afternoon that's structured lessons, it's asynchronous. So the difference between that and the 50% model is the number of days. You've got only 2 days a week in the building in the AB model. So that's significantly less contact time, even though the days are a little bit longer because we'd stay in full day. As I think Jody talked about with the difference in the elementary models, you do have lunch in there and breaks, et cetera, whereas the full hybrid is concentrated instruction. There's homeroom that we're including an advisory in, and so that's valuable learning time as opposed to just attendance taking and organizing for the day. And the mask and snack break is necessary because they're in there 4+ hours. Middle school kids are growing, they need that snack. So between those two things, the full-in hybrid offers us a lot, especially when we talk about the social emotional needs. Middle school is this is the prime age where we don't want to short that. So the fact that the kids have been out of school for 6 months, losing that connection at this very valuable and kind of fragile time of their life for developing and building connections with other people. It's been a challenge. Our teachers, both are worried about things like the HVAC, and but also, a lot of people have really emphatically said, I know it's best for kids to be in the building, and talked about how difficult it was in the spring to reach out to kids who were disconnecting. And we don't want to set our kids up for a pattern of being disconnected. We want them to understand the value of community, whether they're sitting 6 feet apart or right next to each other. And if you've been out and about at all, you can do quite a lot of socializing from 6 feet distance. It's okay. It's not optimal, we know that. We can't share materials, we know that. But there's a lot of creative thinking that's gone into this model that's continuing around how we can do different kinds of activities and learning tasks for kids in this model.
Lynn, can you just explain? I mean, one row here looks identical: 6 feet, 12 students in a classroom, 6 feet, 12 students in a classroom. But what it's not capturing is actually a very significant difference in what those 12 students. One in the AB hybrid being actually half the class, and the full-in hybrid actually being the full class. Can you just explain that, how that is?
Sure. So this is sort of the $20,000 question as to how do we magically get down to 12 kids in a class when that's not our typical class size. So this is where the real creativity came in the model. And I've said this before, I cannot take credit for this. I've got some amazing brains at my building, and I'm on my teaching staff who came up with this. And it's really about taking a look at how we allocate both our staff and our instruction. So our special education teachers usually teach a couple of blocks, maybe 2.5 out of 4, if you average the time. And then they do other kinds of things like run meetings and, work on IEPs, do testing and things like that. Our paraprofessionals don't typically facilitate a block completely on their own. They do a lot of small group work. So it's very similar to what we're asking them to do within this model. But it is slightly different in that we're assigning a group of kids to them for that supervising and support, as opposed to them helping out somebody else doing that in a class twice the size. So the model, the full-in is dependent on 3 additional special ed teachers because we need people to fulfill those roles that our current teachers are going to be teaching the full day. So they can't test a kid and run a class at the same time. So that is a big difference there. The benefit to it, as I've said before, is that we have all of the kids in the building on those 4 days. So they're not necessarily having all 4 classes in person, but they are able to connect with each other, teachers in the building, access to counseling staff, and other kinds of support, and just being part of the social network that is middle school. Even though it's going to look and feel different, you know, they're still in their school, and that's really important to them.
Thank you, Lynn. Just the other, Lynn's really captured, this is about the hybrid, the full enrollment hybrid. She really captured these strengths already. So again, the classrooms are arranged the same regardless of the model. So you have here O'Malley, and you saw us last week, the full and hybrid and the AB hybrid. The class setups are the same. The typical O'Malley classroom, the typical sized O'Malley classroom is on the left. Again, 12 students in there. The smallest, literally the smallest room in the whole building is on the right. You see tables here, but this is also, I believe, 6 feet as well, Lynn? Is that 6 feet?
Yep,
yeah.
Yep, they're all 6 feet.
All 6 feet.
We had to get a little creative with how we fit the tables in, but there's plenty of workspace there.
And so, so that's, I think that's, yeah, that's all we have on there. And combine what you read, what we presented last week, and then here, just a quick summary. So let's go to questions then from the committee.
Okay, questions on the middle school plans? Once again, I can't see everybody, so just
I can see folks. So I see Kathy and then Samantha. I saw those hands.
So my question has to do with, so the students so who's teaching the remote classes, and what do they look like for the students that may choose to not come into school? And also in the AB hybrid model, who would be doing that teaching? Is that part of our $1.5 million in incremental staff that Ben, you showed at the beginning, or how does this work?
Yeah, so Lynn, oh, sorry, Lynn, if you can talk about the full and hybrid and how that afternoon works.
Sure. We're talking about the afternoon specifically, or about families who choose to keep their kids remote entirely? Oh,
let's start with yeah, let's start with the family who choose remote.
Okay, so it's not determined yet exactly how things would be reorganized, but the plan for reorganization is dependent upon the numbers of families who make that selection. So, for example, if the survey that we took initially is accurate, about 20% of our families will choose remote. About 20% of our families allows us to reorganize. We currently have 2 4-person houses and 1 2-person house at each grade level. We could potentially dedicate the 2-person houses at each grade level to being remote. We would have to reallocate kids, put all the remote kids in the 2-person house and the in-person kids in the 4-person houses, and then ensure that teaching staff is allocated appropriately, both for, you know, we're assuming there may be teachers who have some medical needs and would choose remote as well. So that is the plan. I can't give anything definitive on it until we have details on which families are definitely choosing remote and which teachers may have some needs. And we'll plan from there, but that's the direction we'll take. In the afternoons, the students, the intention is for remote instruction to be provided with facilitation by our paraprofessionals, just as they would supporting kids who might need extra assistance at home in our high needs population. And the same thing went on, well, a little differently on Wednesdays. We would have some teachers available who work with higher needs populations to begin with, in order to work with those kids on the Wednesdays when everybody else is remote. And they would be in the building with them, so.
And I think Sam?
Are there more questions? Like
Yeah.
I said, I can't see everybody.
Sam has her hand up.
Thank you.
So the one concern, and I've talked about this before, in relation to both hybrid options, is sort of maintaining cohort integrity. So I sort of imagine that some of these kids after 4.5 hours are going to be, they're not going to be supervised after they leave school. And so likely they're going to be hanging out after school with each other. And so I'm just curious, for those who might not have supervision after school, what are we just anticipating for support for those kids? Because we usually do have eyes on them for more hours during the day. So has there just been any discussion about, particularly with this age group, making sure that they're safe going home or have other options?
We typically don't worry about that too much with middle school age kids. They're pretty independent and take care of themselves, and often are taking care of siblings. We will have some after school opportunities available remotely through our 21st Century Grant and our O'Malley Academy. But aside from that, there's, like I said, kids go home and they're on their own all the time, regardless of the time of day, whether it's 2 o'clock, whether it's an early release day, etc. So that piece we have not discussed with the age group.
Can I just interrupt for a second and make a motion that we continue the meeting for another 30 minutes?
Second.
Any discussion?
Know that it has to be a unanimous vote or we don't get to continue. That's what the policy says.
Okay. All right. Maria, roll call vote.
Mayor Taken.
I didn't fall asleep, but I'm going to soon, people. I don't know why we started this late, knowing it's going to be still, we're halfway through. We haven't discussed buses, transportation. We haven't discussed a lot of things. What the hell did we decide to have this at 7 o'clock? That's my opinion.
What's your vote?
Is that a yes?
It said yes the last time.
Ms. Watson.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
And Ms. Prince.
Yeah.
It carries unanimously. We'll continue till 12:30, at which point we'll vote again.
One more piece on this in terms of one of the areas we're looking at, and this was an idea generated originally by Cynthia Carney, and our community-wide stakeholders group is taking it on. We were calling them remote learning pods, but I think now we have a better working name, remote learning enrichment centers. So a group from our community stakeholder team met earlier this week. And what these are, the basic concept is that civic spaces around the city. Could be the Sawyer Free Public Library. It could be unoccupied businesses. It could be something at the Gloucester Housing Authority, where if supervised and have Wi-Fi and clean, well lit, and with some workstations or desks set up, that kids could do their remote learning time there. If that was a better place for them to work than at home, or they weren't going to be supervised at home. And so our subgroup met earlier this week, have generated a host of questions that they will bring back to the larger group, and then we'll begin shopping the idea to partners around the city. But just that could be a possibility for the after school time or on remote learning days, where kids would be supervised in a place that we that would help them be productive and safe.
Thank you.
Laura?
So just a question on the model here. Lynn, I thought I heard you say that there's 12 students, but they're not always the same 12 students in the same class.
Correct, yes. Our bubbles are the house.
And
so within a classroom at a time, there'd be 12 kids, so 6 feet apart, to have the distance, in order to have a mass break or a snack, and just to have the distance to pass by in the aisles between desks, etc. But the bubble that kids will be within is the house size, which in our normal enrollment, the 4-person houses are 80 to 85 kids, and the 2-person houses are 40 to 45. And we have allocated the staff so that there's not crossover with kids in different grades in the same class at the same time. There are a couple of teachers who will teach multi-grade, but we've reduced the numbers where that happens as well.
Okay, so there's a lot of intermingling from a virus standpoint.
I don't think there is, given that, you know, our grade levels are 225, so we've reduced it to a house, which is a much smaller size, and they're always 6 feet apart. So we've got the distance in there, in addition to the, you know, the pretty stationary, intact houses.
I'm just a little confused. So if a house is a 4-class house and each of the 4 teachers is typically teaching one of the 4 core subjects, why wouldn't the 12 bubble just move through and receive instruction from the like stay together and get the same instruction in the same order? Why do they need to switch? And you know, one goes from math to social studies and one goes from math to ELA. Why wouldn't they just all be following the same pattern?
So there are 2 parts to that. One is that it's not a 4-person house. That one of the things that happens in this model is we build a better community by including the specialist teacher as part of the house rotation, the special education teacher as part of the house rotation, and a paraprofessional as part of the house rotation. So the 4-person house, you've got a cohort, you've got 7 different groups of 12 or fewer that would be traveling. The other thing that prevents that from happening is the different needs of kids. It's more similar to high school than elementary. So we've got different math levels, and we also have students who have various special education or related service needs. And it's not appropriate to keep a cohort of students who don't need a substantially sub-separate program together to travel for the day. So in order to provide services, we would have to put a group of students with IEPs together, and they would have to stay intact. And that's really not appropriate for their learning or for anybody else's.
Is it, again, not to suggest you didn't think about this, but I imagine people are going to have the question I'm having, you know, at least as far as, you know, the differentiation. Not all the core courses have differentiation in instruction level, right? There's differentiation in the math, but like social studies is social studies, 7th grade social studies is 7th grade social studies, you know, for all levels, correct?
Yeah, the only class that we level is math. And then again, the special education needs, which are a significant number of our students.
And so it wouldn't be possible to have, you know, the advanced math house, and then you have the advanced math cohort, like that defines who those 12 or those 2 groups of 12 or whatever it is, and then they stick together, or no?
There's not enough kids to do a house with advanced math kids. It's also really contrary to the way middle schools are built and designed. There's so much change that goes on in kids throughout their middle school year that we try to keep any of the groupings as flexible as possible, and not track them. We want them in heterogeneous groups as much as possible because they're interacting and learning from other people with differences. And that's one of the main benefits of a middle school model. So it sort of flies in opposition.
No, I appreciate that. It's just one of those things trying to figure out how you hang your hat on justifying an 80-person bubble, right?
It just because of the program needs, the learning needs, the social needs of the kids, and also,
I think you've done a good job. I was just saying that, you know, I mean, ask these questions.
Yeah. Oh yeah. I mean, and quite honestly, we might be thinking differently if the transmission rate in the community was different. So, you know, we've got where things are so low, you know, and we've got kids 6 feet apart throughout the day. You know, it doesn't make sense to sacrifice those other pieces when we feel like we've got them physically safe, aside from that.
Jonathan, I don't.
Like I said, I don't see everybody, but are there more questions?
I don't see any other questions.
Okay, then let's move on to the high school.
Okay. What's going on here? Okay. James, are you there?
I'm here in the dark. I just went off again, but I'm here.
Great. So can you, as Linda, can you run us through the table here?
Will do.
Thank you.
All right. So the model that is sort of the equivalent in many ways of what you've heard from the other levels. In other words, that gets us the most in-person learning in a safe manner. At the high school, that's a split day hybrid. So that gets students into school 4 days per week. They're in school for 3 hours per day. The students in class at any one time would be half of our students, and as Ben and others have explained, that's of course not counting the folks who would opt for the Remote Learning Academy. So we'll have a crimson and cream cohort following our school colors. The typical distance between chairs in this model would be 3 or more feet, 3 to 6 feet, or more in a few cases. Hours per day of learning remotely be also 3 hours, 4 days per week. And then 1 day of full remote learning. High needs students would be in for 5 days per week is what we're working towards. High needs students being in 5 days per week. So that's the split day hybrid. Should I go on and explain the AB hybrid now, or we've done both ways, explaining them at this chart or coming back to the...
James, I think just keep going on just follow the table here. That's fine. Thanks.
Yep, no problem. So we've also had a plan that, like at the other levels, and all these plans have, are things that the GHS remote learning team has worked really hard on. So we worked hard on this AB hybrid as well, that has students in 2 days per week. So it's an every other day model for each of the cohorts I mentioned earlier. Students are in school for 5 hours per week on those 2 days. Again, we have half of the students in school. In mentioning the hours per day, it's I think important to note that in this model, students are only seeing each of their classes 1 day per week. So the time periods are longer. But in any case, 5 hours per the 2 days they're in, 50% of the students, again, a crimson and cream cohort. The typical distance between chairs is the same. 5 hours per day, 3 days per week, remote learning, and 3 days per week are learning remotely. Again, we're having our high needs students in this model. We would like to have those folks in all 5 days for at least part of the day. And then we have a full remote model that we've built as well, which is 5 hours of remote learning per day. And we'd still like our high needs students to be able to access in-person support during that time.
Great. And then James, you went over, am I muted?
Nope.
We can hear you.
But if there's anything else you want to, this is the split day. Anything else you haven't touched already?
Yeah, this page just mentions the lunch and how that works for grab-and-go lunch and breakfast provided to students at the end of their in-person session on a daily basis.
Okay, Melissa, you have a question?
Yeah, can you go back to the former slide? Both plans are 3 feet apart, and it doesn't say how many kids are in each class. So can you tell me how many kids are in each class with each plan? I'm sure it's the same, or similar.
So that's incredibly variable as at the high school level. It would be the typical classrooms that we provided pictures of. Unfortunately, at the high school, we don't really have a typical class size, but The classrooms are very variable from one class to another, but the class that Ben is showing right now is the closest thing to a typical class, which provides desks of 4 by 4 for 4 rows of 4 for the room that's closest to a typical size, and 3 rows, and that's for 3 feet, or 3 rows of 3 for that same typically sized room at 6 feet. So it really depends.
So there's not more than 12 kids in a class at any given time?
4 by 4, that would be 16, yeah, right?
Oh, 4 by 4, okay.
A few of the rooms have a larger capacity in them. When we split them into cohorts, if a class is, has 28 students in it, that would be, depending, the alphabet doesn't break things evenly, but that would be, like, say, 16 students in a room. If we, and then we would also need to move some classes to larger rooms if need be, because we do have some rooms that are longer. They don't really vary in width, but they do vary in length. And so we could, if a teacher has more typically larger classes, we would put those in. But again, because we don't know the folks who are in the remote learning cohort yet, we haven't made those changes. We do know in each cohort, each block. So we have about 50 different classes going on each of our 7 blocks. Right, so that's a lot of different room sizes, as you might imagine, but they would all fit into this 16 or so desks per.
And would you say the majority of your classes are going to have more than 10 kids or less?
It's a good question. So the majority, again, that would depend. I mean, certainly if we're looking at 20% or more in a remote, taking the remote learning option, then it would be less. But it could, it could be more than half if everybody, is coming in, which we know isn't the case, but it could be.
Thank you, Jay.
It's 1:15. We have 15 minutes before 12:30. We need to move this along. If we don't get a vote at 12:30, a unanimous vote at 12:30, we'll have to adjourn the meeting, and we won't be able to post it until next Monday. And this preference has to go in Friday, I believe. So that being said, is there any will to move this to a vote? Melissa?
I'm going to start and throw a motion on the table just to get the conversation going. I don't know what the expectations are from anybody, but I am going to move that we move the elementary in-person +1 hybrid plan for consideration, and I can say why if there's a second.
Second.
Okay, discussion.
So I just want to say I put that on the table, and it's a difficult decision for me to do that, even though I kind of knew I was going to do it. But after hearing from the principals and the superintendent about the explanation, I mean, it makes complete sense, and I think it's the best decision mentally for mental health for all students. However, that 3-foot distance for younger kids is so socially unacceptable right now. I know Carol instructed us otherwise, it's all about community spread and things like that, but just the notion of having younger kids in a classroom in our most vulnerable schools, the air systems with the 4 older elementary schools, to me, to move this forward and start having conversations that we can collaborate with the teachers with, I think smaller classes is the way to go, even though I don't believe it's in the best interest of the kids. But I just think that's the only way that we can start this conversation and move it forward about what the real reality is of dealing with COVID and safety and getting kids into class.
Any further discussion?
Yeah, can I ask a question as part of my discussion?
Go right ahead. We are under the gun for time.
I hear you, but I can't vote without questions being answered. So
I said, go ahead.
Is there a way, Ben and principals, I mean, I'm assuming not, I'm assuming you've looked at all of this, but could we reduce, I mean, could we make 6 feet difference distances in those classrooms? Could we reconfigure, and I understand the middle school is totally different, but is there a way to go back to the drawing board? And this may be too much at this point, so, you know, we're all tired. But is there a way to figure out how to get more of that in, but give us the distances and the less volume of kids that feels very important at this age, as Melissa said? Or is that?
I don't quite understand the question, meaning, can you just try to rephrase it or say it again?
Sure. I mean, I think I'll speak for myself. Like, I'm just uncomfortable with the density of kids in a room at those narrow distances. But I very much hear what you and the principals are saying about why this is important and why kids need it. So I'm wondering, is there a way, you know, to reduce the volume? Whether it's morning and afternoon, I don't know, but it's hard for me, after listening to how passionate you all are about it, it's hard to vote against it, but I too am just concerned by the volume of kids in those rooms, especially in the old buildings.
I don't think there is a way I don't think there's a way to, for example, we look at St. Anne's. Amy went over to St. Anne's to look at that as a possible space. There's significant levels of work that has to be done. It can't be done prior to the beginning of school there in order for her to potentially move 3 grades over there, you know, and then but it's that sort of thing you're talking about. And there just isn't that ability. We need more room to do that. We need more classrooms. Our buildings don't have that, essentially. So unless the principal has some other idea that we haven't considered yet, I think the answer to that is no. I do want to say very much that, you know, folks have talked about a phase-in approach, you know, and that's what I think actually we're suggesting. And rather than talk from a slide, I'll just talk about it, which is the phase-in goes like this. While community transmission is as low as it is, we phase into as many kids as we can do. And I think folks heard tonight that, you know, in terms of the safety aspect, it isn't as much the distance as it is so many other pieces. And even if it's and we've said this, for 2 weeks or 3 weeks, you know, to get kids in on the, you know, all in +1 hybrid makes sense on many, many levels. It makes sense in terms of we can do it in terms of public safety. It makes sense for those foundational relationships that will hold the kids and really be the basis for their learning with their teachers. Whether we then move to split hybrid, they already have that. And then, you know, it is very likely we'll move to remote. I mean, I wouldn't say very likely, it's likely. We are expecting to, I should say. We are planning for that, as we should. So I do really appreciate the discomfort. I mean, some of it's is a feeling, some of it's a sense, some of it's just looking, you know. And also, as I think someone said, maybe Joel said, like, the 6 feet's been drummed into us, right? But it may not be the make or break piece on this. So I would encourage the committee to consider the all-in hybrid elementary, even if it's just a beginning piece. And you may want to set you know, time limit on that. You know, it's like the way we begin school and then we back off. And we can go to the split day, you know, the 50-50 hybrid, and then if necessary, go to the remote. So the committee may want to consider that.
Joel? So one of the things I'm struggling with is how to reconcile, you know, the conflicting information, what sounds like conflicting information that we're getting from a number of fronts. And, you know, again, distancing is important, but, you know, maybe it's outweighed by the benefits of non-COVID related benefits by shrinking down to 3 feet. It's been a really hard time reconciling, which just seems to be information coming at us from both sides that don't seem to line up with each other, and trying to figure out where the truth of it all lies, And also, we as a district, I'm confused, so we started this conversation off, and we've continued to talk about rates of transmission being this guiding principle, right? And yesterday, at the 11th hour, Governor Baker and DESE put out this new guidance. And then, we're in the green, but, our two neighbors to the west, Manchester and Essex, are in the clear, and they went full remote. Rockport to the east is in the clear, and all signs point that they're going full remote also. And so here we are in the same neighborhood with a higher transmission rate, and we're hearing admin fighting for only 3 feet of separation, where our neighbors who have lower transmission rates are saying, we're still going remote. And so I'm trying to figure out, what do we know that they don't, or what do they know that we don't? It's just, there's a lot of conflicting information here, and we just seem so far from what our immediate neighbors are doing that I'm really kind of struck here.
Can I just intervene and say, we have to vote a plan tonight. We're not voting which one we're doing right now. We're just voting which one of the hybrid plans we're going to send to DESE. So I just want to keep
we
that
are
conversation
voting our
in
preference.
check.
We're supposed to vote
Right now?
Yeah.
I thought we had to vote what plans we're sending to DESE. And I'm trying to eliminate
We have to
one
vote
of the
that too.
hybrids.
The voting our preference is the critical vote.
Right, but we also have to vote which plan we're sending to DESE, and we have 2 elementary plans to choose from.
Exactly.
So I'm asking to take one of them off the table
And
so
there's
that
a
we
motion
know
on the
which
table to
hybrid.
take one off, and then we'd still have to vote the other one.
But I guess what I'm saying is that, I still can't figure out, is this crowding really an issue? All I kept hearing tonight was that the community transmission rates are what's really driving this, and that, yes, these other things pile up and help, Karen said being 1 foot is better than no feet, 3 is better than 1, 6 is better than 3, and staying home is better than all of them. But, she couldn't, and I'm not blaming her for not being able to, she couldn't quantify what that 3 to 6 does. And as I alluded to earlier, we've been kind of beaten over the head with 6 feet is this, magic number. And I just don't know, how to weigh it against all the other benefits. Again, I'm not saying I'm supporting a hybrid plan, period, but of the hybrid plans, there was, so many more benefits from the 4 hours a day, 5 days a week, balancing that against this 3 to 6 difference. I just don't know. I don't know what 3 to 6 is worth still to tell you whether or not it's justifiable to eliminate the rest of the benefits.
I let the committee deliberate. I want to just answer Melissa's question. In terms of when we submit, we do have to name what we are prefer in terms of what we're heading towards with the opening. What's our opening plan? So we have to submit all 3, as I said, but you have to also name.
Wait, what did you just say? I just need to be clear because you're confusing me now. So it's my understanding, and tell me if I'm wrong, that we have to vote a plan for hybrid, a plan for remote, and then what we're doing.
Yeah,
So I'm just trying to figure out which hybrid plan we're going to put forward to the elementary because we have 2 before us. So I'm just trying to eliminate something, take something off the table at 12:30 at night when we need to progress. In other words, it's 2 plans. My vote is to remove one of them, meaning the other one will be the plan to go forward for the hybrid for elementary. That's all I'm trying to accomplish by this vote. I know we have to have a conversation on which plan we want to do actually, but right now I'm just trying to eliminate one of the plans not put forward to DESE.
But if we don't put forward a plan to DESE, then we can turn around and still do that plan? I mean, is that what you're saying? No. So we're not in agreement. What I'm hearing is that, like, I share Joel's difficulty.
Okay, so that's why we vote. So I'm just going to move the vote then. I mean, if it's no, then it's no. Then we know that this one's staying in and the other one's not. So we just have to make a decision is all I'm saying.
Joel,
So on that, again, not making a decision of whether a hybrid or a remote is the way to go. It just seems like in for a penny, in for a pound on the hybrid. If we're going to go hybrid, we're making a decision in general that we're weighing COVID risks against other ancillary risks to the student and teacher population by not being in the building.
Jonathan, I have to interrupt here and move this vote because I'm not doing anything other than trying to figure out which plan to eliminate to put forward, not if we're going remote or not if we're doing hybrid or not. And that's what Joel's conversation is right now. All I'm trying to say is we have two plans before us for a hybrid for elementary. Which one are we going to put forward? Not which one are we going to do, because we may decide not to do hybrid.
All right.
But which plan are we putting forward?
It's 12:30.
So I want to move the vote. We have to move the vote when someone calls move the vote. And I don't mean that disrespectfully. I just think we have to start taking steps here. It's 12:30 at night.
What we should have been was voting on a preferred plan, but not as opposed to going backwards and eliminating.
Well, that's a different conversation in my mind.
All right. You want to move the vote? The motion is to eliminate the all-in plus one elementary option, and we're going to close discussion.
I'm not comfortable closing discussion without having one.
We just got started.
All right, then we're going to. Then I'm going to call. All right.
Just talk about what the vote is, not what we're going to put forward to tell parents.
If we eliminate it, then this is not an option.
It's 12:30. I'm calling for a vote to continue the meeting.
So moved.
Second.
All right. Maria, roll call vote.
Mayor Taken.
I have a question. Since it's already the next day, we don't have to post we're continuing a meeting because we keep continuing it. Why can't we just say we're going to
take an
continue
8-hour recess?
4 hours or another 8 hours? Because you know what? This is not going to happen tonight because I haven't even gave you half of my shit that I want to say for crying out loud. I've been fighting for 8 hours, went through 3 bags of chips, 3 espressos and everything else, listening to you and trying to be calm that I said this should have been done a hell of a long time ago. I should have been on the damn committee, but you didn't want it. I've been on every Zoom, every governor, everything with the money and everything else. And now you're all fighting about 3-6, 4-6. But yet, not one of you, except one of the principals, have even had concerns that pathways. Oh, is it all right for the low income children to go to pathways? They've been already existing. They've been in school. So it's okay to say you're underserved, underprivileged children because their parents are working or DCF put them there or et cetera. It's okay to be in school. Not one of you had a concern when pathway children are going to pathways right now. Did anyone ask, or anyone ask, can we take a look at them? Can we go there? And did anyone ask, okay, let's see what's happening. So all of you's been invited to how many damn Zooms? How many times I've sent it and said it, there are Zooms, there are meetings, there's some, Ben's been coming to all of them, all of these different things. Then you send out all these emails about some guy in New York. Then you put it into political bullshit because it's the Republicans want it this way or this one wants it this way. For the record, I am unenrolled. I care about humans only. I care about the whole city. Of course, I care about the teachers and their grandparents and everyone else. I've got 2 grandkids going in there, and I sent my daughter away from Florida. My daughter wanted to come here. I was so scared too, just like the rest of you, and I said, absolutely not. I had to tell my granddaughter, you're not allowed in my house. How do you think I feel right now? So right now, whether it's 3, 6 feet, whatever, if parents are not going to follow rules, they're not going to follow rules. If they are going to participate, we need everyone's support to participate. Because if you don't forget, and I will never, some of your teachers were backstabbing. They started texting people, breaking HIPAA and saying there was someone already in school with the COVID when we were in school still. Because we weren't ready to shut down the schools, they put the fear of God. Now, if our teachers are not going to be behind us, and if we're not going to be doing this 100%, even if we get to school, someone's going to start something. And you know what? They're going to start a lot. This is not happening. I can't breathe. That window don't open. That don't open. What we should do is say, do we want these children to go back to school? If we do, you pick one. Send it to the damn governor, whatever you want to do, because we have a right to change by Board of Health. Let's get the damn quality of the air back. Let's get everything that we're supposed to get back, because then we'll have time to look at the quality of the air, find out what Mitsubishi or whatever, or Siemens or whatever the hell he's going to put into the schools and what we can do, and then figure out if the quality of the air. So maybe we should start a sample and have maybe 6 adults sit in there or 11 adults instead of children to find out the quality of the air with mask on, if it's going to be working or not. Because we're going to be staying like this for the next 3 weeks, because we're all going to argue. Because half of you already have your minds made up from before. You're listening to emails. While I'm watching all of you, you're texting one another. You black out, come in, look each other and laugh. You know what? I've been up since yesterday morning like the rest of you. I have a 7:15 call, and I've been on Zooms 24/7, people. We need to get our act together. If we don't do this together, we already failed. Thank you.
What was your vote?
I'll extend.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
Kathy Clancy,
Yes.
Mr. Favazza,
Yes.
Chairman Pope,
Yes.
Ms. Prince.
Yes.
So the mayor had a good point. Are we able to take an extended recess? Is that like if the Zoom meeting keeps running in the background, are we allowed to, recess for?
I've never been in this situation before.
Do you want me to read the policy? Do you want me to read the policy again?
Guess what? Policy don't count. We're in a state of emergency. We're in COVID. This mayor and the board of health make the rules. I just did.
Well, it would have to be unanimous or it doesn't happen. And I can tell you, I'm not voting to put this off because I have to be to work in 7 hours and I'm going to work in 7 hours. And anything to show that this is a delay to me is a tactic. We're here. We have 282 people still online waiting for us to make a decision. And we can't even decide whether or not we're going to remove one elementary plan or not. Think about that. All I'm doing is putting it on the table for discussion. If the vote is no, it's no. That means the majority of us wants that plan. I don't care what it is, but we need to start taking votes.
But I have to tell you something. How can we even do that? First of all, I never even heard anyone's questions, okay? If you do, let's say, the hybrid one, and the kids are going to school, and you happen to do that. Okay, so you do half a day, 4 hours. Okay, every day, 4 hours. Did we figure out the buses? Did we figure out parents who have to work, and are they going to pick up the ones who drop off their kids, how they're going to pick up their kids? Have we even did that? The survey that you guys all did was about a hybrid plan, okay? And it was a different hybrid plan. So I'm kind of, you know what? I want my kids, this is what I want, because I'm going to tell you honestly, something has to happen. These children who were excelling in your schools, okay? So let's talk about mental health. If you give me, can I have my 5 minutes now? Because you guys had a whole night. Let's talk about the mental health issues, okay? The mental health issues. We've had children that were great students, excelled amazingly. And now some are suicidal. Okay? Some don't even know how to exist anymore. Some that were champions at everything you were going, 5th grade, going great, are now throwing things, taking tantrums. It was terrible until the summer came and they got to go out a little bit. So we are now setting up all of this mental health, one of these calls. As you know, before we even started, the biggest goal that I was working on, okay, was trying to get children's therapists. Out of 1,200 registered therapists who are juvenile therapists, 900 didn't take any insurance at all. And you all know that. We had everything and we're ready to go to start Children, Friends, and Families, to open a place right at the Browns Mall. Everything was going great. Now we have, and Jamie Marshall said I can name him and mention him all the time, all the troubles with his son, and you all know that, and we all
Mr. Chair, point of order. It's 12:37. There was a motion by Melissa, and we need to have discussion on her motion. Well,
yeah, it is discussing on the motion. We haven't finished half of the stuff. You haven't took on that stuff about how you getting these kids to school. What's going to happen on the
So again, if it's discussion on the motion, I was midway through my piece when we voted to extend, and that's how this got started. If we're going to return to the motion and discussion on the motion, I was
fine. Then I'll wait till you discuss in the motion, because I'm going to discuss.
Okay, Joel, continue on.
Thank you. So again, on the motion, whether to remove the hybrid plan that involves everyone there every day, again, not to pick hybrid versus remote, just to remove one of the two hybrids. That's the motion, correct, Melissa? Just to remove one of the two hybrids. I feel like if we're going to have a hybrid option to then decide whether we want to go hybrid or remote, the hybrid option we should put forward should be the one that, that the administration has been putting forward, which would be the one you're trying to remove. And so I'm going to vote against this. I would rather keep the one that the administration is pushing as the hybrid that we'll debate whether we want to go hybrid or not. And then we can have that conversation later. But I'd rather not eliminate the hybrid option the administration wants. We have to put forward a hybrid option.
I know that I put this motion forward just to make a decision. That's it. Because no matter if it's yes or no, that makes the decision right there in my mind. Because if you're voting yes, that means you want it. Or I mean, if you're voting no, that means you want the 3 feet. And if you vote yes, you want the 6. Or
Samantha.
No, the opposite.
So I agree with what Melissa said, that we need to reconcile the concerns of staff and some of the parents that emailed, right? We got a lot of emails that talked about feeling more comfortable with the 6 feet distancing versus the 3 feet distancing. And if we're asked to make a decision based on public input, we need to consider that. So there's that piece. In addition to that, I think that if we don't do the remote model in the right way, in relation to safety regarding COVID, we're going to go remote faster, which means we're going to have less eyes.
Did you mean hybrid? If we didn't do hybrid the right way?
Yes,
okay.
Thank you, sir.
All right, sorry, I didn't mean to
the right
interrupt.
way. We're going to go to remote quicker, which means we're going to have less eyes on the highest need kids in this district. And this is just my opinion. If we do the AB model, I would like to consider extending the definition of high needs, because there's definitely a lot of kids who are going to be safer in our buildings than at home. So I think there's, again, back to the not thinking either or, but and in both, right? We need to think about this creatively, and there's definitely kids that should be there, the 4 or 5 days a week that we're allowing high need students to be there. So did I say what I was going to do? I vote yes to eliminating that.
Which one are we eliminating?
So I'm going to vote no on this because I've seen the rooms, and I know that we know there's going to be parents that are going to choose home, remote only. And I think the distance may not be 6, but it might be 5. And, I appreciate the advice of our Board of Health director or our health director. And I think all the kids should have the opportunity to be in school every day. And I just don't think the 2 days a week is enough at that age.
Any other discussion before we vote? So the motion is to eliminate the all-in +1 of the elementary plan. Maria, can we have a roll call vote?
Wait, can I ask one thing before we vote?
Go ahead.
I just want to be clear about something. We are voting. We will put what we vote forward to the state. We've talked in many ways about changing that based on health data, changing what we actually do based on health data coming up. I just want to really understand, how binding is this? How binding is this? If we're already talking about adjusting it 2 weeks in, I just want to understand if we're throwing this away if we vote against it, or if we're, I just want to understand a little better. Yes.
Should I answer that?
Yeah, please, Ben.
At this point, we need a preferred plan so we can do all the operational planning that is waiting upon this decision.
Okay.
So, what we need to know tonight is hybrid versus remote, really not, versus all in, which we know full in person is not an option. So, but we need to know hybrid versus remote, and then we need to plan for that to open. Now you could go from, and I've said this before, if you select hybrid tonight and then the health indicators get worse, we can go to remote before school starts. And we would do that because that's the safe thing to do. But we can't there are vast differences in terms of planning operationally between the split A/B hybrid and the for elementary and the all-in plus one, and they're just very different. And
Yep.
so,
Okay.
Melissa?
Contribute a little bit more for consideration. Like I said, I'm not saying that this is the best for kids, but the fact that we're even discussing a hybrid plan is a big step, considering that a majority of the teachers don't even want to come back in the classroom. I think if you take the opportunity to talk to teachers, they're going to feel a hell of a lot more comfortable with 10 kids in their class than they are 20. And if we don't have buy-in from the teachers to get them in the classroom, guess what? There's your answer no matter what we vote. So this, to me, is a compromise. Decisions are made on compromise. You can't go in and say it's my way or the highway. That's where I'm at with this vote too. And just know that. We have to respect the staff that has concerns and the concerns that come along with the staff. So to me, it's a compromise. We can always change. I bet the state isn't going to hold us accountable. If the data is great and there's no more COVID, they're not going to tell you can't go to a different hybrid form.
Just to that point, I think we heard tonight from one of the administrators that the A/B hybrid plan is the most taxing on the teachers. The most difficult on the teachers is the A/B plan, and the all-in plus one is easier on the staff than this. Just putting that out there as information we heard tonight.
Okay. Any further discussion? The motion is to eliminate.
I have a discussion, right. Joel, on this one, we don't agree, but that's what the teacher said, because I can plan accordingly. People who work can plan accordingly. It's very difficult. My concern is the children. One way or the other, I do not, and I'm going to say personally, which way you all want to choose is fine. I will go with you. I have to have students in school. Let me tell you why. Because they need to meet the teachers. You know what? Someone says, well, what's 2 weeks? 2 weeks is a student meeting a teacher, whether you do it 2 days or all days, whatever's best for the teachers and whatever's best that we have for the schools and planning for the parents is fine. The children need to go into school. No matter which one we choose tonight, it has to be either one of the hybrids. They have to be in school, even if it's a little while, because right now you still have outside. You can be able to still go outside. You still can be able to open windows if you can. You still can be able to do alternatives. You still be able to, because once it gets cold and if the number starts going up, we are now 100% remote. Now, if you look at why the other schools didn't, I asked the other schools, I talked to the schools. Now, I don't know where all our teachers are, and I'm sorry if the teachers are there and they're saying, well, you should know where we all come from. Most of the schools that chose not to go is because Rockport and Essex and all them, most of their teachers are from the high-risk cities. That's why, Joel. I asked all that questions today. If you all want to know something, Salem now stopped. They're doing remote because they just got more COVID. They voted to do the hybrid. They submitted it, but cannot no more because now they're out of the green. They went into the red. That could happen, Laura. So it doesn't mean if we choose a hybrid that we have to go hybrid. It's all about the numbers and also all about the quality of the air. So while we were talking, I did text some of the people in the State House and et cetera and say, you know what? What happens if we have to put Mitsubishis in every single room or whatever they're called in everything's rooms? Is there funding? Could we get funding? Can we get help? Will you get help? I mean, it's not going to be, 100% and everything else. Yes, we can get some assistance. Yeah. And I said, well, if it's going to take 4 to 6 weeks to get here, then what the hell are we doing? And we're going to see if we can even get it faster if we need it. So yes, that's why. I mean, we need to vote on one thing. It doesn't mean, Laura, that we have to commit it to it or not. And Samantha, you're right. These kids have to meet the teachers, the new ones. And then if we say in 2 weeks, you know what? Out we go. Then we work on the remote. But don't we have to have, and please, we're going to work on this one, but make sure we start these plans earlier, people. We need to make sure that we got something in plan for our remotes also. Thank you.
Okay, the motion is to eliminate the all-in plus one elementary plan. Maria, can we have a roll call vote?
Mayor Taken.
I'm going to say no.
Ms. Watson.
Yes.
Ms. Wiesen.
Yes.
Kathy Clancy,
No.
Mr. Favazza,
No.
Chairman Pope,
No.
and Ms. Prince.
You're muted.
You're muted.
I said my first failed vote in 13 years. I vote yes, but I understand. Like I said, it's a discussion item. I just
Once
never put a
again,
vote
we're
forward.
closing in on little time. I'm going to make a motion that we put forward as our preferred plan for the elementary, the all-in +1. Do we have a second?
So moved.
Okay, discussion.
Well, the discussion is we put this in, it doesn't mean it has to stay. We still have to work with the teachers. We have to work with the quality of the year. Don't forget, we can always go down. We can always go down. Don't sit, we're not stuck into it. We just got to propose something, and then we got to work really hard together and get what we need. And you know what? God forbid, it might happen that we won't be able to because of the quality of the year or something else. I'm not hoping that the numbers go up. I'm hoping that, you know what, things can change, but we might not be able to. And the fact is, if we have 3 schools, so look at your hybrid 2. You have 3 schools. Well, if you're going to have 2 days, why can't we just use the 3 schools? We don't know. We haven't thought about anything. Use the 3 schools for the elementary, middle, and high school. Have the high schools can do mostly remote. We don't know. We haven't worked out. Let's submit something and then really work together.
Any further discussion?
Clarification on the vote. Are you saying this is the plan we're going to put forward to the DESE, or is this what we're putting forward to tell the community this is what we're doing?
This is the motion, is that this will be our preferred plan for the elementary grade level, and it will be the all-in +1.
Thank you.
Is there any further discussion? Maria, roll call vote.
Mayor Taken,
Yes.
Ms. Watson,
No.
Ms. Gleason. No. Kathy Clancy,
Yes.
Mr. Favazza,
Yes.
Chairman Pope,
Yes,
and Ms. Prince.
No.
it carries 4-3. I will now entertain a vote that we put in for the preschool, the preferred plan by the administration. I'm trying to remember what the name of it was, but it was full in.
For
Correct?
O'Malley?
No,
No.
for preschool.
Second.
Okay, is there any further discussion? All right. Seeing none, Maria, roll call vote.
Mayor Taken,
That's a tough one. For discussion, yes.
Ms. Watson,
Yes.
Ms. Gleason,
Yes.
Kathy Clancy,
Yes.
Mr. Favazza,
No.
Chairman Pope,
Yes,
and Ms. Prince.
Yes.
it carries 6-1, and that will be the preferred plan for the preschool. I'm now going to make a motion that for the middle school, we put forward as our preferred plan, and I'm trying to remember the names, I don't see them, but it was the
Full-in hybrid? The
the
4 to 5
full-in
days?
hybrid.
4 days?
The-
Full-in hybrid. I second that motion.
Okay, is there any discussion?
I just want to say I just want to applaud the middle school for being creative and really taking advantage of their space and being able to serve as many kids as we have.
Joel?
So the plan, I thought this was gonna be the one that I was gonna have the easiest time voting for from a spatial stance. And then I didn't realize what I didn't realize until tonight was that it's 80-person pods, and that's a lot of exposure. And I'd be interested to hear what my colleagues think about this 80-person pod, especially those who just voted down 20-person pods essentially at the elementary level.
Melissa.
Response to that is that I wish this plan is what we could do for the elementary school because it gets the most kids in and they're 6 feet apart. And that's the only reason why I put that motion forward before. I don't think young kids should be 3 feet apart. O'Malley, they're able to get the most kids in for the most amount of days with 6 feet apart, and that's why I support this. Not pods, not exposures, because then you can go back to your argument that you just made why you voted the other one the way you did. So to me, it's all about distance, safe distance, social distancing, wearing masks, and getting as many kids in school as possible.
And it can be changed. It's not, this is something we're submitting. This is something submitted. We're trying. It's not like it's etched in stone. It's not like it, you know what? Don't forget, we still got to first talk to the teachers. We've got to figure out what's going on. You got to figure out what the parents, you got to figure out what's the quality of the year. You got to figure out what the Board of Health says. By that time, September 15th, God help us. Let's hope everything's cleared and it's good. But you know what? Let's just do what we need to do, work on the process and work on a backup plan.
Any further discussion on the motion for the middle school? Samantha.
So I feel a little similarly to Joel. I thought that this was going to be an easier one for me. I applaud the creativity in the use of space and the ability to get 6 foot distancing between the students. I do worry about that number of students changing classrooms and interacting with each other, and then potentially, leaving the school day early and being unaccounted for. So I think where the piece that I feel better about the older kids is that I think more parents will likely make a decision to go remote because of that flexibility and the ability for older students to handle that. And so I'm hoping that reduces the number. And when the chips fall, we're looking at a reduced number in the building. Because I do think that the benefits to having that age group in the building is really important to consider. So I will support that, but I hope that parents really consider their options.
Listen.
I just have a question, I'm not deliberating. I just have a question about the plan because I want to be sure that I'm clear on it based on what Sam said. So I'm assuming this is the model where they go to school, then they go home, have lunch, and then have another hour of remote learning. Am I correct in that assumption? Yeah, so the kids are going home after school, and that's what they're doing after school. They're going home. So I just want, because I share your concern. I share your concern, Sam, and I just want to make sure I knew they were going home because they have to jump on Zoom for another hour.
Well, and is that true, or is it asynchronous for the hour?
I mean, it's asynchronous.
So they could do their hour at 7 o'clock at night if they wanted to.
That's true. And they can do it at home. We're hoping to get these remote learning, centers or pods open as well. So in addition to home, folks hopefully will have that option as well. Yeah.
And again, those logistics I think can be figured out after the fact. I'm just trying to state what my concerns are with that age group and the risks to them being sort of unsupervised for longer periods of time.
Thank you, Sam. I'm saying the same thing. I didn't realize the pods, but.
Yeah, so anyway, I mean, I think there's solutions there, but I think it's worth having the discussion.
Can we require that they do the hour an hour after they get out of school?
I don't know what you mean exactly. Can we require?
So instead of just saying it's increments, they can do it 7 o'clock at night. Can we say that our plan is they're going to be home and at 1:30 or whatever time is adequate, they're going to be online doing it then? That way we know they're going home?
I mean, we can require them to do the work. We can keep track of it. If they completion of the work, we'll grade the work. Okay. Depending how teachers do it, they can, if you're doing it online, maybe it's possible to get a timestamp on that. I don't know, Lynn, if you want to add anything to this. It's similar in except for live sessions in remote learning. So if you think about the remote, full remote or any part of hybrid, except for when folks are doing the live in-person teaching with a teacher, with an instructor, all the other parts of remote, synchronous project work, computer-based work are the same situation. Kids can actually do that at different times in the actual school day, except when they're scheduled to be with a teacher. I'm sorry, that's not being coherent. Lynn, anything?
Yeah, we will recommend, and not just recommend, but it will be scheduled during time slots, which it's right. Not required, because once kids leave, we couldn't necessarily require them, but it's intended, and that's how it will be communicated, and it's on the schedule, even blocked out, that this is the block of time you use for the one subject, and this is the block of time used for the second subject, so that it really does tighten it up that way. But their being at home allows flexibility that some families may need as well.
Any further discussion? Laura.
I just want to say also that I think it's really a very interesting creative plan. And I also think that while the houses are big, they're keeping smaller, classrooms are smaller. So I too am struggling with all this, but they're 6 feet apart in smaller classrooms. Unfortunately, cohorts are mixing, but there are concerns and there are benefits from what I can see.
Jonathan, can I ask one more process question to Lynn? I didn't realize Lynn was still here.
Go ahead.
So O'Malley is set up and designed in little pod areas. They're each, you have the main area, and then you have the hallways that go off to the side. When the kids are going from class to class, are they going up the stairs, down the stairs, through the, what do they call it? What's the big room in the middle?
The commons.
The commons.
Yeah.
Are they traveling through the commons, or are they staying in those pods, which is why O'Malley was designed the way that it is, so that they're not necessarily interacting?
Yeah, they only travel to get to some of their specialist classes. So one of the things we've been working on is designating bathrooms to the houses and travel patterns to the houses, so that they will continue to be in the 6 feet apart as they travel through. So it's, between each period, each block of time, there will be a class from each house who has to potentially go either somewhere else on the floor they're on, or down to the lower floor for their specialist class.
So one class, so not everybody, I'm trying to
No,
figure it out in my head.
most of the classes will stay in the house, but the specialist class is located outside of the house.
So it's only specialist class that they'll be traveling through the commons and up and down the stairs?
Yes.
Other than that, they're staying in their little wings off the side of the commons. So they're not interacting with the rest of the school. Okay.
No.
Thank you.
Any further discussion? Okay, so the motion is to approve the preferred plan, the administration's preferred plan for O'Malley Innovation Middle School. And roll call vote, Maria.
Mayor Taken.
Yes.
Ms. Watson.
Yes.
Ms. Wiesen.
Yes.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
No.
Chairman Pope.
Yes.
And Ms. Prince.
Yes.
It carries 6-1. I'm going to make a motion that we put forward as our preferred plan for Gloucester High School. And once again, I don't have the name of it exactly, but the hybrid plan where the students, that's recommended by the administration, and I so move.
Called split day.
Split day, okay.
Second.
Okay, discussion. Laura.
So I don't have the details in front of me, but again, this is another plan where we're back down to 3 feet. I'm just, again, I remain concerned about that, and wondering, just wondering if there's anything to be done about that. I know this is a late hour to be asking that question, but it's still, I'm stuck on the 6 feet.
I think they're both 3 feet.
You're muted, Ben.
Yeah, they are both.
Yeah, I think that
Wait, Ben is speaking.
that there's variation in the class sizes immensely at the high school because of the different subjects, and that we're talking about worst case scenario when we're talking about the 3 feet. But the other thing to keep in mind is that there's a lot of space at the high school. There's a field house, there's a cafeteria, there's an auditorium. And maybe they can, the reason we're putting forward these preferred plans is so that the administration can move forward with trying to actually figure out how to put them in place. So, Joel.
So the two conflicting things I'm thinking about on this one are, on the one hand, these are our oldest students. So theoretically, they have the maturity, I appreciate they're still children, but they have the maturity and the self-control, arguably, more so than their peers at the other levels, to maintain mask protocol, maintain social distance protocol, maintain just like safe sneezing and coughing protocol. On the flip side, because they are also the oldest and theoretically most mature and independent students, they are probably the ones who could, handle remote. They don't need to have a parent home with them. They don't need to have a parent sitting with them. They don't need help, accessing digital information. If you look across the country right now, or even across the Commonwealth, colleges, even colleges that up until 2 or 3 weeks ago thought they were bringing their students back, but in the last 2 or 3 weeks have all just kind of one by one said, actually, you know what, don't come back. Maybe we'll see you after the holidays, but we just don't feel safe for you, coming back. And part of their decision, despite the fact they lose money by not having these students come back, is that population, which is older than high school but closer, is able to have some independence and have some ability to tackle a remote curriculum. And that may be the same thing here. Maybe the high school kids can handle remote curriculum, but also maybe they can handle 3 feet because they'll be safest. I really don't know.
Melissa?
I'm just going to say I'm going to support this motion. I think older kids sitting in chairs is socially distancing. My concern with the 3 feet with the elementary was that kids may not sit in their chairs and stay there, especially the first and second and third graders. With high school kids, I have no concerns about them being told to sit in their chair and stay there. So while I don't like the 3 foot idea, we don't have a choice in this situation, but I truly believe that the students will sit in their chairs and act like the young adults that they are. And knowing that the kids want to come back to school, we talk to high school parents, they want their kids back in the school. We know it's good for their mental health. So I am going to support this motion for those reasons and probably 100 more that I can't think of right now.
Kathy.
I'm also going to support the motion. I want to also say that, at this age, if kids really are comfortable doing remote, they have the option to take that option. So that's why I think with high school kids, I've heard from so many of them that they want to be in school. And these are kids who have been working in our restaurants, and they've been sitting in lifeguard chairs, and they've been bagging groceries for all of us. And if they want to be back in school, I trust that they're going to appreciate every second being back in school, at least for a while.
Samantha?
So the one question that I'm curious if other people are thinking about this. So, based on the very little data that we have, what I've heard is that this age group possibly transmits the same rate as adults, whereas, we were sort of working under the assumption that there seems to be less risk from what we know for younger kids in transmitting. Plus, this age group can get just as sick as adults. So the 3 feet, that's where I have sort of I take pause with the 3 feet. And I do agree with Melissa that they might have the maturity, some of them might have the maturity to sit and adhere by some of the safety protocols. But again, I do worry that with that 3 feet, we're not also considering some of the other data, although it is limited. That is what we're sort of basing all of these plans on. That they are at risk and they are they can put the adults in the room possibly more at risk.
Melissa?
Just a question to Ben. Did Karen Carroll was aware of these plans? You know, have you had the discussions with her? Did she put her stamp of approval on the 3 feet distance, or did she raise the concern that maybe 3 feet is too close for high school students based on their age and their ability to do what they're doing with COVID?
I didn't ask her that specific question about this specific plan. You heard the most detailed explanations that any of us have gotten at this point tonight directly from her.
Okay, thank you.
Laura?
Sam, I was thinking about that. I mean, the numbers show that, you know, high school age are basically, you know, like adults as far as this transmission is concerned. And, but I take Kathy's point that, you know, they can choose fully remote. And we have gotten quite a bit of feedback from high school parents and high school students that they want to go, that they want to be there. You know, I think I'm still caught in the same thing. Transmission numbers are low right this second, and maybe we'll get a few weeks, maybe. You know, it's for this age group where they're, you know, they're making many decisions for themselves. It's just a very tricky, situation. I hope they would listen. I actually think high schoolers are less likely to obey because they're adults. I don't know. I think this is very tricky. But we have gotten a lot of feedback that they want to go back.
I'd like to speak too. My hand's up.
Okay.
But you just can't see it. Sorry, Samantha. I agree with them. I'm sorry, but the 3 feet's really bothering me. This is where it starts going. And I'm sorry, I'm not going to call kids, you know, all responsible, because they're not. Because we know with lifeguards, we know with the parties, we know with everything else. They probably think, well, we're not going to get it. If 3 feet is so close, though, I haven't seen you in a while. I'm going to kiss and hug, whatever. You know what? I'm very nervous. Like I said, they want to go back to school. They want to participate, especially the seniors. They don't want to lose out. I don't know how long they're going to be going, like you said, for 2 weeks. My really concern is I'm hoping that Mr. Cook, if you're still on here, that, you know, you can reassure that you have the, you know, the support of your teachers or who you talk to, that, you know what, I mean, I'm not going to say we're going to need to babysit, but you need to really stay on top and say, you know, especially in the hallways. I mean, if they are going to go to, you know, in and out, that's where we do all our communication. Come on. Even when we're at the market, we have masks on and you're supposed to walk one way, you know, as adults, oh, I forgot, and you end up going the other. This is the scary one. But like we said, we have to start somewhere, and then from starting in the beginning of school, and by the time that we finally get everything done, I'm sure it's going to be different. So I'm going to support it, but I'm not happy about it.
Samantha, and then Joel, then Melissa.
So again, you know, as with everything else, I'm supporting the hybrid options, but because we have the option of people choosing into remote, because I'm of the opinion that some kids need to be in school and some really need to stay home. We don't yet understand transmission in schools. Testing capacity is questionable. This age group is questionable in how it transmits. But the one thing that we do understand is that keeping group size low helps in mitigating risks. So I hope that parents really consider those options, because, you know, from what I'm understanding from teachers, the remote option, especially for this age group, can be robust. They've spent a lot of time thinking through this. It's not going to be like it was in the spring. They have significant more training. And, you know, I have all the trust in the world that our teachers will do right by the kids who choose remote. So I hope people take that seriously, because there are a lot of kids who need to be in our school buildings for safety reasons. You know, I'm looking at this particular age group in terms of equity and safety. And so, you know, I hope that people really consider their options carefully.
Joel?
So my concern is that after I said what I said and listened to the mayor, I started thinking, and the two instances that are coming to mind are this past spring. It was not an official school event. So the seniors did their normal senior parade, and it was their first chance to demonstrate their ability to live in a COVID society. And you saw mask-free cars with students from unrelated household, windows half rolled. Like the first chance they got, it was totally, mask protocol was gone, hugging, selfies. It was like, you would never know that pandemic was happening the way the senior class looked during that, not all of it, but most of the senior class looked during that parade. Secondly, we just had a graduation. And on the one hand, the graduation ceremony itself, it was modified. Everyone behaved themselves. Everyone followed the protocol, even though it wasn't ideal. But then as I was walking out to the parking lot, again, boom, masks were off, arms around everybody, unrelated households, taking selfies, taking pictures. And so I'm curious to know what the school administration will be able to do if this hybrid is the way you go to make sure that this kind of when no one's looking or when the cameras turn off, that it doesn't just descend into total I don't know, the chaos essentially.
Melissa.
So, three things. I know the 3 feet thing is an issue, but I did ask James the question. He said the majority of the classes will be around 10, 12 kids. They're smaller, not bigger. So that makes me feel comfortable as far as transmission and being close to each other, because I have to believe that the majority, and James Cook did say the majority of the classes, they probably will be able to be at least 5 feet away. And I think the superintendent mentioned that earlier today. A big concern of mine is the dropout rate. Kids going to school, they're being accountable by their teachers. Kids showing up online whenever they want to at that age is very, very vulnerable. And we all know we have attendance issues at the high school. And we've had dropout problems in the past. I don't know what the rate was last year, but I think we're above the state average, if I remember correctly. And finally, I think if we don't choose a hybrid plan, you're telling parents you have no choice but to do remote. And I am a firm believer that parents have a right to educate their kids whatever they want, and they should at least have an option to do it, and let the parents decide if it's the best option for their child, not us telling them, no, you can't have it. So that's why I'm going to support this motion.
Kathy.
Yeah, just real quick, I agree with what Melissa said. I also, remember a scary headline from the Globe last week where parents are choosing private schools. And we cannot, lose families to private schools, and a lot of our families have that choice. So I think it's important. And I think, James is still on the line with us, and I'm sure as we said, we need to pick a plan and have them see how it operationalizes and see how the numbers come. And hopefully, can be creative about how things get assigned throughout the building to give us all better comfort that there's plenty of space from a health perspective.
Okay, Joel.
Ben, I don't know if you have the answer for this, but so to Melissa's point about parents and to a degree the students getting to kind of choose their own destiny and deciding whether or not they would feel more comfortable at home, what is in place for staff and teachers to make a similar choice? The same way that parent might say, you know what, I appreciate these schools need to be open. I appreciate some people want to send their kid. I don't think it's safe. I'm not sending my kid, or kids say, I don't think it's safe, I'm not going. What availability does the staff or the teachers required to be in that building have to make the same choice for themselves to say, yeah, listen, good for you. I hope it goes well. I'm not comfortable, so I'm going to, work remote.
Sure. So just like for staff and families, depending where the ultimate decisions are tonight, we have to then follow up quickly, hopefully by the end of this week, certainly by Monday, to communicate with folks at these types of decisions or interests. I mean, really decisions from this family's standpoint. In terms of staff, they'll have options that are in the contract right now around leave. There are also some other aspects related to COVID, legislation that has been passed. Some of that has to be, is likely to be part of negotiations. So, so that's not set yet, because if it's part of negotiations, that'll set it. So that's got to be probably part of negotiations. But we expect to, what we've been planning for and are expecting is that we have very few at this point staff members talk about, request leaves, but we do expect that some will. Some may request just to be in remote. And we will need a bunch of those folks. We don't know if we'll need all those folks. But there are a variety of leaves that are in our collective bargaining agreement now, and we may have to negotiate some adjustments to those.
I guess I would just hope that we as a committee would remember some of this, free choice guidance that we're using to guide our decision, to give us opportunity for families to extend the same choice to the best of our ability to the other adults who are going to be impacted in that building by, this less than perfect solution.
I echo that, Joel.
Okay, is there any further discussion?
Do we have to extend the meeting?
Well, we have a motion in front of us. We can take that vote, and at that point, we will have made all our preferred choices. And I think because there's no other options on the all remote or the all in possibilities, then I think we can adjourn. And there is a motion on the table, which I'm going to call for the vote now, and then we'll call for a.
All right, I just got an email, so I know we have still a lot of people here. I'm working on getting us a testing site in Gloucester. I just talked to the corporation from CVS with another doctor, and he just emailed me back. They are working on it to see if maybe one of the CVSs here locally can open up or another facility. Also working with some of the urgent cares in Beverly. We have some connections to, if we needed to have the urgent care come here, if we had, like, let's say a pod, God forbid, but we have that opportunities like we do for the homeless, like we do for everyone else. We're very unique. I want people to understand, this is the most difficult decision. This has never been an easy decision on anyone here. Anyone that's still out there remotely, and everyone needs to know, this is a decision that we're making that has never been planned in all of history. All of us are going through the traumatic mayors, school committee, city council, everyone that what's happening. I've always said COVID and comfort book, but this is the most crucial one. This morning we went mayors, Ben was allowed to come on, and so wasn't Karen, and we talked about opening schools and what we need to do. We actually all had the same concerns. Who started with hybrids, who's going to do this, maybe this, but we're all going to meet again because we know it's going to change. We all know it's going to change. We're putting something through because this is the most difficult decision, because we have now all the lives in our hands and the decisions that we made. It doesn't mean that these decisions have to be set. So when we decide, now that I'm wide awake, but when we do decide to go to sleep, we can sleep that we did the best we can. I'm hoping. Now, I wasn't on the reopening, so the reopening and the committee that was all there talked to teachers. You got all the emails. That I guess you have the bargaining. You talked to that. Ben, the principals all work together. The emails that we got. It's not that, we're not listening. It's what we're trying to do is to play it, not safe, but to play it for the children, like Samantha said. Some of them are better to be seen in school, see how they're doing, see what's going on emotionally, see how we can make that better. The children that are stable, God bless them, the parents, it's not easy. It's not easy when, you have people that are sick, or you have people that, grandparents, and we have a lot. Grandparents living at the house, what do we do? How are we going to do this and all of that? Please. Don't get angry. Don't get upset. We're going to work together. We're going to continue to work together. We're going to continue to listen to you. We're going to make sure that everyone is safe. I'm working on the vaccines as far as funding to get more help for us in the schools, to get what we need to get in the schools, to the quality of the air, your home health aides. Like, I suggested that. I don't want my nurses to do that. I know the screenings. I know we're trying to get more nurses now. So your nurses can continue to be the school nurses, and we will have all that. Rest assured that we will going to do the best we can, and we're trying to do it. And I'm not looking at, let's say, the budget, because your health is more important, the well-being of all of us, mentally and physically. It's not just you. It's not just the teachers. It's not the students. It's all of us. All of us that live in this community. And it scares me too, because like you said, Joel, Essex, all around, because we all interact with one another. But we need to put something forward so we can actually work on something. And then I'm only asking that when we do, that we immediately, and I know we have meetings this week, that we immediately work together to work for the best, to figure out once they're, let's say they do start the school and they see what's happening, we work on it immediately of what can happen. So when we do have to, if we do go remote, those children that need assistance more, we'll have a plan. Thank you.
Thank you. Is there any further discussion? So as a former superintendent, Christopher Farmer, always used to say, what we're voting on here is the least worst option. So we'll call for a vote. Maria?
Mayor Taken.
Of all people you had to mention, yes.
Watson.
Did you say me? I'm sorry, Maria.
Yes.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
Ms. Prince.
Yes.
Okay. It passes unanimously. Do we have a motion to adjourn?
No, we didn't vote what we're doing. We haven't voted what plan we're putting forward to do yet.
That's what we all just voted on.
We just
Every
did.
one of those votes was to put forward as a preferred plan. Every one of them. Maria, is that correct?
Oh,
Yes.
I'm okay with that. I just didn't know that that's what we were doing.
Okay, well,
I thought-
everybody's tired.
I thought we were saying what plan we were telling Desi we would do, because we had to submit 3 different types of plans, and then we were going to take a vote to decide which one we were going to move forward with. So I'm sorry. I mean, I'm okay with that.
Every time I made a
didn't
motion,
understand
it was to put forward as the
No,
preferred plan.
So Jonathan, procedurally, do we need to vote on the remote plans?
Well, there's no options. So my assumption
So those
is
are
that
the plans. Okay.
as the backup.
I vote to approve the remote plans to be submitted to Desi.
We can do that, fine. And
yes,
the remote and the all
Be in person and the full in person as presented.
Second. Is there any discussion? Maria, roll call vote.
Mayor Taken.
yes.
Ms. Watson.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
Ms. Prince.
Okay. Now, do we have a motion to adjourn?
So moved.
Can I have one more? I know, so move, but can I have a question? When are we going to talk about buses after? When is that? Next school committee?
Now that we've given the administration a direction to start working on the logistics, I expect a full report at our next meeting on how this is all going to work.
Okay. Thank you.
Just do want to add, just for the mayor's question, Adam Mayo is here, has been here all evening. He won't say anything right now because I don't want to prolong anything. But just so you know, he's been doing a fantastic job of looking at all the scenarios, looking at the questions related to different scenarios. He's done already, has made a lot of progress. And now that you've made decisions on the preferred plans, he can continue that work and nail it down. And so
Who was there? I'm sorry. Who was there?
Adam Mayo, our new transportation director.
Oh, I thought you said Ann Mayer. I'm going, what was I doing? Okay, thank you.
Adam Mayo has the picture, the fine looking gentleman in the suit and tie there.
Okay.
Here.
Thank you.
Yep.
Before, I don't want to adjourn. I want to do a vote for reconsideration.
Okay.
I don't want to come back Friday because somebody filed something to do this all over again. Sorry.
Second.
Okay, what we have, although we have a motion on the table to adjourn and a second, we will, I guess there must be some way we can put it off until after we have this vote.
They can withdraw their motion to adjourn.
I'll withdraw my motion to adjourn.
I second.
And what are we voting on? What's this?
To
The
rescind.
motion to reconsider. So in other words, if we vote yes, that means we're going to have this conversation over again. And if we vote no, the votes that we took tonight stand.
Are you moving to reconsider all votes related to preferred plans?
Yes.
Okay.
Thank you, Joe.
So
we're just saying that we can't vote on this again tomorrow.
basically, if every member who has a right to make a motion to reconsider if they voted in favor of a motion. You can't do it if you voted against it.
Okay.
And there's this time limit. But all they have to, it doesn't mean it has to come up with, the vote has to come up again within the next, I think it's 3 days or something, but they have to register that they want to reconsider. And then it has to come up at the next regular meeting.
Okay.
So that's what we're doing is we're reconsidering now. Or we're putting forward a motion to reconsider. If it gets voted down, then it can't be reconsidered. Okay, so that's what it is. So is there any discussion on the motion to reconsider? Maria, could we have a roll call vote?
You taken.
No.
Ms. Watson.
No.
Ms. Weason.
No.
Kathy Clancy.
No.
Mr. Favazza.
No.
Chairman Pope.
No.
And Ms. Prince.
No.
Now, do we have a motion to adjourn?
So moved. Yes. Goodbye.
Second.
Second. Maria, roll call vote.
You taken.
Yes. Good night, everyone. Thank you.
Night.
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 Watson.
Yes.
Ms. Weason.
Yes.
Kathy Clancy.
Yes.
Mr. Favazza.
Yes.
Chairman Pope.
Yes.
And Ms. Prince.
Yes. Good night, everybody. Thank you. Good
Good
work.
night.
Thank you, everyone, for hanging in there that is watching.
Yeah, for everyone who's watching. Thanks for being here.
Thank you for everyone. Thank you for all the input we've got. Thank you to all the administrations for providing the backup. Thanks to Mike Hale. Thanks to Karen Carroll. Thanks to everybody. And I hope everybody gets a good night's sleep tonight. Thank you very much. And this meeting
Good night. It's
is
morning.
adjourned.